Welcome to Adapt NCLEX. Welcome to your ultimate one-stop pharmacology review. If you have ever wished every single pharmacology topic was in one place, this is it. 6 hours, 230 questions, every system, every high yield NCLEX practice questions, answers, and review in detail based on the Pharm series that we did all together, one place. Let's get ready and study. This is your companion for your nursing school and the NCLEX in passing. Take care. Let's go. First question. As you can see, there's an EKG associated with the medication. I know you know it. Don't worry. Don't freak out. A nurse is caring for a client on a cardiac unit. After reviewing the ECG strip below, which prescribed medication is most likely responsible for the ECG abnormality observed by the nurse. The first thing you do is to go for the buzzword. They say responsibility from that medication is what is causing that EKG finding. That's all. All that they've said doesn't mean anything. What do you think? This EKG, if you read it, you can see this is what. You can stop the video and then answer the question and then you listen to me on how I approach it. I'll read the EKG, and the EKG look at what? Bradycardia. Therefore, if it's a bradycardia, I'm going to pick a prescription that is going to slow down my heart, right? And we're talking about cardiac medication. Then you start using a test-taking strategy. I know this is bradycardia because I can see the RR interval is too long. From here, 1, 2, 3, 4, 5, 6 is too long. 6 over what? 300 over 6 will give you 50. So this heart rate is low. Therefore, which medication causes that? There's a class of medication from cardiology that usually will slow down your heart rate. The most common one is the one that starts with the law. That's all. That's the one. Calcium channel blockage, that's that. But the one we start with the law is the beta blocker. I look at the answer choice and I see what? Spironolactone, it does not have law. Enalapril, this has pro at the end. This is ACE inhibitor. Bisoprolol. Even if I don't know the beginning of the words, the last 3 are okay. It's a law. I'm picking it. Bisphosphonate has no law at the end. Therefore, what is responsible for that? It's a beta blocker, slowing down the heart rate. So we'll be doing these NCLEX questions and answers in the detail. I'm giving you the detailed explanation so that you can figure out what is going on. You should take a note and everything that's said, or you can answer the question and see how I approach it. So the first one is what? Bisoprolol is what is responsible for this bradycardia. What is the next class of medication? The nurse is reviewing prescription for several clients receiving what? Lisinopril. Try to make it so challenging so that you can learn, because we're going to learn. It's a content NCLEX questions and answers with rationale, detailed rationale. So that's why I make the question like that. So we have lisinopril. It's a class of medication known as what? ACE inhibitor. They have their own side effect. Which of the following clients should the nurse question the prescription? What do you need to know? The next thing you need to know is what kind of class medication, what is the side effect? This is the name of those medications. The pro and the lisinopril. Lisinopril, the major side effect is called ACE, which is what? Angioedema, cough, and what? The E is basically electrolyte abnormality. There is another one, I, which is, I usually had it to is as teratogenic, right? So ACEI, which is the ACE inhibitor, are the side effect. How did they do their thing? Through the renin-angiotensin system, they end up increasing your potassium and therefore decreasing your sodium. And this is how they control your blood pressure, the renin-angiotensin system. In the process, the side effect is through the mechanism of the renin-angiotensin system. Therefore, what do you think? Stop the video, pick your answer. What do you think? The first one is what? ECG, right? HCG positive. HCG positivity means you're pregnant. Teratogenic means you cannot have it. The client with creatinine of 2.3, 2.3 will increase your potassium. These medication increases your potassium. Therefore, I should worry about it. A client with the blood pressure of 150/60, that means we're using this medication to control their blood pressure. This is okay. A client on what? Salt substitute. Salt substitute is potassium. That means you have too much potassium. We should question it. A client on what? Aliskiren. Aliskiren are renin inhibitors. They are the beginning of the renin-angiotensin system. You don't have to worry about the details, but know that they block renin before even lead to decrease in angiotensin 1. Therefore, in the process, they will decrease aldosterone, which is responsible for what? Your sodium. Since they are blocking all these pathways, they can lead to what? Hyperkalemia. Therefore, you should not take it. A client taking what? Triamcinolone is another class of medication. These are potassium sparing. Potassium sparing increases your potassium. Therefore, you should not take it. And as you can see, number one, the next question. Number two, the next question. Number four, the next question. Number five, the next question. Number six, the next question. Those are the patients that they should not take lisinopril. So that's a problem. So that's the next question. Next question. A client is being discharged on digoxin for heart failure. Which statement indicates the need for further teaching by the nurse? Digoxin is another class of heart failure medication, cardiac medication that function in three ways. They slow down your heart, they improve the contractility, and then they increase the rhythm of the heart, basically. And they can be used in different form, right? The specific side effect associated with them. Number one symptoms is GI symptoms. If you have GI symptoms, you are in trouble. The best way to remember them is to draw a caricature. I draw it like that. And I said, you start from your head, they have neurological problem. From neuro, your eyes is here. They have vision changes. And then your mouth is here, GI symptoms, that's number one. Then your heart, they have cardiac issues. And then your kidney. These are all the side effects to remember digoxin. Therefore, what is the problem? The client said what? I will inform my healthcare provider if I develop nausea. That's GI symptoms. That's a good thing. I will increase my potassium intake. Well, there's some electrolytes that can affect digoxin, right? Potassium, calcium, and magnesium. The low potassium causes digoxin toxicity. But people forget that if you increase your potassium, it's not the good thing. It's supposed to maintain it normal. Unless you're taking other medication that is decreasing your potassium, then you can increase it, but even bring it to normal. Saying I'm going to increase my potassium is a wrong thing. I will need drug level check frequently. Yes, because digoxin is very toxic with a narrow therapeutic index. I will check my epical pulse 1 minute before each medication. Yes, because when your heart rate is low, if your heart rate is less than 60 for adult, less than 70 for a child, and less than 90 for a neonate, we got to hold it. So for these patients, we need to check their epical pulse. This is the right information. Therefore, number two is the one we need further teaching. A nurse is preparing to administer metoprolol through a client. Which assessment finding will require the nurse to hold the medication? This is another medication we've seen. The last name law is a beta blocker. Their purpose is to slow down your heart. They decrease oxygen demand of the heart and they help you slow down. Therefore, when you're using it to answer the question, it's the main thing. Beta blockers, they slow you down. Temperature, 101.5 has nothing to do with slowing you down. Even though it's abnormal, Don't let that distract you. The blood pressure is 150/70, should not require you to hold the medication. Probably you may have to give it to you. Respiratory rate of 20 is fine, and a heart rate of 55, that is bradycardia. Therefore, we need to hold the medication for that. Next medication. A nurse is preparing a client for what? Discharge, who has been prescribed enalapril. We've seen it, lisinopril. The same thing. The class of medication is the most important, not the name. So if you know the class, start with the pill, and you know that they are all what? ACE inhibitors, then that's the key aspect of the thing. The side effect does not matter. The beginning of the medication name is the last name. Which teaching point should the nurse include? You know that they are what? ACE inhibitor. Therefore, you will write it down and say, this is their side effect, and I'm going to use it to answer the question. Rise slowly from a sitting and a laying position. What do you think? Yes, it causes orthostatic hypotension. Therefore, that one, we're going to pick it. This teaching is good. Add fish, avocado, strawberry, tomatoes to your diet. These are all potassium-rich food. You should avoid it, right? Take the medication with food to reduce stomach upset. You don't need to take it with food. That is a trap. Even though it's good in your test, it's a wrong answer. Therefore, this is wrong. You're telling me that it's required to take what? This medication with food. That's what the statement is saying. Check your pulse 1 full minute before the medication. This is not digoxin. His name is called enalapril. Expect increased urination when starting the medication. This is not the loop diuretic or diuretic. Therefore, I don't need this. Report a persistent dry cough to the healthcare provider. That's the C there. Yes, you need to do that. Go to the emergency department if jury suddenly feel too tight. If your jury cannot fit, they get tight, you get in what we call angioedema, and that is the A. Therefore, which teaching point should the nurse include? Rise slowly from the position, report persistent cough, and go to the emergency room. So 1, 6, 7. So far, how many have you got? Like I said, stop the video, answer the questions, and then you listen to me how I approach it. How many are you got so far? Put down in the comment and let me know how many you've got so far. We are on round 6. What is the next priority? Teaching for a client on bumetanide. This is another class of medication. They are diuretic. This specific one is a loop diuretic. Most diuretics are what? Sulfur drug. They causes photosensitivity. They causes dehydration. They causes hypokalemia. What do you think? The priority? Avoid sunlight. Photosensitivity is not the priority. The priority is what? Sulfur drug causing Stevens-Johnson syndrome. Second, hypokalemia. Increase fluid intake at night. You're going to pee. You're going to urinate all night. If you drink, you're not going to be sleeping. Change position slowly. It causes orthostatic hypotension. Take on an empty stomach. Most food should be taken with food, right? That's not even a priority. The priority is orthostatic hypotension. Therefore, number 3 is the best answer. So these are test-taking strategy, questions and answers with expect explanation, explaining it in detail so that you can, whenever you see it anywhere, you can answer that strategy to answer questions. So test-taking strategy, critical thinking, questions and answers using cardiac medication that you have to know, the top 5 class medication and what you need to know. And next, has provided discharge teaching to a client prescribed what? Verapamil. Verapamil, another class of medication. These are what we call calcium channel blockers. Which statements by the client indicate the need for further teaching? These medications, they look like beta block, they slow down your heart rate, but that is not the major function. Their major function, the detailed explanation on calcium channel blocker, they make your vein bigger, venodilator, they make your vessels bigger, and they keep fluid in the vessel. So when in the periphery, your leg, you get edema. In your face, you get flushing. In the process, that causes what? Hypotension and bradycardia. This is how they do their job. Therefore, based on that content, every time you see that vasodilation and then flushing, edema is common for this medication. Then they affect your heart. What do you need to know? They said you need further teaching. Which statement by the client indicate need for further teaching? There's certain things you need to know about these medications that NCLEX will ask you. I will avoid grapefruit juice while on this medication. I will check my blood pressure regularly. I will inform my ACP about my sildenafil. I may feel dizzy when standing too quickly. I don't need to report leg swelling unless it's painful. I need to check my pulse for 1 full minute before medication. What do you think? What are your answers? Put it down and let me know. Number 7, what do you think? Calcium channel blockers? What should you do? I will avoid grapefruit juice while on this medication. That's absolute. There's no need for further teaching. I will check my blood pressure regularly because it causes hypotension. I will inform my healthcare provider about sildenafil. Sildenafil is like Viagra. They are erectile dysfunction medication. They do the same thing as calcium channel blocker. It causes what? Venodilation. If you take both medication, you will have severe hypotension. So that is a good thing. Does not need further teaching. I may feel dizzy when I stand up too quickly. Orthostatic hypotension expected. I don't need to report leg edema unless it's painful. Leg edema is common, but you need to report it to the doctor so that they can adjust your medication. I need to check my pulse for 1 full minute before the medication. This is not the Jackson. Therefore, which one needs further teaching? 5 and 6. I know you got it. And you have 7 out of 7 right now. Next, medication. A nurse is caring for a client with what? Acute myocardial infarction, that's MI, who is receiving what? Atenolol. I don't know what this medication is, but we already discussed it. And we said what? It has a law at the end. Based on that, we've seen the beta blocker. Laws are beta blocker. And what they're going to do, going to slow down your heart. Which of the following findings indicate that the medication is effective? That means effective is working. What is going to happen? Blood pressure is 88/50. That's not what I want you to do. You have to drop your blood pressure too much. It's no more effective. That's critical thinking strategy, right? It's basically you not to be able to feel hypoglycemia in diabetic patient. Going up, it has nothing to do with it. Client reports no chest pain because it decreases oxygen demand for the heart. Therefore, that is good. It has done its job. Patient has a heart attack. Respiratory rate of 29, it means you having problem. That's not effective. If ventricular rate of 75 means he has dropped your heart rate. So that's good. So which one indicate effectiveness? 3 and 5. Once again, if you know, stop the video, answer it, then you can listen to me. That's how you benefit from it. And this is caring for a client with the history of asthma who has been prescribed terminal eye drops for glaucoma. Which of the following findings is most concerning and require immediate follow-up? Stop it. Go back. Look at it. I see glaucoma, but all I see was a medication name called this. It looked like something I've seen before. It has the law. Even though it's going to your eyes, it's a beta blocker. Which finding is most concerning? That means prioritization 101. I got to intervene. Something concerning. I give a patient beta blocker, it's going to slow my heart rate. But this patient, look, there's a buzzword here. He has asthma. Oh, you got to give them selective beta blocker. Otherwise, they're going to have a respiratory problem. Terminal is not the selective beta blocker. Selective beta blockers are the BAM, which is BAM. Bisoprolol, atenolol, metoprolol. This medication can affect your lungs now. Therefore, what do you think? You see, I answered the question based on the content, no even looking at the answer. Intraocular pressure is 18, it's less than 20. That's good. The medication is doing a job for glaucoma. Clients report mild higher irritation. That's the side effect of the medication. Clients' sentences are incomplete. He can't hold his breath. If you can't speak in full sentences, it means shortness of breath. If you see that statement in the question on the NCLEX nursing school, please pick it. That's respiratory failure issue. Heart rate of 65 because it's dropping your heart rate, but it's still no bradycardia. Therefore, which one is most important? Number 3 is good. That's what we have to pick. The clients, several clients are on digoxin for heart failure. The nurse should intervene with which situation? We already talked about digoxin. I give you the clue, and I said, draw your boy, bring your leg down, your chest, start with your head, neuro, your eyes, vision changes, your mouth, GI symptoms, your heart, cardiac, bradycardia, and kidney function. If you know all this, you don't even have to memorize, watch any video about digoxin. These are what they're going to ask you. There's another one, few things you have to know is the electrolyte. Potassium, hypokalemia, magnesium, hypomagnesemia, hypercalcemia, apical heart rate of 60. This is a child. Leukorise, ephedrine for UR symptoms, confusion, and what? Creatinine. Let's go back. Now, let's look at them. Potassium of 3 is hypokalemia. That's a risk factor for digoxin toxicity. Magnesium 1.2, hypomagnesemia, risk factor for what? Digoxin toxicity, increases digoxin toxicity because of cardiac arrhythmia. Hypercalcemia also do the same thing, cardiac arrhythmia. A child whose heart rate is less than 60, that's what? Bradycardia for him. You got to intervene. It should be less than, you want to make sure it's greater than 70 and it's less than 60. Therefore, it's 60. Therefore, we should intervene for that one. Leukorise causes hypokalemia. Hypokalemia increases digoxin toxicity. Ephedrine is found in cold medication, and that can also cause arrhythmia. Patient has confusion. That's the side effect we saw from the head. Neuro, that's a problem. Serum creatinine 2.3, that's renal failure. That means all 8 patients need to be seen. This is the content level questions to give you all the contents you need to know for digoxin. If you go take the NCLEX or nursing school, one of these information will be there if they ask you a digoxin question. There's one more inside. You should stick around and watch it. A client taking lisinopril developed a persistent cough. What is the next best action or response? Instruct to increase fluid intake, reassure that this is normal and temporary, notify the provider. Advise to take the dose at night. What do you think? You've seen lisinopril multiple times. I can change it, I can put anything there, but it's a pril. It's the ACE inhibitor. You know it causes angioedema, cough, electrolyte problem, and teratogenic. Patient has persistent cough. Do you let them increase fluid intake, or you tell them this is normal, or notify the provider, or advise to take the dose at night? Put down your answer or your comment. Stop the video, answer yourself because you got to keep your score. Persistent cough is expected. It's not an emergency, but if it persists, it's a warning sign that we got to modify the medication. Therefore, the right answer is number 3. Instructing the client to increase the fluid. This has nothing to do, it's not a diuretic, right? Reassuring, the word persistent defeats that purpose. Advice to take the dose at night. There's no time limit for taking lisinopril. Therefore, letting the doctor know is very important. This is done to intimidate you so that you know some questions are easy, but it's designed to intimidate you. You know it, don't run away from it. And nurse is caring for what? 4 clients taking lisinopril. It's an ACE inhibitor. Which client condition is most concerning? The best way to answer this question, think critically. It causes hyperkalemia. What will affect your hyperkalemia? Your kidney function. The rest is history. Client A has potassium 3.5, client B has 3.6, client C 4.1, and client 4D 4. The creatinines are different. Whoever has higher creatinine is the one you should worry about, unless the potassium is already high. But the highest potassium I see is 4.1. And I see the highest creatinine is what? 2. The heart rate, it does not affect your heart rate. So I'm not even worried about it. That's a trap. Therefore, which patient we should worry about? The one with the higher creatinine. Number 4. This is the strategy. You can answer questions. You have to go with the buzzwords, and the buzzwords are the key in the question. It's lisinopril, most concerning. 13. 6 clients are on the digoxin. This is what I promise you for heart failure. The nurse should intervene in which situation? We've seen the digoxin, another class of medication, the biggest of all. What do you think? There's a setting criteria. There you have to know. We've talked about it. If you're an adult, your heart rate less than 60 is a problem. A child, 70 is a problem. A neonate, 90 is a problem, right? And there's certain electrolytes. Number 1, signs and symptoms is a GI symptoms. Therefore, what do you have? An adult with the apical pulse of what? 100. A child who vomits 1 dose of digoxin in the morning. Child who has no appetite. Adult with a yellow vision. Neonate with ventricular septal defect. A child with severe what? Diarrhea. Whose situation should you worry about? Which situation should we intervene? Think about it. Test-taking strategy. Stop the video, answer it on your own, and then listen to me. This will give you some idea on how I'm going to approach it. I know that if your heart rate as an adult is less than 60, is a problem. Your apical heart rate is 100. You're good. A child who vomits 1 dose, that means we cannot give them another dose in the morning, but we got to check for them because it may be early signs of what? Digoxin toxicity. That's GI symptoms. A child who has no appetite, that means worse GI symptoms. They have anorexia, that's bad. Adults with a vision change, that means they already have toxicity. They may be having neurological problem and a vision issue. A neonate with ventricular septal defect is a trap, is a big word. It means what? Cardiac problem. And these VSDs causes what? Left to right shunt. And then they lead to what? Heart failure. That is why this patient may be on digoxin. It's what is the medication is being used for. It's not contraindication. If you have severe diarrhea, it causes dehydration, and you will have digoxin toxicity. Therefore, which patient should the nurse intervene? Number 2, we got to check on him. Number 3, we got to check on him. Number 4, we got to check on him. And of course, number 6. So these are little questions. You need to master them because that's what the NCLEX or nursing school will ask you. This is the same thing. A nurse is teaching a client with a heart failure who has a new what? Prescription for what? Spironolactone. The nurse should teach the client to avoid the following food. Select all that apply. Spironolactone is a potassium sparing. Therefore, if it's potassium sparing, I should not take any potassium good. So teach me to avoid what? Spanish, strawberry, whole grain, avocado, tomatoes, kale, and banana. If you don't know, this is the best way to know which food has high potassium. Google it. How about that? Easy way. But me, the way I do it, I use FAST. F, fish, avocado, strawberry, and Spanish. Those 4 is always going to be there. Spanish, strawberry, avocado, and tomatoes are always going to be there. Everybody know about what? Banana. And then you can have add the cow. All grain has no potassium. Therefore, 1, 2, 4, 5, 6, 7 have potassium in it. Like I said, this is a teaching video to give you questions and answers with the detailed rationale. So that's why I'm giving you all those information that they may ask you. But this is questions and answers, practice questions, answers, and detailed rationale. Pharmacology, right? Pharmacology, drug on cardiac medication. Number 15, and this is the last question. You know it. It looks difficult, but not. So select or apply. That's why it's designed like that. But guess what? You're going to ace it. Let's break it down. And let's care for several clients, a bunch of them, 6. Which client situation the nurse should intervene? Select or apply. 1. Client on what? Furosemide, which is what? Loop diuretic, is reporting muscle cramp. Client on chlorothalidone reporting mild dizziness when upright. This is hydrochlorothiazide derivative. The client on what? Spironolactone, a potassium sparing with the peak T wave. The client on spironolactone with what? Bilateral gynecomastia. Client on what? Hydrochlorothiazide, and he has what? Glucose of 200. Client is on furosemide with the small purple rash on the torso. What do you think? Last question. I know you're keeping the score. How many have you got? We got to get this. What do you think? Let's start with the number 1. Like I said, put down your answer. You stop it in the comment section. You say, oh, I get 12 out of 12, 15 out of 15. This one, first one, furosemide is a loop diuretic. It's a sulfur drug. It causes hypokalemia. Signs of hypokalemia, it's muscle cramp. That situation we got to worry about. Chlorothalidone is hydrochlorothiazide derivative because they also diuretic. They cause hypokalemia, because they increase your glucose, they causes uric acid to increase. Those are all signs. But because of orthostatic hypotension, report mild dizziness when upright is not something you should intervene. Spironolactone with the peak T wave is a potassium sparing. Peak T wave is high potassium. Therefore, we should intervene. Gynecomastia is the side effect from what? Spironolactone, because it has a steroid-like effect. You grow boobs, breasts, if you're a male. That is not something we need to intervene right now. Hydrochlorothiazide with the glucose of 200. Guess what? It causes hyperglycemia. But in this situation, you got to intervene. You got to follow up on it, because we give you a medication that is affecting. If this is one medication alone, but this is selected apply. So this is something you got to like intervene and figure out what is going on with it. But you will need some form of follow-up. You can't ignore it. The medication is causing glucose to go up. Furosemide with the small purple rash on the torso. This is Stevens-Johnson syndrome. That's going to kill you. That's sepsis. This is the first question. Which prescribed medication is most likely responsible for this finding? Read the question from the back. A nurse is caring for a client with what? Schizophrenia. That should tell you this patient is it will be on antipsychotic. Who, what? Stating something about what? My heart feels like it's skipping a beat. What do you think? Skipping a beat is the buzzword. So I have skipping of the beat with the schizophrenia, and there's a medication they're taking. What medication they're taking? Olanzapine, aripiprazole, risperidone, ziprasidone. Key way to remember psych medication. Look at the last name. You can see number 3 and number 4 sound like the same. Therefore, they are antipsychotic. Olanzapine is also an antipsychotic. Aripiprazole is also an antipsychotic, first generation. But the question is asking you, skipping heartbeat. That means something is affecting your heart. Based on that, what do you think? Pause the video, put down your answer in the comment, then look at the way I'm going to approach it. There's only one medication that can affect your heart based on antipsychotic function. And that medication is what? Something that will cause you to skip your heartbeat. And that medication is what? It's not olanzapine, it's not aripiprazole, it's not risperidone. This is ziprasidone. All the antipsychotic have specific side effects. I have other videos you can watch. This one is designed to give you all the things you need. Ziprasidone causes QT prolongation. That is why this patient had a skipping. So which medication we should pick? Number 4. Next question. I designed the test in such a way that I give you other one, then I come down, then I go up, down, up, and down to test your knowledge. This is one of them. This, by the way I said it, it can be difficult. Which findings support this diagnosis? Select or apply. That means there's a diagnosis I need to worry about. And then it's assessing the client who recently started what? Sertraline, and is suspected of what? Developing serotonin syndrome. Buzzword, how do you answer the question? Go with the buzzword. I say sertraline. I know what it is. You have to know what. This is the class of what? Depression medication, SSRI, right? Serotonin receptor inhibitors, right? And this is receptor uptake inhibitors. This is what they do. They increase your serotonin. You should not combine them with any medication that will add extra serotonin into your system. If you have serotonin syndrome, easy way to understand it. What do you think? Should you have muscle rigidity, hypotension, areflexia, calm, bradycardia, diarrhea, and hypotension? The way I do it is serotonin syndrome. When I see it, I would say everything is going up. If everything is going up, what do you think? Muscle rigidity, I'm going up. Hypotension, I'm not going up. Areflexia, I'm not going up. If I'm calm, I'm not going up. Bradycardia, I'm going down. Diarrhea, what do you think? Hypotension, what do you think? Based on that concept, what do you think? There's only a few answers there. This is new generation NCLEX. Select all that apply. Select all that apply is what you know. Muscle rigidity sound like it's going what? Up. I'm not picking. I would think about it and say, hey, muscle rigidity, I should be going up. That means number 1 is right. Hypotension, I'm going down. I'm not picking you. Areflexia, I'm going down. Calm, I'm going down. Bradycardia, I'm going down. Diarrhea, I'm going up. Constipation, you're going down. And hypotension, I'm going down. Therefore, the right answer is number 1 and number 6, right? Muscle rigidity and diarrhea are signs of serotonin syndrome. And those are the right answer. Number 3, what is the nurse best action? She needs to do something, right? Best action, that means all the answer choice may be right, but it's one thing if she has to do, it will be the best one. A client is prescribed what? Sertraline, reports difficulty sleeping and a decreased appetite during their follow-up. Buzzword, patient is prescribed sertraline and they have difficulty sleeping and decreased appetite. What is the nurse should do? Reassess the client, reassure the client that the side effect will resolve in a time, instruct the client to stop the medication for a few days, notify the healthcare provider to change the medication, assess the client's mood and safety. What do you think? 10 seconds I'm giving you to answer this question, or stop the video and answer it, or put your answer down in the comment. What do you think? I'm prescribing you sertraline. You came back for a follow-up and you have difficulty sleeping and decreased appetite. What is the most important? And when they give you a question on antidepressant and the patient is following up, the number 1 thing you should worry about, especially SSRI, when they started the first 2 weeks, suicidal ideation is number 1. Therefore, patient safety and their mood is the most important. Reassuring the client about the side effect is not good because they just started the medication. 2 weeks is important. Instructing the client to stop the medication is not good. They cannot just stop it. Notify the healthcare provider to change the medication. It will not change it. The most important thing is to assess the patient. How do you assess the patient? Check their mood and their safety. That's key. Which finding require immediate intervention? And this is caring for a client taking what? Clozapine for schizophrenia. Which medication is it? This is what? Antipsychotic. What kind of antipsychotic? Second generation. So I'm trying to give you the content regarding that medication, so that because this class of medication is antipsychotic. Every time you see it, think about that. Which of these should you worry about? Patients complain about constipation, weight gain, fever and sore throat, and drowsiness. What do you think? Put down your answer in the comment section. But the key concept to answer this question is what? Clozapine causes agranulocytosis. Write it down. It causes agranulocytosis. Once again, write it down. Agranulocytosis. That means it causes leukopenia. And therefore, if you have any signs of infection, it's a problem. Constipation is suspected finding. Weight gain is suspected finding. Drowsiness is suspected finding. But when you have fever and sore throat, and being sharp, and that's prioritization 101. That should be the right answer. Number 5, a nurse is caring for a client on what? Haloperidol, who developed what? Tremors and stiffness. Those are the buzzwords. I'm going to circle that medication, haloperidol. And what did the patient develop? Tremors and stiffness. What do I need to answer the question? I need to know what is haloperidol. It's a first-generation antipsychotic. Do they cause what? Tremor and stiffness? Of course, yes. Is it a bad problem? Yes, it's a bad problem. That's what we call neuroleptic malignant syndrome. Which medication should the nurse anticipate administering? What is the treatment of this problem? NMS, how do you treat it? Or the side effect of haloperidol, the major one, what medication do you use? Propranolol, lorazepam, atropine, cyproheptadine. How do you treat this medication or this condition? What do you think? The problem is you have to calm them down. But calming them down is not enough. You got to attack the muscle. So the best medication to treat it is not propranolol or lorazepam. I'm not going to choose them because they will take away the anxiety from the patient, which is good in NMS. You got to calm them down. But the actual medication that can counteract the haloperidol is benztropine, which is going to help with the muscle rigidity. Cyproheptadine is used for serotonin syndrome. So the right answer is number 3. And has completed a staff education session on bupropion, another medication you're supposed to know. And this is why I put it there. This is a common board favorite. You see in nursing school, you see in NCLEX exams, this is great to know. Bupropion is what? Is atypical antidepressant. And I told you there's a word there, sustained release is coming. Which client situation required the nurse to intervene? Select or apply. A client with the history of bulimia nervosa, a client with the diagnosed seizure disorder, a client who smokes 1 pack of cigarette per day, a client crushed the tablet before administration, a client reporting dry mouth and mild insomnia. What do you think? It's a select or apply. You don't have to pick everything. Pick the one you're 100% confident. I always say 101, 110, 120% for the next generation NCLEX. You have to pick something that you're confident about. This is pharmacology, practice test on psych medication that usually shows up, psych drugs. So which one will you pick? First, you got to look at the medication. Like it says, stop the video, answer it, then progress and listen to the way I approach it, right? So that we can all work it together. I know you're keeping a score. We are number 6. Bupropion is atypical. There's a word associated with it, sustain. So it comes as an extended release. There's certain things you should know about this medication. It causes appetite suppression. So you should not give it to anorexic patient who does not want to eat. So number 1, we got to intervene. If you have seizure disorder, it decreases your seizure threshold, so you have more seizures. You should not take bupropion. That's number 2 things you have to know. Number 3 is used to treat what? Tobacco. It helps with tobacco cessation. So when the patient smokes 1 pack per day, it's a good thing. We don't need to intervene. It comes as a sustained release, as the question says. You should not crash it. The patient crash it. Number 4, need intervention. Number 5, a client reporting dry mouth and mild insomnia, expected finding. Who need intervention? Number 1, bulimia, seizure disorder, and 3, crashing the tablet. That's the key thing you need to know about bupropion. And this question answers everything about it. A nurse is providing teaching to a client prescribed what? Lithium for bipolar disorder. Another medication that is good to know, right? It's an anti-epileptic and is used for what? Mostly for mood disorder, especially bipolar disorder. And that is what we use it for. That's lithium. If you don't know anything about bipolar, remember lithium. Which statement the nurse should intervene? That means bad stuff they're saying or they're doing. If you provide teaching about lithium, I will increase my sodium intake, number 1. Number 2, I will take acetaminophen for knee pain. I will need routine lab draw. I will notify my healthcare provider with nausea or anorexia. Number 5, I will drink 2 to 3 liters of water a day. 5 answers. Select or apply. Pick those that you're 100% confident. If you know it, pick it. If you don't, if you are 85%, don't pick it. 99%, don't pick it. I want you to pick it when you have 101, 110%. What do you think? Stop the video, put down your comment, think about it, jot it down. We're doing a quiz, pharmacology quiz, quick and dirty way of answering pharmacology. Lithium, what do you know about it? I can tell you it's a trap. Number 1, you should not increase your sodium or you should not decrease your sodium. You should keep your sodium constant in a normal range. Therefore, number one, need intervention. The patient said, I will increase my sodium intake. I will take acetaminophen for knee pain. Why is the patient saying that? Because NSAIDs can affect your kidney. If it affects your kidney, lithium love a kidney that is diseased. Lithium love a kidney that is diseased. That's the easy way to think about it. Anything that affects your kidney, lithium say happy birthday. Therefore, lithium will hate a patient that taking acetaminophen. They want you to take NSAID so that you can destroy your kidney. So number 2 does not need further teaching. I will need routine lab work. Very toxic, so we got to check your drug level. I will notify healthcare provider with nausea and anorexia. Why? Because number 1 signs and symptoms is GI symptoms. I've said it multiple times. The easy way to know a drug toxicity is GI side effect. Most of the bad medications we have, which have narrow therapeutic index, they start with GI, like digoxin, especially lithium. So you should notify the healthcare provider with nausea and anorexia. Why would you drink 2 to 3 liters of water a day? Because you don't want your kidney to get in trouble, and lithium make you dehydrated. Therefore, hydrate yourself to fight lithium. So which of these options we should intervene? Number 1, we should intervene. 2, you should not. 3, you should not. 4, you should not. 5, you should not. So there's one thing that patient is saying that it will increase his sodium. But taking acetaminophen is good. I will need a lab draw is good. I will notify my healthcare provider with signs of toxicity is good. And I'll drink a lot of water is good. What is the next immediate action? The client is receiving haloperidol. You've seen it again. It's febrile, confused, and has muscle rigidity. This is the same question, but I'm testing something different. You will see this in the NCLEX. See the same thing repeated multiple times, but there's something in the question that's changing the concept. Every question has a concept. This question concept is different. If the patient is receiving the same medication we saw, haloperidol, but yes, febrile, is confused, muscle rigidity. What would the nurse do? Immediate action, prioritization. Would you give the patient benztropine? Would you check their vitals? Or do you hold the medication and notify the healthcare provider or apply cord compression? Think about it. You have everything you need in this patient. He's febrile, that's vital signs. He's confused, that's vital signs. He has muscle rigidity, that's also physical exams to make assessment. Why would we check your vitals again? What is he going to tell you? Bench trophy is going to treat it, but this is a dangerous problem. You need help. So the best help you need is by notifying the doctor and holding the next dose, because you cannot give him his allopuridol again. So every time you see this kind of question in the NCLEX, remember, holding the next dose means don't give any further medication. It doesn't mean the medication is scheduled 10 hours from now. It's a good answer choice. So 3 is the best answer. And next is reviewing dietary instruction with the client. Prescribe what? Phenoxine for depression. Another medication you're supposed to know. Phenoxine is what? It's the MOIs. They are very dangerous. Their major problem is hypertension. There's certain things you're supposed to know. Avoid medication that will make your blood pressure goes up. Avoid diet that will make your blood pressure goes up, because you should avoid thiamine-rich food. Which food should the client avoid? Every time they give you MOI, this is a board favorite. They're going to ask you about dietary, because that's what is going to kill the patient. How many more answers have you had? 8, 9? How many have you got right? I hope you get this one right. Number 1, grilled chicken. Should the patient avoid that? Fava beans. Should they avoid that? White rice. Should they avoid that? Ricotta. Should they avoid that? Cream cheese. Should they avoid that? Fresh mozzarella. Should they avoid that? Think about it. These is things that the board will put in your exams. The nursing school will put in your exams. Pay attention, nursing students, nurses. And this answer choice is a good thing for you to know. When I give you a question, there's a keyword, which is the concept I'm testing. The things they're supposed to avoid is what? Thiamine-rich food. So anything that is smoked, right? Anything that is aged and fermented. 3 things, that's all. Fermented, aged, and smoke is a bad thing. Grill is fine. Fava beans is bad. That's a lot of thiamine food. White rice is good. Ricotta is a cheese, but it's not fermented or aged. Cream cheese is not fermented or aged. Fresh mozzarella is not fermented or aged. So those cheeses, they can take it. Therefore, there's only one answer. If you pick more than one, you get 0, sorry. So number 2 is the only thing the patient should avoid. One answer. And nurse is providing district teaching to a client prescribed lithium, same medication we've seen it for bipolar. Which instruction is most important? You see, it look like the same thing that we saw in the selected apply, but I'm trying to give you variety of options so that you can be familiar with. Lithium, we talk about it. Make your kidney happy, make your sodium normal, and hydrate yourself. Those are the 3 things. Kidney happy, sodium normal, hydrate yourself. Patient said, and then you instruct the patient to avoid salty food. That's a bad thing. The patient should limit fluid intake. That's a bad thing. Report hand tremor. Of course, it's okay. It's bad, right? But think about it. Maintaining adequate hydration is the most important than reporting hand tremor. You want them to prevent their hand tremor. Therefore, you should teach them to what? Hydrate themselves, maintain normal sodium, and avoid hurting the kidney. So 4 is the right answer, 3 is not. NS is providing district teaching to a client. Prescribe what? It's no bupropion. This is called buspirone. It's also, it look like bupropion. Bupropion is antidepressant, atypical. Buspirone is an anxiolytic, anti-anxiety medication, but what is used for? Anxiety related and is atypical. Which statement by the client indicate the need for further teaching? Things you need to know about buspirone. My anxiety will improve within a week. Is it true? I will take the medication in the evening to avoid sedation. Does it cause sedation? I will avoid consuming grapefruit juice while taking the medication. Should you avoid grapefruit juice? I will take this medication with and without food. Do you need food or no food? The medication are low risks of dependence. One of the good things about buspirone, this is the content, compared to benzos, it has no sedation, it has no dependence. Therefore, number 5 and number 2 is what? Think about it, it's a trap. The medication at low risk of dependence is good. That's number 5. So there's no need further teaching. But number 2, I will take the medication in the evening to avoid sedation. Well, it does not cause sedation, so you can take it anytime. So 2, need further teaching. My anxiety will improve within the week. It's not benzos. It takes 3 to 4 weeks to work. Therefore, 2 to 3, between 2 to 4 weeks. Therefore, that needs further teaching. I will avoid consuming grapefruit juice while taking the medication. The medication, it can affect your liver because of, and then grapefruit juice increases the toxicity. I can take this medication without food. You don't need to take it with food. Therefore, 4 is good. So what are our answers? My anxiety is not going to improve in a week. That's the wrong answer. We got to intervene. I will take the medication in the evening to avoid sedation. There's no sedation. We have to intervene. 1 and 2 have to intervene. 3 is fine. Avoid grapefruit juice. 4, I will take this medication without food. It's good. You don't need to take it with food. So that's fine. And 5 is okay, low risk. Therefore, 1 and 2 are your right answer. That's everything you need to know about ibuprofen. This is a key. You see 3 questions of clozapine. Why? Because it's a key thing. There's a different way they can ask you. So I try to tackle every area. And next is assessing the client 1 week of what? Therapy on clozapine for psychosis. Which finding is most concerning? What is one thing about clozapine you should worry about? We saw one, I give you a fever, but this one, there's no fever there. There's drooling, there's diarrhea, there's a weight gain of 2 pounds and temperature of 98. Put down your answer. I really want everybody who watch this video to put down their answer to number 12. I want to see what was the answer before I give the answer away, because this is always a trap. So stop the video, put down your comment, tell me what you think number 12. I'll reply you. So what is the answer choice? Drooling sound bad, right? But the drooling here is not airway, it's salivation. It causes hypersalivation, so they cannot hold their saliva. So this is common with clozapine. Diarrhea, no, it's not good. Diarrhea is not good. Why? Because it causes agranulocytosis. And when you're having diarrhea, it's a sign of it may be sepsis, infection. 2 pound weight gain is suspected finding, and temperature is normal. Therefore, number 2 is the right answer. And next is caring for a client who has recently started on what? Amitriptyline for depression. This is what we call TCA, tricyclic what? Antidepressant. They are my favorite, and I call them the DANCE, D-A-N-C-E, the DANCE. If you're taking amitriptyline, watch for the DANCE. The D is dermatitis. The A is anticholinergic. The N is neurological problem. The C is cardiac toxicity. And the E, you have to evaluate. Therefore, anybody on amitriptyline, look for the DANCE. Therefore, based on that, which one should you prioritize? The A, the anticholinergic, is the dry mouth and constipation. The blurred vision is anticholinergic. Drowsiness and dizziness, or it may be also related to anticholinergic. Heart skipping, a beat, and confusion. That's neurological and cardiac. Based on that, what should be your answer? I know you picked number 4, and I know you watch Adapting Twins. A school nurse is monitoring a child who has been taking methylphenidate for attention deficit hyperactive disorder. Know this medication, know this medication, know this medication. Even if they change the name, they give you derivative, and they tell you it's for ADHD, the signs and symptoms never change. The answers never change. All of them are stimulant. Therefore, they speed things up. But what they do, they deal with something that I'm asking you. Which findings should the nurse report to the healthcare provider? Sedation and hypertension. Should you report it? Daytime fatigue and drowsiness. Should you report it? Decreased appetite and 30% height and weight chart. and the blurred vision and headache. What is the concept here? What is the concept? Once again, stop the video, put down your answer in the comment. But what do you think these medications, they are stimulant. Therefore, everything is supposed to go up except few things. Therefore, if I see hypertension, I say it's expected finding, right? If I see headache, it's expected finding. They don't cause sedation because they are stimulant, right? They don't cause drowsiness and fatigue. It's unrelated, right? But what they do, there's two things. They make your weight go down and your height and weight go down, and they decrease your appetite. This is the key. So every time you see a kid on methamphetamine, the priority is decreased appetite and what? Height and weight reduction. And that's your priority. So number 3 is the right answer. Number 15. This is the class of medications to put you in a perspective. It's an anti-epileptic, valproic acid. There's a bunch of them, but this one has specific side effect. You have phenotide. Valproic acid is also another group of medication that you're supposed to know. So it is anti-epileptic. The nurse is providing teaching to a client prescribe what? Valproic for bipolar. They can be used for bipolar. I call them anti-epileptic. Which instruction should the nurse include? All these anti-epileptic, they have very common side effects. They are sulfur drug, and they are teratogenic. Those are common to them, all of them. So, and you have to monitor therapeutic index. 3 things you have to know: sulfur drug and teratogenic. But for valproic acid, is that it has its own specific side effect, and that's what I'm testing. Selected apply. Patient said what? Report any unusual bleeding and bruising. Is he associated with valproic? Minimize alcohol to 1 to 2 beers a day. Take the medication on an empty stomach. Take an acetaminophen if you experience stomach pain. Routine lab draw may be needed. Take your oral birth control medication daily. What do you think? Once again, select or apply. You don't have to pick everything. Pick those that you're confident, and then when you pick it, make sure you're 100% sure before you move forward. If you are not 100% sure, you let go. Valproic acid, this is the content. Specific side effect. It causes thrombocytopenia, so it affects your platelet. It affects the liver, that's the second one. And it causes pancreatitis. 3 things you're supposed to know to answer questions related to that. Apart from that, it's a teratogenic and it's a sulfur drug based on the fact that it's anti-epileptic. Teratogenic means it causes neurotube defect. So this question is answering everything. Report any unusual bruising and bleeding means it causes what? Thrombocytopenia, and therefore you're going to bleed, and therefore we got to pick that one. Minimize alcohol 1 to 2 beer. Well, it affects your liver. Why do you want to minimize alcohol? I don't want you to take any alcohol, 0 alcohol. Take the medication on empty stomach. It causes GI upset and pancreatitis. You should take it with food. Take acetaminophen if you experience stomach ache. If you have stomach ache, it may be pancreatitis. 2, the acetaminophen will affect your liver. So we have a problem. I need a routine lab draw may be needed. Yeah, that's good. Take your oral birth control medication daily. Well, it's a teratogenic. They make oral birth control ineffective. You should have a barrier reliable method. You can still take the pills, but somebody have to wear a barrier method. That is condom, or female or male condom. Therefore, which instruction should the nurse include? Reporting any unusual bruising and bleeding is good. That's good answer. 2, we should not include it. 3, take the medication on empty stomach. We should not include it. 4, take acetaminophen if you have abdominal pain. We should not include it. 5, you need a routine lab draw. Good. And taking your oral birth control daily, no, we should not. So there's only 2 answers there. If you pick more than 2, you get 0. A client taking trazodone report dizziness when standing up. The client taking isocarbazide report muscle twitching. The client taking ziprasidone report chest fluttering. The client taking paroxetine report decreased libido. A client taking lorazepam as positive pregnancy test. A client taking risperidone is unstable to sit still. A client taking seleginin had what? Cottage cheese last night. What do you think? Content right here I'm going to give you. And each medication, I'm going to tell you the most important. Trazodone causes priapism, but it also causes, that's the priority. It causes orthostatic hypotension. This is why the patient have dizziness when standing. That's expected. Don't pick it. Isocarbazide is MOIs. It causes a little bit of dizziness, confusion, muscle twitching. That's not a priority. Those are common side effects. The major side effect is hypertensive agency. So it's muscle twitching, it's not serotonin syndrome, or it's not NMS. They don't cause that. They can cause serotonin syndrome if you combine with any serotonin product. The client taking ziprasidone, which is antipsychotic, reporting what? Chest flattening. We saw it as in the question. This causes QT prolongation. We should intervene. The client's taking paroxetine, that's SSRI, report decreased libido. That's expected finding for all antidepressants, especially SSRI. The client taking lorazepam is a benzos, right? They increase, you have dependence, and then you can have withdrawal symptoms. They're different from buspirone, which are what? Anxiolytic, but they are atypical without sedation and dependence. The biggest thing about lorazepam, you should not take it when you're pregnant. So we should intervene for that one. A client taking risperidone, this is antipsychotic. That's the major antipsychotic that we use for second generation because it's weight gain. But the major side effect is unable to sit still. This is akathisia. We should intervene. A client taking seleginin had what? Cottage cheese last night. It's a MOI, but cottage cheese is allowed because it's not fermented or aged. Therefore, which patient condition is concerning? Number 3, ziprasidone, lorazepam, risperidone. Those are the one is concerning. These are the medications we'll be talking about. You can see it's very extensive, but those are the one NCLEX will ask you. There's few things you need to know about them. These questions and answers on pharmacology will take care of it with this endocrine stuff. First question, don't run away from it. I know you know it, but when you see it presented in a different way, you get discouraged. Don't do that. Let's stick with it. And next reviews insulin order. Glargine, 20 units, subcutaneous daily at 8 a.m., right? Lespro, 6 units, subcutaneous with meal, right? And patient lunch will arrive, what? 12:30 p.m. When should the Lespro be given? You give it to the patient 1 hour before. That means what? 11:30 a.m. or 30 minutes before 12 p.m. or right before eating or 30 minutes after they eat. You know the concept. Bring it there. Lespro, what is the medication? It's a rapid acting. What is the definition of rapid acting? This should be given before meal. Therefore, what answer choice you should pick? Give it before meal. So right before meal. That is all. Number 3 is the right answer. If you give them 30 minutes before or an hour before, they're going to have hypoglycemia. If you give them after 2, hypoglycemia. Therefore, 3 is the best answer, right before eating. You see how you take the concept and use it to answer the question. So Lespro, know about it. Glargine is a long-acting. Next one, and let's prepare to administer regular insulin IV to a client with what? DKA. Which action is most important? The buzzword is which action is most important. Administer the medication, what? With meal, hold it if potassium is less than 3.5. Shake the insulin vial before drawing. Give subcutaneously in the abdomen. Stop the video, put down your answer choice, and then listen to the way I approach it. If I'm answering this question, keywords. Look at the question, regular insulin. and there's IV there, intravenous, and this patient has what? DKA, and no patient is sick. A DKA patient should be NPO, should be probably in the ICU, will be giving IV insulin. Therefore, number 4 is completely wrong. The question stem said IV insulin. Why would you choose number 4? It says subcutaneous. No, we said we're going to give it to them IV. Shaking the vial before using it is not the appropriate way of administering insulin. This is going to be a drip of insulin. Hold if potassium is less than 3.5. Potassium will be driven into the cell with insulin. Insulin is one of the most common causes of hypokalemia in the patient who has diabetes or DKA. Therefore, we got to make sure we hold the insulin when potassium is low. Patient is going to be NPO because they have DKA. So administered with male is not right because the patient will be having what? IV drip of insulin going on. Therefore, the right answer is number 2. Next question. And next, provide teaching to a client with what? New prescription for metformin. Which instruction is most important to give a client? The key word how to answer the question, I try to make the question short, but yes, everything you need to know. You're providing what? Teaching, that's the buzzword. The second buzzword is what? A new prescription. The third one is what? Metformin. And the most important is the most important. This guy is the most important that you got to give to the patient, right? Therefore, what do you know about metformin? It's one of those medications that used for diabetes. It's oral diabetic medication. It does not stimulate insulin production. Therefore, number 4, we say weight monitor for weight gain is wrong. It does not stimulate insulin production. Anything that stimulates insulin production will cause weight gain. Avoid alcohol and contrast. Think about it. Expect occasional low blood glucose. Since it does not stimulate insulin, there is not going to be hypoglycemia. 2 and 4 is a concept answer choice. Take with male to avoid GI upset. Yes, it causes GI upset. But which one is the most important? Prioritization 101. Contrast diet and alcohol will make you have what? Lactic acidosis. And that is the problem. You see how this question testing your content level in terms of how to analyze prioritization. So number 3 is the right answer. Next one. And next monitors a client on prednisone for which complication. Select that apply. Think about it. What does prednisone do? It's one of those medications. If you don't even want to analyze it, think about a Cushing patient. How should a Cushing patient look? Change this question into a Cushing patient. A Cushing patient has too much steroid, and therefore their blood pressure is going to be high. If your blood pressure is high, you have hypertension and hypernatremia. If your sodium is high, your potassium is going to go down. You see how I'm breaking down. What does steroid do? You hold on to things. So you hold on to water and it increases what? Your sugar. So hyperglycemia. There's a risk of infection. You see, everything is connected. And then break down your bone. Your skin becomes very thin. You bleed easily. I've given you all the signs and symptoms of what? Steroid related to adrenal dysfunction. Therefore, what? Number 1, hyperglycemia. He said it's a complication of what? Prednisone, which is the steroid. Infection risk is going to be high. Your skin is going to break easily. Your sodium is going to be high, and you're going to have osteoporosis. It's a selected apply. You don't have to pick everything. Pick those that you're confident. Therefore, 1, 2, 3, and 5 are your right answer. This you got to know regarding steroid. The next one, a client is taking levothyroxine, report weight loss, insomnia, palpitation. Which instruction is most important to give it to the client? Reassure the client, tell them to stop taking the medication, notify the healthcare provider, and suggest taking it at bedtime. Think about it. I see levothyroxine and say, oh, this is thyroid hormone. Why do I give it to you when you have low thyroid hormone, hypothyroid? What that thyroid hormone does increases everything except your weight, right? So if I give you too much thyroid hormone, your heart rate goes up, right? You can't sleep. You become restless. Your blood pressure goes up. Thus, your metabolism increases. This is the signs of what? Hyperthyroidism. It's the same thing as me giving you thyroxine. So if I give you thyroxine, you're going to look like hyperthyroidism. Patient symptoms is consistent with what? Hyperthyroidism. That means the patient is having what? Side effect. What do you do? What do you do? Think about it. I want you to put the answer for number 5. What do you do in this situation? Patient is getting levothyroxine and he's looking like he's having hyperthyroid symptoms. You don't reassure them. You don't tell them to stop it. It's a steroid. They get a rebound. You tell the doctor and you can make some adjustments. They can't take it at bedtime because this medication has to be taken in the morning. Number 3, right answer. And this is assessing the client taking what? PTU, propylthyrouracil, for hyperthyroidism, which finding require a priority action for the client. I always say, how do you answer question? Read it from the back. What is the keyword? Require priority action. You're going to circle that one. Then you go to the stem of the question. And next is assessing a client taking what? PTU. That is your prioritization medication. That is your buzzword. Therefore, rewrite the question. I have PTU. What should I worry about? If you don't know anything about that medication, PTU, put the thyroid hormone under. Secondly, think about it. It suppresses thyroid function. Therefore, it makes you hypothyroid. Is that the priority? No. Fatigue and cold intolerance, altered taste, yellow urine, and a sore throat. There's 2 things you have to know about PTU. It causes agranulocytosis, it affects your liver, and it has other common side effects. Once again, it causes what? Agranulocytosis, it affects your liver, and it has other common side effects. Fatigue and cold intolerance is what? It's because it suppresses your thyroid hormone, and therefore you're looking like hypothyroid. I'm worried that, let's see, we're talking about prioritization. Altered taste is common, one of them. But yellow urine may be related to what? Your liver function. And then sore throat is what? Infection. Which one is most dangerous? Agranulocytosis, which is sore throat, yellow urine related to liver function, altered taste, which is the normal function, and number 1, which is hypothyroid symptoms. Think about it. Agranulocytosis is more deadly. Therefore, we should pick number 4. This is a hard one. I designed the test this way so that I take you up and down. But it's a simple prioritization question, and you have to prioritize agranulocytosis over liver dysfunction. And next, provide teaching to a client receiving what? Radioactive iodine therapy, which statement by the client indicate effective understanding of the teaching. The buzzword is radioactive iodine therapy. This is used to destroy your thyroid hormone. If you have hyperthyroid and you can't take medication, I will isolate my laundry and utensils. Is it a good thing? I will take it with food. Is it a good thing? I can be around children. I will expect my hair to fall out. Think about it. You have hyperthyroid. I'm giving radioactive iodine therapy. Even if you don't know what it is, the word radioactive tells you something that can spread, right? You can emit radiation everywhere. Therefore, you should isolate yourself, which answer choice indicate isolation. I'm trying to break down the question one by one, right? So effective means isolating yourself because it's radioactive. You take it with food. No, this is given once. It's a trap. You get the radiation once, you get in your system, and you're doing things until 5 to 6 weeks, and you get out of your system, right? So two is irrelevant. You cannot be around children because what is going to, you can expose them. And you don't expect your hair to go out. The dose that they give you is not like true chemotherapy stuff. This is just ablation of your thyroid. I will isolate my laundries and utensils because all your body fluids will contain radioactive substance. Number one is your right answer. And don't forget this answer. How many answers have you had so far? We are on number 7, halfway. What do you think? What is the tally? Put it in the comment section. And then she's caring for a client newly diagnosed with what? Hypothyroid, who is prescribed what? Levothyroxine. We've seen this already. That means they have hypothyroid, they need thyroid hormone. We're giving them steroids. Which statement by the client indicate a need for further teaching? They're saying something that is wrong. How do you answer questions? Rewrite the questions on your own and use the buzzword. That means I have hypothyroid, I'm on levothyroxine, and I need some teaching. Therefore, these 3 words I'm focused on. I'm saying something bad about what? Levothyroxine. What do you think? I will take this pill first thing in the morning. Is that what you're supposed to do? I can expect to feel more energetic within a few days. What do you think? I will report chest pain or a rapid heartbeat. Is it a bad thing to do? I will have my thyroid level checked regularly. Hey, what do you think? I will remain upright for at least 30 minutes after taking the medication. Is it necessary? Stop the video, put the answer choice down, and let me know. But this is the concept I'm giving you because this is pharmacology test. I got to give you all the content related to this medication because this is high yield medication. Your board will ask you. Levothyroxine should be taken early in the morning, empty stomach, no antacid, no milk, nothing like that. I will expect to feel more energetic within a few days. It's a steroid. It takes some time to work. I will report chest pain or rapid heartbeat. I'm giving thyroid hormone. That speeds things up. Therefore, that is expected. I will have my thyroid level checked regularly. Yes, you have hypothyroid. I want to make sure the medication is working. I will remain upright for at least 30 minutes after taking the medication. It causes esophagitis. In order to prevent irritation of the esophagus, remain upright. Which one needs further teaching? There's only one answer choice. Taking it in the morning is good. You're not going to feel well right away. You should report chest pain. You should have thyroid hormone check, and you should remain upright. Number 9, NS is providing medication instruction with the client prescribed PTU. We are now in the hardest portion of the test where this requires select or apply thinking. But you don't have to pick everything. If you know only one answer, pick it. Don't over-select. Which statement indicate a need for further teaching? Select or apply. What is PTU? We talk about it. Put the thyroid hormone down, right? And this is what is the problem. Major problem, agranulocytosis, followed by what? Liver dysfunction, followed by changing your taste and then your GI. Therefore, which one needs further teaching? I will take this medication for 3 months. No, you take it continuously. I will avoid crowded place while taking this drug. Yes, because you're going to have agranulocytosis. I can expect my heart rate to increase. You put the thyroid hormone down, therefore the thyroid hormone will slow down your heart. That's not true. Routine liver tests may be needed during treatment because your liver function will be affected and may bruise more easily while on this medication. This is the hard one. Any medication that causes agranulocytosis can also causes you low platelets and anemia because how does they cause agranulocytosis? They go to the bone marrow and it suppresses your bone marrow. So they basically actually refer to as pancytopenia, decreasing your red cells, the blood cells, and the platelets. So these are the things you're supposed to pay attention to. White cells, red cells, and platelets go down, become pancytopenia. Therefore, 5 is a good thing. So which one need further teaching? Number 1, you take it forever, for a long time. It does not increase your heart rate, it decreases. So 1 and 3 is your right answer. And then she's teaching a client taking methimazole for hyperthyroidism. This is the second medication that you can use for hyperthyroidism instead of PTU, which instruction is most important to include. Avoid seaweed and dairy product. Notify the provider if you develop a sore throat. You may feel jittery for the first few days. Take this medication with food. There's a content there. In that statement, look at it. If you don't know anything about methimazole, I'm giving you one thing and one thing only. It also causes a granulocytosis. So pay attention to that. Therefore, based on that, what do you think? Avoid seaweed and dairy products. The seaweed has a lot of iodine, and that can also affect your thyroid function. It's very important, but it's not that important in this situation. Notify the provider if you develop a sore throat, agranulocytosis. You may feel jittery for the first few days. Think about that. This is a good one. Think about it. Jittery means your heart is going to have palpitation. PTU is putting the thyroid hormone down. How can he increases your heart rate? If he's increasing your heart rate or you're having palpitation, that means it's not working. That is number 3 is telling you. The medication is not working. That means you're not having side effect of the medication. We should increase the dose. Take this medication with food, not necessarily. Agranulocytosis is dangerous, it's sepsis. Therefore, 2 is the right answer. And then scales for a client on what? Desmopressin. Which lab results is a concern? Desmopressin is ADH. What does ADH do? They hold on to water. So desmopressin will hold on to your water absorption. What does water do? It causes dilution and give you dilutional hyponatremia. With antioxidants indicate dilutional hyponatremia. Number 3. This is a straightforward content. Next one. A client on long-term steroid suddenly stopped the medication. Think about it. I stop the medication I'm taking, the steroid. Which complication is most concerning or you should be concerned about? What do you think? Thyroid hormones, especially which is a steroid, corticosteroid, which is a steroid. What do you think? Steroid hormones, what do they do? We talk about it. We saw a question like that. They increases your glucose. They increases your sodium. They decreases your potassium. They increases your blood pressure. These 4 things is good to know. But patients stop taking the medication. What do you think? Should their sugar goes up? Should their blood pressure goes up? Should they have fatigue? Or should they have fluid overloaded? This is interconnected. Let me give you the pathophysiology. You take your steroid, it helps with your sodium, you hold on to your water, your blood pressure goes up. It increases your glucose, right? What do you think? Fluid overloaded is when you have steroid. I don't have steroid anymore. Hypertension is when I have steroid. I don't have it anymore. Hyperglycemia is when I have steroid. I don't have it anymore. When you stop your steroid, you're going to have adrenal crisis. Adrenal crisis present like profound fatigue. 3 is your right answer. And this is teaching a client with newly prescribed glargine insulin. Which statement by the client shows what? Correct understanding. This is very, very important. There's a concept there. I will mix this with the regular insulin in 1 syringe. I will take this before each meal. Endocrine medications are very important. NCLEX love them because we see them all the time. A lot of people are on diabetes. I will take this once a day, same time. This works quickly, so I will hit right away. These statements are saying things that you already know. That I've changed it. I don't use the word that is supposed to be used, like fast acting, rapid acting, long acting. Those statements is what they mean that I put it in this form. So NCLEX will do that to you. One thing about glargine you should not forget is a long acting. You never mix it with anybody, right? It has no peak, and you take it once a day. Therefore, number one, I see mixed, I take it away, right? It's a long acting. You don't need to take it with meal. You take it once a day. It's daily, and it does not work quickly. That's why you take it once a day. Therefore, 3 is the right answer. And then as receive money report on multiple clients, which finding will cause the nurse to hold metformin? Rewrite the question again. What are the contraindications for metformin? That's all. Which situation you should not give a patient metformin? Patient is having cardiac catheterization. Patient blood glucose is 110. Patient has mild nausea after meal. Patient hemoglobin A1C is 8. You can see. Stop the video and the answer choice is popping out like a candy. It's right in front of you. Using the buzzword, you can see it's popping out. Metformin, contraindication. What do I know about metformin? It causes nausea, right? Number 3 is not a problem. Why am I using metformin? Because you have diabetes, hemoglobin A1C of 8. I'm not going to stop it. I'll give it to you. No, 2, sugar is fine, but it's not the priority compared to 1. 1 means contrast, and contrast allergy should avoid metformin because it causes lactic acidosis. And let's review the med list of a client. Last question. With the patient with grave disease, which prescribed medication require clarification? This summarizes everything we talk about using concept to answer the question. Underline the buzzword. The buzzword is grave disease. Which medication I should clarify? Then if I'm the best way to answer the question is grave disease. What medication do I need? That medication should slow down the thyroid hormone, right? That's all. Anything I'm going to give you for grave disease, slow down the thyroid hormone and the effect of the thyroid hormone. The effect of the thyroid hormone is tachycardia and anxiety. Whoa, I see propranolol. Good. Iodine solution is going to destroy the thyroid. Metamizole is going to put the thyroid hormone down. Levothyroxine is the thyroid. I cannot give you any more thyroid. Easy way to confuse you, but that is it. As you can see, try to make it a little bit difficult this time so that we can get this medication mastered no matter what. But this question is intimidating. Don't worry. Select or apply. New generation NCLEX. Pick those that you're 100% confident. It's a prioritization question. Let's get to it. And next is reviewing a list of clients receiving respiratory medication, which situation require the nurse to intervene. Select or apply. How do you answer questions? Start from the back. Select or apply. New generation NCLEX. You know you're not supposed to pick all of them. You pick those you're 100% confident. What is the problem? Intervene. Something is not right. They are all medications associated with the respiratory system. Sex patient, whose situation you should worry about. Theophylline. Why? What is happening? Who report drinking 4 cups of what? Caffeine daily. That's one patient. Second patient is on Abudro, has a heart rate of 102. A client on what? Ipatropine, who has what? Peanut allergy. A client using Salmeterol as a rescue inhaler for sudden wheezing. A client on what? Prednisone, who has blood glucose of what? 165. A client on Metlucast, who is experiencing what? Nighttime asthma symptoms. How do you answer prioritization question? Divide it into 2. Ask yourself the first portion and the second portion. Second portion is very important. look at what is happening to the situation. If you're on theophylline and you're taking 4 cups of caffeine a day, you are in trouble. Lead to toxicity of theophylline. A client on Abudrol who has a heart rate of 102, what is going on? Abudrol is a beta agonist. It will speed things up. You expect the heart rate to go up. 102 is not that bad. We don't need to intervene. Ipratropium, who has what? Peanut allergy. Ipratropium is anticholinergic used in acute situation of asthma. If you're allergic to peanut, you cannot take it because some of the components has peanuts in it. Therefore, you should not take it. Using Samithro as a rescuer inhaler for sudden wheezing. The last name is raw. It looked like Abudrol, but it's not a rescue agent. It's for what? Long acting. Samithro should not be used as a rescuer or a sudden wheezing. Therefore, this patient needs some teaching regarding the use of what? Samithro. So that question, we need to intervene. A client on prednisone who has a blood glucose of 165, steroid increases your glucose level. This is an expected finding. We don't need to do anything. A client on Mantulucas who is experiencing nighttime asthma symptoms, same thing. Mantulucas is for long term. If you are experiencing asthma symptoms at night, you need a rescue agent. This patient needs some teaching. Who we should intervene? Number 1, number 3, number 4, and number 6. This is the first question. But as you can see, it's content-based. You have to identify the medication and then pick the right answer. Number 1 is that. Number 2, which finding on the EKG should the nurse report to the provider? A nurse is caring for a client receiving what? Frequent Abudrol nebulizer treatment for acute asthma exacerbation. Which finding on the EKG should the nurse report to the provider? Think about it. Sinus tachycardia with a heart rate of 105. Occasional premature ventricular contraction. Flattening T waves and the presence of U waves. Normal sinus rhythm. The answers are intimidating. Don't worry. Break down the question. EKG finding, you should report to the provider. Those are the 2 buzzwords. The next buzzword is Abudrol, frequent Abudrol. Then ask yourself, what is Abudrol? It's a beta agonist. If I give it to you, your heart rate goes up, 105. Do you get premature ventricular contraction? It said occasional there. Don't worry about it. Flattening T wave, how does that happen? In the presence of U wave. Normal sinus rhythm, that tells you number 4 is gone. Number 1 is suspected finding. Number 2 and number 3, you can see occasional premature ventricular contraction and a pure flattening T wave in the presence of U wave. What is happening? Abudrol causes hypokalemia. Don't forget, write it down. Abudrol causes hypokalemia. Write it down. Therefore, the presence of U wave and the flattening T wave, those are signs of what? Hypokalemia. EKG changes are more serious in this situation compared to occasional premature ventricular contraction. 3 is your right answer, but this is a content level regarding Abudrol. Don't forget, let's recap again. Abudrol causes hypokalemia. Therefore, watch for these signs on EKG. Which instruction should the nurse include during discharge? About who? The nurse is caring for a client. Prescribe what? Abudrol. It's a rescue agent. Abudrol is a rescue agent. Use this inhaler daily in the morning. Wait for 5 minutes before using the steroid inhaler. Expect drowsiness after each dose. Clean the inhaler mouthpiece weekly. Stop the video, answer the question, put down your answer, and then listen to me how I'm approaching it. The only way I approach it and the best way is to go to the Abudrol. That's my buzzword. I look at Abudrol and say, what should I include in teaching? A big beta agonist is going to speed things up. It's going to make everything goes up. Why would I be drowsy? No, I'm not going to be drowsy. I'd rather be more alert. I can't sleep. Tachycardia. Therefore, 3 is not expected. Use the inhaler daily in the morning. It's a rescue agent. You don't take it every day. You see, those are the trap, right? You don't take it every day. Wait 5 minutes before using the steroid inhaler. Yes, you got to open the tube when you have asthma exacerbation, the bronchodilator before inflammation. So A before S. So wait 5 minutes before using the steroid. So if they use the inhaler, they should wait for a couple of minutes before they use the steroid so that the albuterol can take effect. Clean the inhaler mouthpiece weekly. You need to clean it more frequently, maybe 3 times a week. Therefore, number 2 is the right answer. And next is teaching about Samithro. We've seen it. It's used for what? Long acting, which client management indicate the need for further teaching. They don't understand a long management medication. You see the way I'm approaching it, breaking it down. Management, NCLEX review questions, NCLEX question and answers, using fundamentals of test-taking strategy to help you master these respiratory drugs in these questions. You can see, I hear about Samithro. The first thing I tell myself, long acting. If I need further teaching, they're not doing something regarding what? Long acting. I will use this when I start wheezing. Think about it. This medication will help me during an asthma attack. I will take it twice daily for a long-term control. This replaces my rescue inhaler. I will still need to carry what? Albuterol with me. These questions shows up on the NCLEX. The concept I'm using is the same thing they will write when they're trying to test you about Samithro. So watch these questions, pay attention, and know how they're going to trap you. Further teaching regarding Samithro. I will use this when I start wheezing. Negative, you should not use it. It's not a rescue agent which you intervene. This medication will help me during an asthma attack. 1 and 2 are saying the same thing. If you pick one as an answer, pick number 2 because it's talking about acute situation. I will take it twice daily for a long-term control. You can see 3 contradict 1 and 2. Therefore, 3, it does not need further teaching. It's a good thing. It means long-term management. This replaces my rescue inhaler. No, it's saying the same thing as 1 and 2. It doesn't replace your rescue inhaler. It's used for long-term management. I will still need to carry albuterol with me. That means I will still need a rescue agent. And that is true. Therefore, which one need intervention? 1, 2, and 4. Thank you for watching. And you can see how I'm approaching it. I want you to master this pharmacology, respiratory drug, respiratory pharmacology test. A client using inhaled steroid, it's a steroid. The name does not matter. Ask how to avoid side effects. What should the nurse emphasize? Increase fluid intake. Avoid diarrhea with the inhaler. Use a spacer. Take the inhaler only at night. Think about it. I'm inhaling steroid and I want to prevent what? Complication associated with it. Fluid has nothing to do with the steroid. It has no correlation with that. The only thing that delivers the steroid is a spacer. You can use the spacer or not. Therefore, if I use the spacer, it's going to concentrate it and get me into where enough medication into the lung to help me find symptoms. Therefore, that one is more important than avoiding diarrhea with the inhaler. It does not answer the questions whether it make it effective, and there's no correlation. Take the inhaler only at night. You're supposed to take it twice a day. Therefore, 4 is wrong. Number 2 is the right answer. So the next question is what? Number 6. A nurse is providing teaching instruction to a client with a new diagnosis of asthma. Which med the nurse should instruct the client to avoid? There's certain medication, if you have asthma, you should never take it because it's going to worsen your situation. Is it NSAID? Is it Mucomist? Is it acetaminophen? Is it metoprolol? And is that enalapril? There is concept regarding each answer choice. Stop the video. Tell me how many answers you've answered so far. We are on number 6. Did you get 6 out of 6 or 5 out of 5? Let's get to it. NSAID is not good. It can lead to what? polyp, nasal polyp, and worsen the asthma attack. Therefore, they should avoid it. Mucus mist will give them more secretion. There's no secretion in asthma that can cause bronchospasm. They should avoid it. Acetaminophen is good. If you avoid NSAID, then you should take acetaminophen. Metoprolol is what? Beta blocker. But what? It's a selective beta blocker, which is good in asthma. Balm is good in asthma. That means what? Misoprolol, atenolol, and metoprolol. These are medications that asthma patient can take, even though it's a beta blocker. Enalapril can cause cough, and this cough can worsen asthma attack. You see, you know the content, but I'm putting it back together to be able to answer this question. These are concepts. NSAID, mucus mist, enalapril, ACE inhibitor, which causes cough, should be avoided in asthma patient. Number 7, which statement indicate effective understanding? That means they know what is going on. A client is prescribed what? Mantilocus for what? Asthma prevention. Key things about this medication is for long-term management, is used for exercise-induced asthma and allergic rhinitis. Therefore, these medications very important. Based on that, what do you think? I will use it when I feel short of breath. I will take these before exercising to help me prevent symptoms. This medication acts immediately to stop wheezing. I will carry this at all times in case of emergency. Think about it. Put down your answer. I give you the content from the beginning. It's used for long-term, exercise-induced, and allergy-related asthma attack. You cannot carry it all the time because it's not used for emergency, right? I will use this when I feel short of breath. It's not used for emergency. 1 and 4 saying the same thing. I will take this before exercise to help prevent my symptoms. Prevention. This medication acts immediately. It's not the rescuer. Therefore, 2 is the right answer. And this is caring for a client prescribed what? Trophylline. This is also what? Beta agonist. But they're different from albuterol. They are long-term beta agonists, which findings should the nurse report immediately. What does beta agonists do? They speed things up. What do you think? Restlessness, nausea, tremor, heart rate of 65. What do you think? Heart rate of 65 is normal. Tremor, things are going up. Nausea, things are going up. Restlessness, things are going up. But don't get trapped. Just because you see restlessness and you know at certain system is very important in this situation, it's not because it's due to beta agonist. Tremor too is that. But tremor take precedence in this situation because it indicates more to what? Trophylline toxicity than restlessness. So number 3 is your best answer choice. And let's prepare to administer budesonide, right? Budesonide via what? Nebulizer to a client with asthma. Which intervention should the nurse implement to ensure proper medication delivery? This is just asking you MDI, medication delivery of steroid using what? Nebulizer. There's teaching you have to provide for the patient when they're using it. Should they avoid typing the nebulizer chamber during the procedure? Medication administration fundamentals here. Have the client rinse their mouth after the procedure? Same thing, right? Assist the client to a sitting position greater than 45 degrees. Place the mouthpiece between the client's lips. Instruct the client to perform deep breathing before the treatment. Pharmacology test. Put down your answer. This is NCLEX review as we review the content and we do NCLEX questions and answers. So what do you think? What do you think? What should they do as they teach the individual to implement proper medication administration? This is a concept. Avoid tapping the nebulizer chamber during the procedure. It's not a good teaching. They should tap it rather. Tapping it allow the medication not to stick inside the wall and deliver enough amount into your lung. Have the client rinse their mouth after the procedure to prevent what? Trash. So that's good, right? This is to proper assist the client to in the sitting position greater than 45 degrees. This allows your lung to expand and take all the medication. Place the mouthpiece between the client's lips to make sure it's really, really tight. Instruct the client to perform deep breathing before the treatment. This can be a trap. A lot of people may pick this, but deep breathing is done during, not before. You take deep breathing during the inhalation, not before the treatment. Therefore, number 2, number 3, number 4 are the proper teaching. The client is using mid-dose inhaler, MDI, with no spacer. These answer the same questions as the previous one. If you know it, you can answer this. Which action by the client requires correction? That means intervention. Shaking the inhaler before using is the same thing like tapping it so they can mix well. Inhale slowly when pressing the canister, like the last question where the inhalation occurred before, and I said it should occur during. Holding breath for 10 seconds after inhaling to allow everything to go in. Exhaling immediately after pressing the canister. That means you're pushing all the air out. You need to give yourself time to do that. Therefore, which one is the right answer? Number 4 is wrong. You should not exhale right away. It's a slow exhalation to allow wait. At least you got to wait a few seconds then before you can exhale. Number 11, once again, are you keeping track of it? How many questions have you had? Do you remember all these medications you've seen and the key fact about them? And then caring for a client with what COPD prescribed ipatropine. This is what? Anticholinergic. What is it used for? Fast acting. Therefore, used in acute situation. Which side effects should the nurse monitor for? It's anticholinergic. It does not cause hypotension. It causes dry mouth. It does not cause sedation. It does not cause hypoglycemia. What do you worry about? Number 2. And nurse is teaching a client how to use guanfacine. Which instruction is most important? You have to know what is guanfacine. Take a look at the answers. Take it at bedtime to listen secretion. Drink plenty of water throughout the day. Avoid taking with food. Limit use to once daily. What do you think? Have you heard about guanfacine? I know you've heard about it. You've taken it over the counter. Are you using the proper method? This question demonstrates that. The key concept to answer, guanfacine is expectorant, right? It helps thin and loosen your mucus, and you need fluid to be able to do that. Even water activates guanfacine, therefore it's needed for its activity. If you take it at night, you're going to have more secretion and you cough, and you're going to worsen your night sleep. Drinking plenty of water is needed to allow the guanfacine to work. Avoid taking with food. There's no indication that you can take it with food or without food. Limit use to once daily. You take it every 4 to 6 hours. So you don't need to limit use to once daily. Therefore, the right answer is what? Number 2, drink a lot of water. And let's review discharge instruction for a client prescribed what? Cromolyn sodium. Which statement shows understanding? This is a good medication you shouldn't forget. It's a mast cell stabilizer. It's like leukotriene, but they act differently. They are very preventive. They are used for long-term use. That's the thing. Long-term is used preventive measures, right? Not acute situations. So look at the answer choice that says something out of the ordinary. I will use the medication for a quick relief. No, it's not for rescue. I will take it every day to help prevent attack. Sound like better idea because it's for prevention. It will help loosen my mucus. It's not guanfacine. I will take it only when I feel wheezing coming on. It's not the rescue agent. Therefore, the right answer is, as you can see, every day to prevent attack. Number 2. And nurse is preparing to administer IV aminophylline to a client with asthma. What should the nurse monitor closely with? If you don't know, remember this, aminophylline, we saw trophylline. And trophylline, aminophylline are the same. Pharmacology, how do you remember them? Pay attention to the last name. I see aminophylline and I know theophylline. Whatever I know about theophylline, I should add it to aminophylline. What should you worry about is a beta agonist. And beta agonist is speed things up, right? And they're going to do what? Your blood glucose may go up. Your respiratory rate may go up. It does not affect your sodium and potassium. But what would they do? What is the most important thing regarding this medication right here? This medication, very, very, very important. It causes seizures. And the first thing you should worry about is seizures regarding aminophylline. Therefore, that should be the right answer. 15. Last one. Think about it. Stop the video. Answer this question. Put down in your answer. This is a straightforward, but I want you to know this drug. Acetylcysteine. Client with what? A client with what? Pneumonia is prescribed acetylcysteine. What is the intended effect of this medication? Reduce inflammation, suppress the cough reflex, loosen and thin mucus, dry up secretion. Acetylcysteine, if you don't remember it at all, is used in cystic fibrosis. What does cystic fibrosis have? Too much mucus. Therefore, how should I take care of the mucus? Break things down. Therefore, what is the function of acetylcysteine? Loosen and thin mucus. It does not reduce inflammation. It doesn't suppress your cough reflex. It doesn't dry up. It's designed for what? Luxing it. That's why we use it for cystic fibrosis. These are the medications we'll be covering. As you can see, different classification. And I'm going to give you key mnemonics, high yield questions, and you will love to know how to solve these questions. First question. It's not that difficult. It's based on concept. Which side effects should the nurse monitor for? A nurse is caring for a client receiving ondansetron IV for nausea. What do you think? Shorten QT intervals, torsades de pointes, respiratory depression, hypertension. If you go for the words in the question and the answers, you'll get it wrong. But go for the buzzword. The buzzword is what? Ondansetron. Ondansetron is antiemetic. It's one of those medications that have specific side effect. What is that specific side effect? Look at the answer choice. It's a shorting QT, torsades de pointes, respiratory depression, hypertension. This is not one of those questions you see respiratory depression and you pick it. It has nothing to do with that. It has something to do with QT prolongation, right? It doesn't shorten QT. If he's shorting QT, that's not that medication. So that number one is wrong. Test taking strategy 1 and 2 saying the same thing, but you don't see it. If you look at it carefully, torsades de pointes are caused by QT prolongation, no QT shortening. Therefore, one which is a QT shortening is a wrong answer. QT prolongation is number 2, which can lead to torsades de pointes. That is the biggest side effect of ondansetron. And this is the mnemonic to remember that. Ondansetron is a Zofran. That's the trade name that we are. It's a Zoflat QT, right? Zofran, quick onset, flattening Q8, report palpitation. You're giving us IV slowly and nausea medication. This is the mnemonic you would like to know. You can take a picture, but this is your friend for any question on ondansetron. Number 2, which action should the nurse prioritize? Prioritization 101. A nurse is caring for a client with Crohn's disease, prescribed what? Adalimumab. This is one of those medications we can use for Crohn's disease for anti-inflammatory effect. It's an immunomodulator. Based on that concept, immunomodulator, use that buzzword. Go for the buzzword. Immunomodulators, what do you think? Should I check CBC? Should I place Matos test? Should I check urine culture or should I check blood culture? The concept, immunosuppression. You don't want the individual to get sick. I put a bunch of answers there to trap you. CBC, urine culture, blood culture is talking about infection, but that's not the purpose of these medications. We want to prevent the infection before it comes. Therefore, I got to check your PPD because if you already have PPD positivity, it's going to reactivate you. So placement of Matos test is the right answer. 1, 3, and 4 are saying the same thing. And this is the mnemonic. Avoid disease activation in adalimumab, which would assess for TB, decrease immunosuppression symptoms like risk of infection, and avoid live vaccine. Every time you see this medication, think about avoid disease activation. Number 3, which medication should require clarification if prescribed with sucralfate? Go for the buzzword. The buzzword is sucralfate. Focus on that. And nurse is reviewing medication interaction. That means something that can interact with what? Sucralfate, omeprazole, acetaminophen, antacids, loperamide. This is a concept that is always taught. Sucralfate is a cement. It's going to coat the inner surface of the stomach. We don't want anything to disrupt the coating of the inner surface of the stomach. Antacid is going to be a problem. You should avoid antacid within 30 minutes of taking sucralfate. So that is your right answer choice. Omeprazole, acetaminophen, and loperamide does not affect sucralfate effect. Therefore, what is the mnemonic? Sucralfate stick up late, right? It's sun sensitivity. It causes your urine to change. It can affect your blood level. Folate level will be affected and assessed for what? Skin rash. It stick things up. What is the problem with antacid? We call them the scams, right? They separate from what? Other medication because of the explanation I gave you. 1 to 2 hours, at least 30 minutes before you can take any medication. Antacids are bad. It causes constipation, which one? Calcium and aluminum. You should avoid in kidney patients who have buildup of magnesium. So magnesium product for antacid you should avoid. It can lead to magnesium diarrhea related. Is safe for occasional use only, so no more than 2 weeks. So they are called SCAM. These are your mnemonics for what? GI medications. Which client statement indicate correct understanding of the medication? That means they understand. That's all. I've summarized it in my own way. Understand which medication? Omeprazole. How do you understand it? Okay, is a PPI, right? Therefore, because he has last name of what? Zol. I will take this on an empty stomach before breakfast. Think about it. It's taking it before you eat so that you can block the acid. I will chew the tablet if I can't swallow it whole. This medication comes as a capsule. Do you think you should swallow and crush it? I can stop taking it once I feel better. Well, you can't stop taking medication on your own. It helped decrease my stomach pH. This is the trap. It helped decrease your stomach what? Acid, not the pH. When the acid go down, right? What do you think your pH will happen? When acidity go down, the pH goes up. So if there's no acid, pH should go up, not decrease your pH. So no answer 4 is not the right answer. The best thing is to take it on an empty stomach before breakfast. Watch for answer choice 4 so that you don't get trapped. What are the prozole? They end with the what? The zol, right? It top the antacid, right? These are one of them. Omeprazole, pantoprazole. And what is the acronym for that? The mnemonic. Protect stomach lining. There's a risk of fracture. It can lead to osteoporosis if you take it for a long time. It can also have causes C. diff. Those are the things you shouldn't forget. C. diff, fracture, and then B12 deficiency. So watch for those things, decrease calcium, and then osteoporosis. Which client statement require follow-up? And let's provide digital teaching for a client prescribed what? Misoprostol. This is not a medication that you take often. It's ibotogenic, but we give it to patients to prevent NSAID-induced ulcers. That means NSAID. If you take NSAID and you're going to develop ulcers, we'll give you misoprostol to protect the inner lining of your stomach. We use it for people who have what? Osteoarthritis that can take NSAID for a long time. It can lead to what? Ulcers. So these medications are used for that. Therefore, which one? I will use as contraception while on this medication. This will help prevent stomach ulcers. I take this medication to help with my arthritis. I might have some cramping or diarrhea. Think about it. It's a misoprostol. It's stimulant also. It can activate your GI tract so you can have cramping and diarrhea, right? It can prevent ulcers. Like I tell you, NSAID-induced ulcers are prevented by misoprostol. Because it's ibotogenic, you should take what? Birth control so that you don't get pregnant. You don't take it to prevent your what? Arthritis. It prevents NSAID-induced ulcers. Therefore, the patient does not understand that. The client is prescribed metoclopramide. Which assessment finding will require immediate action? This is antiemetic. One of the biggest side effects is what we're going to talk about. It increases what? Appetite, involuntary muscle twitching. It causes fatigue and dry mouth. One of the common side effects is diarrhea. One of the worst side effects, it acts like antipsychotic. Do you see antipsychotic answer choice there? Put down your answer. I want you to jot it down and let me know what you think. You can see that number 2, involuntary twitching is tardive dyskinesia. So those are the side effects associated with metoclopramide. How many answers have you get so far? I hope you have 6 out of 6. But if not, this is for you. Watch it multiple times, take notes, and pay attention to this medication because they will show up on your NCLEX. And next is teaching about what? Lactulose for hepatic encephalopathy. This is one of the medication that you see it in nursing school or NCLEX, which client statement indicate correct understanding. That means indication, understanding of lactulose. What are they saying? It helps lower my ammonia level. I should stop taking it if I have diarrhea. This may make me feel more confused at first. I will monitor for constipation. I should take this medication only once a week. 2 to 3 loose stool means the drug is working. What do you think? Hepatic encephalopathy means you're confused from what? Buildup of ammonia. Lactulose will help you get rid of the ammonia by having diarrhea. Therefore, 2 to 3 loose stool is how you titrate it to make sure you're clearing your ammonium. Anything greater than 2 to 3 loose stool is a problem. The idea is 2 to 3 loose stool. So 6 is good. I should take this medication only once a week. No, it's not given once a week. It's titrated to normal stool. I will monitor for constipation. No, it causes diarrhea. This may make me feel more confused at first. It doesn't cause confusion. It helps your confusion to go away. I should stop taking it if I have diarrhea. No, you should not stop taking it, right? I should stop taking it if I have diarrhea. The medication work by giving you diarrhea, but if you have excessive diarrhea, then you can stop it. It will lower my ammonia level. That's what it does. Selected apply. Those you know you're confident. If you know only one, pick it. There's only 2 answer choice there. If you pick more than that, you lose points. 1 and 6 are the right answer. And this is caring for a client prescribed what? Docosate sodium. This is a stool softener. How does it work? It softens the stool and prevents you from straining. Therefore, based on that, which scenario in this medication is most appropriate? A client with diarrhea after antibiotic use. You have C. diff and you're having diarrhea that's infectious. We don't give you stool softener to do that. A client who should avoid straining during bowel movement. Sound like the right patient, right? A client with hepatic encephalopathy, we give you what? Lactulose, no Docosate. A client with what? Suspected bowel obstruction, we don't give you stool softener. We got to relieve the obstruction. So which one is the most appropriate? Is number 2. Once again, stop the video, answer the question, see the way I approach it. If you get it wrong, put it down in the comments and let me know. We are on number 9. How many have you got so far? And next, review a prescription for loperamide. Do you remember this? I know you know it. What do you think? This is what? Diarrhea medication. It makes you constipated, which client condition is contraindicated. You see, I take the buzzword and I use it to answer the question by saying diarrhea is going to cause constipation. Therefore, if you're already constipated, I'm not going to give it to you. Is that right? That's the way. Or certain conditions should not get it. A client with traveling diarrhea, you having diarrhea, I can make you constipated by giving you loperamide. A client with fever and bloody stool, you have infection. You don't need to be what? Constipated, because the infection needs to get out of your system. A client with mild irritable bowel syndrome, if you have a lot of diarrhea, we can give you loperamide to slow you down. A client with what? Post-operative loose stool, we can give you something to slow you down. Therefore, bloody diarrhea and fever is contraindicated in the patient with what? Loperamide. The client prescribed pancreolipase. We use it for pancreatic insufficiency. Therefore, if you eat anything that need the pancreas to be digested, like fat, we need to take it with the medication. That's all. This is the way you approach question. read the question, know the concept you're going to bring with you, and then look at the answer choice. Which instruction should the nurse include? Take this before meal and snack. Oh, if I'm eating and there's fat and other thing, should I take it? You be the judge. Crush the capsule for easier swallowing. Capsules are not supposed to what? Crushed. Take this medication at bedtime. It's taken with food. Limit protein while on this medication. That's not what it does. Therefore, which medication, which instruction is the best one is what? Take it before meals and snack. And nurses review medication order for several clients prescribed what? Dicyclomine. What is the function of this medication? This is pharmacology review, pharmacology test number 5, NCLEX review questions, NCLEX questions and answers. And we're using it to do our what? Pharmacology test. So whenever I read the medication, I give you what it is. Pharmacology for dicyclomine is what? Anticholinergic. It slows things down. Which client should the nurse question this prescription? Which patient situation should not be associated with what? Anticholinergic. If you have diarrhea, I can slow you down. If you have dry mouth, occasionally, I can make your dry mouth worsen a little bit. If you have angioglycoma, I can make your glaucoma worsen forever. If you have irritable bowel syndrome, I can make you have constipation a little bit. All of them may have some idea of trouble, but whose trouble, whose situation? If you have 1 second, if you're taking care of this patient, if you see this question and the NCLEX, what answer choice will you pick? And know you're going to choose the right one because you got to be sharp. And what does be sharp means? Breathing issue, electrolyte, shock, sepsis, airway, and then pain. Pain that is going to affect what? Your life, limb, eyesight. I see eyesight there, which is what? Glaucoma. And therefore, number 3 is your right answer. A client with GERD is prescribed what? H2 blockers. They do different things. They bind H2 receptors. They are the tendins that are associated with what? Antacids or acid secretion or GERD. Therefore, which statement indicate a need for further teaching? They're not saying some things that is right with the medication. I will take the medication with meal. That's what he's saying. Do you think it's okay? I can smoke less now since my reflux is associated. Should you smoke while you have GERD and taking medication? This helps reduce my stomach acid. Does that H2 blockers reduce your stomach acid? I should avoid alcohol with this medication. Of course, no alcohol. It reduces acid. You should not smoke, and you take it with meal or 30 minutes before meal. 2, need further teaching. And what is the key associated with them? H2 blockers. This is the key. You take at bedtime, interact with other medication, don't take it with any antacid, increase the pneumonia formation, and then what? It causes what? NSAID in some patients. And nurse is review medication for a client with a new colostomy. Which order should the nurse clarify? Think about it. Which order should the nurse clarify? What does the patient have? A new colostomy. A new colostomy, you don't want them to be constipated. Which medication is going to cause constipation? Simethicone, take care of your gas. Sodium doxate, help you not to strain, help you stool passes easily. Psyllium is a bulking agent. If you don't know the number 3, diphenocylate atropine, which is like what? Lumonol, is like loperamide. They all causes constipation. Therefore, this patient should avoid number 3. A nurse is reviewing medication for a client newly diagnosed with what? GERD. The provider prescribed what? PPI. What is the primary purpose of that? This is the good question I said. I just want to test your mind. PPI, what is the purpose? I'll show you how to answer some questions if you don't have no idea. Look at the answer choice. Neutralizes acid in the esophagus. Blocking acid-producing pump in the stomach. Increasing gastric emptying. Forming a protective barrier over stomach lining. When you finish reading, say, oh, this is describing, this is a descriptive answer choices. And the question say, prescribe what? PPI, proton pump inhibitor. If I'm picking an answer choice, I'm going for something that has proton, it has pump, and it has inhibitor. I see neutralize in number one. I get rid of it. I see block. I see pump. Hey, acid, you may be my answer choice. 3 said increasing. There's no proton, no pump, no inhibitor. And then there's formation of protective barrier. It doesn't say proton, pump, inhibitor. Therefore, 2 is the right answer. And this is some of the mnemonic associated with the PPI, which we saw already. Nurse has received the morning report. Which medication should the nurse administer first? An antacid for a client with indigestion, a PPI for a client with the history of peptic ulcer disease, retinoidine for a client with what GERD, and a proton pump inhibitor for a client scheduled for surgery. The key word is what? All of them need their medication, but the most important is pre-op medication. Take precedence over everything. So give it to the patient who is going to surgery to prevent aspiration. And this is providing district teaching to a client prescribe what? Sulfasalazine for what? Ulcerative colitis. Which statement by the client indicate a need for further teaching? These are sulfur drugs. These causes stones. Therefore, you need to drink a lot of water. You got to watch for photosensitivity. It can affect your blood level. It can cause agranulocytosis, pancytopenia. Those are concepts I want you to know and use it to answer the question. I will drink plenty of water, fluid while on this medication. I might have orange color urine. I will stop taking it if I get headache and nausea. I need regular lab tests while on this drug. The blood level need to be checked. You don't need to stop it if you have headache or nausea. Common side effect, your urine is going to change color, and you got to drink a lot of fluids. VI pharmacology. Top tested neuro drugs. First question, what is the priority action? I said this question because it's always a trap. A client prescribe diazepam as what? Slurred speech and difficulty to arouse. What is the priority action? You have to do 1 second, do it so that the patient doesn't get into trouble. What is the next step? Read the answer choice. It said what? Administer naloxone, provide high flow oxygen, give flumazenil, and notify the charge nurse. Before you answer the question, go with the buzzword. There's one buzzword in the question. Patient was given diazepam. This is what? Benzos. What does benzo do? Depress your neurological status, your respiratory status. Patient has a slurred speech. That means having side effect associated with diazepam. Give them the antidote. That's all. That's your priority action. Notify the charge nurse is not going to help. Giving them medication that doesn't respond to that medication doesn't help. Naloxone is for what? Opiate. It's not benzos. We have benzos. What is the antidote for benzos is what? Flumazenil. Once again, flumazenil. And that is number 3. Providing high flow oxygen does not solve the problem. All these questions, this is a warm-up. But all the questions are straightforward and clear. Start short. Stop the video, answer it, put it in the answer choice, and then let me know as you listen to me. Next question, critical thinking question. What you know, I put it in the critical thinking. What is the next best action? Priority action. And next case for a client, what? Pregnant, who has what? Epilepsy, who must what? Continue phenotime therapy. Wait for a second. Think about the question. Pregnant lady has epilepsy, number 2, and I'm taking phenotime. Something should tell you, why do I combine 3 things in that situation? Because when you're pregnant, you should not take anti-epileptic, which is what phenotime is, because it causes neurotube defect. But what? The question says, who must continue? That means can't stop the therapy. That's the buzzword. Therefore, if you see answer choice that says stop the medication, it's a wrong thing. Test taking strategy. What is the next best action? Recommend switching to valproic acid instead. Administer high dose folic acid supplementation. Discontinue the medication immediately and instruct the client to double dose every other day. Stop the video. Think about it. 10 seconds. Answer it and play the video. Think about it. Which answer choice you want to choose? Patient cannot stop phenotype. Go back to the pathophysiology of the medication. Phenotype, the reason why they causes neurotube defect, which valproic acid do the same thing because they interrupt folic acid metabolism. Switching from phenotype to valproic acid has the same teratogenic effect, right? Discontinuing the medication, mommy is going to have seizures. You're doubling the dose every other day. It's not going to help. You're taking the same thing. What you need to do is to block the effect of the phenotype on the baby. And that is what? Folic acid. That will prevent neurotube defect. Number 2 is the right answer. When you see this question anywhere, always remember folate. What is the next priority instruction? What would she do? A client with epilepsy is prescribed what? Phenotype. Another thing you need to know about phenotype specific is what this question is asking you. Take with milk. Is it okay? Use soft Bristol toothbrush. Is that appropriate? Stop medication if rash appear. What do you think? Take antacid for stomach upset. What would you do? Think about it. Once again, stop the video, 10 seconds. But I'm giving you content so that when you see these questions, you watch these videos multiple times, take note. I want you to take note. When you see them, these are the things they will ask about this medication because those are the high yield fact on these NCLEX questions. Next is questions on pharmacology regarding neuro medication. Phenotype, you should avoid protein. They hate protein. Is there any protein there? Maybe some milk, right? Protein, right? So you shouldn't take it. They hate it. It causes gingival hyperplasia. Do you see it there? That is what soft Bristol toothbrush means. That means your tooth doesn't bleed, gum bleed. So easy on your tooth and your gum. Stop medication if rash appear. Of course, that is what? Steven-Johnson syndrome, bad effect of phenotype. But you should not stop it right away because then you get a rebound. You should let the nurse know or the doctor know. Antacid will affect absorption. Number 2 is the right answer. This is another medication, carbidopa, levodopa, you should know for Parkinson's disease is coming, whether you like it or not, in nursing school or the NCLEX. Jot down all the things I'm going to say and remember them and never forget them again. But we'll make it straightforward, not beating around the bush in the easy way, right? Which statement indicate a need for the nurse to intervene. They're saying something wrong about what medication? Carbidopa, levodopa. We use it for what? Parkinson, right? Because they need what? Dopamine. What are the things you need to know about it? Answer this, select or apply. And then if you get it right, let me know. If you don't get it right, it's okay. These are the things you have to know about it. What are the things you have to know? I take my high protein shake right after the medication. You should avoid protein with carbidopa, levodopa. If a patient is on tube feed, you stop it 2 hours. I expect my tremor to improve in a few days. Well, they don't. It takes some time. I change position slowly to prevent dizziness. This is a good thing because it causes orthostatic hypotension. So change it slowly. My urine may look darker than normal. Yes, it changed your urine color, black, brown, red. So that's good. I stop the medication if I notice facial twitching. You can do that. That is side effect, tardive dyskinesia, but you can't just stop it. You alone cannot stop medication. You have to let the doctor know. I receive this medication as a monthly depot injection. It's given as oral medication. These are the things you have to know. The major side effect is tardive dyskinesia, which is number 5, but you cannot stop it. Okay, your urine color is going to change. It's going to cause orthostatic hypotension, and you should avoid high protein diet. So 1, 2, 5, and 6 need intervention. Which of the following the nurse should anticipate as early signs of what? Toxicity. What medication? Phenotype. Patients prescribed phenotype. What should you suspect as toxicity? They are used for neuropsych issue. Every time they give you a medication for a system, the major side effect always goes to the system. That's my strategy. A neuropsych medication for seizure, when I'm taking it, side effect will also associated with that. The early signs of phenotype is mostly neurological problem and a slight GI symptoms. Nausea, GI, right? Vomiting, but it's related to neuro. When you're having brain problem, you're going to have nausea and vomiting. It causes horizontal nystagmus. Your eyes is twitching back and forth and slurred speech. Those are all neuro. It does not cause hyperglycemia. So 1, 2, 3, and 5 are neuro side effect or phenotype, early side effect. Of course, it can cause ataxia, other symptoms associated with it, right? Gingival hyperplasia, but those are not on neuro. Ataxia is a neuro, but remember, major early side effect is neuro. If you don't take care of it, they go into coma. Which teaching by the new nurse demonstrate correct understanding of the medication purpose. What medication? Levetiracetam. Why? Patient is prescribed what? Levetiracetam for what? Brain tumor. A new graduate nurse is caring for a client with a brain tumor. And he prescribed this medication. What is the purpose of it? This is a neuro medication. This is test-taking strategy. Think about it. Don't answer it. You don't even know the medication. I know most of these medications, neuro medications, are mostly anti-epileptic. That is the best, except few of what? Maybe Alzheimer's or Parkinson, but most of them are anti-epileptic. That's what they're going to ask you. If it comes to the shelf, you don't know anything, I would think about it as an anti-epileptic, but this is a common anti-epileptic. It's called Keppra. We all know it, but the rare name is levetiracetam, right? What is the purpose? It's anti-epileptic. You have brain tumor. I'm giving you anti-epileptic. Well, the medication will do what it's used for. The medication will shrink your tumor. That is not anti-epileptic. Medication reduce brain swelling. That's not anti-epileptic. Medication help prevent seizure. Oh, that sounds like anti-epileptic. The medication is used to manage agitation from the tumor. It causes agitation. That's the major side effect. It's another side effect. It can increase seizure, suicide ideation. We don't use it to manage the agitation. You have to give somebody something, another medication to manage the agitation. So seizure prevention means what? Number 3, which sound like prophylaxis for seizure. Test-taking strategy. Which side effects should the nurse report immediately in a client taking valproic acid? Most of these questions you can see, I just give you the most important information, straightforward. Don't beat about around the bush. Single 2-line question, not too many lines. That's what the NCLEX is going to give you. It doesn't give you anything away. Valproic acid, stop it. Think about it. How have you done so far? 7 questions. I know you answer all of them, right? Because you watch Adapting class. Valproic acid, what is the problem? Think about your liver and your blood. It causes hepatic toxicity and it causes thrombocytopenia. It can cause aplastic anemia. That means your platelet go down. And then what? It can cause pancreatitis too, and also liver dysfunction. Which of this should you worry about? Nausea, hair loss, yellow, sclera, and weight gain. I told you what? Platelet problem, I don't see platelet problem. GI symptoms, I see nausea. Liver, I see yellow sclera. Which one would you pick, nausea or yellow sclera? Yellow sclera means your liver is in trouble. Bilirubin is elevated. That's what I'm going to pick. Weight gain and hair loss is not associated with it. Which of the following should the nurse prioritize? Prioritization 101, something that is going to kill the patient, right? You have to be sharp. A client taking carbamazepine, another anti-epileptic, develop a sore throat and fever. Which of these should you prioritize? Go back to the buzzword. Go to carbamazepine and ask yourself, what is the key for carbamazepine? What is the key for carbamazepine? Because it's agranulocytosis. Therefore, I'm looking for signs of agranulocytosis. Your NCLEX is not going to give it to you. Let's recap. Agranulocytosis. There's not going to be a word for agranulocytosis. You have to translate it to what? Agranulocytosis. Which is that? Reassured it is expected. It's not expected. Sore throat and fever is bad signs. Encourage rest. Fine. It does not answer the question. Notify the provider. Does that answer the question? Administer ibuprofen. You're treating the sore throat and fever. Therefore, just by elimination, number 3, stand alone. You are not doing anything. Just letting the doctor know probably will help you that, oh, this is agranulocytosis. But 4 said treat it. 2 said just let them rest. And 1, you're just doing nothing. So 1, 2, and 4, not doing nothing. 3, you're escalating care. Doctor will know that this is agranulocytosis, and therefore it will take care of it. I just put it there so that you know sometimes notifying the doctor is maybe the best answer because the other ones doesn't mean anything. Which statement indicate? The nurse indicate understanding. A nurse teaches a client with what? Levodopa, carbidopa. I'm going back for recall. This is the way I can help you recall the information we talk about. The major thing I told you about this guy is what? Dizziness, orthostatic hypotension. Your urine color is going to change. You should avoid protein. It causes neuropsychotic issue, tardive dyskinesia. Do you see the answer choice there? Does the patient understand this medication? He said, I'll eat high protein meal with the drug. It's okay. Will cure my Parkinson. Do you think it will take care of it? I report involuntary movement. Do you see it there? Dizziness is expected. It's not expected. Do you think so? We all know dizziness is expected. Orthostatic hypotension is expected, right? Involuntary movement is what I call tardive dyskinesia, right? That is what is there. I'm not going to put tardive dyskinesia. Should not expect the NCLEX to put tardive dyskinesia, but the answer choice is there. This is how you got to apply some common sense and test-taking strategy in looking for answers that you already know. I'm hiding it, but you find it because you watch Adapt NCLEX, and you should give yourself a pat in the back. It will cure my Parkinson. No medication cure neuropsychotic issue. You should avoid high protein diet. 3 is your right answer. Which client should the nurse question a prescription for benztropine? And let's care for several clients on the neuro ward. Which client? Client with glaucoma, bradycardia, tremor, depression. Let's do some work. Benztropine, you may not know what it is, but look at the last name. Always pharmacology, look at the last name. Does it look like something you know? If you take B-E-N-Z from there, it has tropine. What can you put in front of it? That sound like something you've seen. Atropine. So, atropine is used for what? To help with your anticholinergic effect, right? That is what it does. Atropine, anticholinergic effect. If you take the Z from there, it becomes atropine, anticholinergic effect. Therefore, this medication is anticholinergic. Which condition anticholinergic is bad? When you have bradycardia, if I give you atropine, your heart rate goes up. It's a good thing. Tremor, depression, right? But glaucoma, if I give you anticholinergic, you're in trouble. You worsen your glaucoma, increase your intracranial pressure. Therefore, number one, we should worry about it. And nurse care for a client prescribed lorazepam, which is benzos. It depresses your neurological status, your respiratory status. Therefore, what do you think? Sedation, dizziness when standing, shallow respiration, and drowsiness. All of them are bad. But which one is bad? Bad of all badness, right? Number 3, shallow respiration. Which of the following instructions the nurse should prioritize? Prioritization 101. About which medication? Topomax, right? Topiramate, or you can say Topomax. It's the same thing. Is anti-seizure medication. If you don't recognize it, I say go back to anti-seizure medication. But now you know that it's anti-seizure medication. Which one should you prioritize? Increase your sodium, schedule a doctor, visit, expect increased sweating, and take with milk. Don't take with milk. Don't increase your sodium. One of the biggest side effects is it causes glaucoma. Therefore, you should go see your surgery. Ophthalmologist, number 2. These are little things. If you know about this medication, trust me, when they ask you, the answer choice is popping out like a candy. Like I know Topomax, I need to worry about what? Glaucoma or eye problem. I need to go see a doctor. That's all. The rest, know that it's used for seizures. And if it's used for seizures, it's a sulfur drug because it's all the sulfur drug symptoms. Which a nurse care for a client prescribed gabapentin, right? Gabapentin, prescribed gabapentin. It's also anti-seizure medication, but it can be used for other things. Which of the following instructions the nurse should prioritize? Take the medication in the morning to prevent insomnia, expect rapid pain relief, avoid driving for a few weeks, and increase dose if pain returns. It's used for seizure medication, but it's good for pain management, neuropathic pain. It causes sedation and weight gain. Don't forget, sedation and weight gain. Therefore, taking in the morning is going to worsen your sedation, right? It doesn't prevent insomnia. It makes you sleepy. It doesn't work right away. It takes some time. You should avoid driving a few weeks because then you can, so that you can know how the medication is going to respond to you. Don't increase the dose if the pain returns. You got to talk to the doctor. Number 3 is your right answer. Which assessment finding should the nurse prioritize? The nurse care for a client taking lamotrigine. Once again, anti-seizure medication. Like I told you, most of them, they have anti-seizure medication. But I told you it's used for epilepsy. What should you worry about? Fatigue, diarrhea, small purple rash on the torso, increased appetite. This is to give you all the content regarding sulfur drug. Most anti-epileptic are sulfur drug. As soon as you're able to recognize them as anti-epileptic, think about it as sulfur drug. Sulfur drug, they call the biggest side effect is what? Stevens-Johnson syndrome. Otherwise, they causes other things. They cause stone formation, right? Kidney stone. You got to drink a lot of water. Avoid being on the sun for a long time. So one of the major side effects, small purple rash on your chest, and that's Stevens-Johnson syndrome, number 3. Valproic acid, we've seen it. I'm testing you again, and I told you it affects your liver, right? It causes pancreatitis, and it causes thrombocytopenia. Which lab work would you check? I put troponin in there to trap you, potassium there to trap you, but you know the content. You know it has nothing to do with them. Just because there's potassium there and troponin doesn't mean I have to pick it. I know the content. I'm going for the content, and that content means platelet is my answer. Do that when you're taking your NCLEX. Don't let them trap you. Don't let me set you off and pick answers you don't want to because you see it is bad. And no valproic acid causes thrombocytopenia, causes liver dysfunction. I'm looking at it and say, oh, platelet, thrombocytopenia, I pick it. And what do you think? Levetiracetam is Keppra. We use it for seizure medication. And I explained to you some of the things you should know. Stop taking it if you feel better. Is there a good teaching from a nurse? This can cause mood changes, agitation. This causes dry mouth. It needs blood level monitoring. This is the only medication that you don't need to check blood level. Levetiracetam doesn't need blood level, right? It can increase your neuropsychotic features, agitation, right? Depression, suicidal. It doesn't cause dry mouth. And you should not stop it because you feel better. Then you have a seizure problem. 17 questions, over 12 medications. Top testing 1. These are the list. First question, as you can see, a nurse is caring for a client who has a severe infection and is prescribed what? Penicillin. This is the warm-up. The client report itching and rash. What is the what? Nurse priority action. Keyword in the question, penicillin. What do you know about penicillin? It's an antibiotic. You just have to identify it. First thing, what are they asking you? Client has complaint. What is the complaint? Itchy and rash. What do you think? Something is not right with the patient. There's taking strategy, critical thinking. You have to intervene. If you don't need to intervene, still, you got to figure out what is the problem. 1 said, give the patient diphenhydramine and continue the medication. 2 said, stop the penicillin and let the doctor know. 3 said, reassure the patient, right? That itching is normal. Don't worry about it. Monitor for any signs of improvement. Number 4 is what? You don't do anything. So take it out. Then 1 and 2 and 3, think about it. Use your critical thinking. Use your test-taking strategy. Use yourself as a nurse. If you are in this situation, at least you got to do something. Do you give a diphenhydramine? Or you stop the thing and tell the doctor? Or reassure the client that this is not a problem. Penicillin, antibiotic, rash, and itchiness are never normal. Therefore, what do? Stop the penicillin and let the doctor know. Number 2 is your right answer. This is the hard one. There's 3, 4 hard ones before then I cool you down. This is the way the test is designed. A nurse is reviewing the medication list of a client being treated for what? UTI. The client ECG is shown below. You have to read the EKG. Which prescription should the nurse suspect? Is what? Test-taking strategy, critical thinking, pharmacology, using NCLEX questions and answers. So critical thinking, what do you think is the problem? Patient has UTI, being treated with some form of antibiotic. I have no clue. But then they say EKG changes. That means the concept being asked, one of these medication causes hyperkalemia, hypokalemia, hyponatremia, hypocalcemia, some form of EKG, QT prolongation. I have no clue. But if you look at the EKG, stop the video, try to answer it, and you can see that these are peak T waves. Therefore, I have hyperkalemia. Which of these causes hyperkalemia? You have to know the drug list. What is levofloxacin, doxycycline, vancomycin, and trimethoprim sulfonamide. All of them have specific side effects. And by the end of this video, you will master them. Levofloxacin does not do that. Doxycycline does not do that. I cannot give you the key fact about them because there's questions that will be used to answer that. The more we get it, we learn about that. Vancomycin does not do that. Sulfur drugs are very common. Number one, causes hyperkalemia, and therefore, this is hyperkalemia. Peak T wave, that's the cause of it. Critical thinking question, pharmacology using NCLEX questions and answers, and you're practicing using your knowledge test-taking strategy. Which of the following medication or dietary item in the client's record will require the nurse to intervene? Same thing. I had one designed to teach you that you can use critical thinking, case study, idea, and using what you know, concept to answer this question. And then for a client prescribed what? Linezolid for what? Resistant bacteria. What do you do? Stop the video. This is the way I approach it. I see selected apply. I'm going to pick something. I'm confident. Then I said, what is it? They said dietary and what? Medication. I can see dietary and medication. What is the patient is on? Linezolid. I need to identify what linezolid is. And it's used for bacteria. But what is the problem? Patient is taking these antibiotics. Should they take any of this? Tramadol, pseudoephedrine, sumatriptan, smoked ham and rice, or salami and pepperoni? Test-taking strategy, using your content. This is a practice test. I'm giving you the content associated with these antibiotics. Linezolid is one of those medications you can take by mouth. It does the same thing as vancomycin. But what is class about them? They are very, very dangerous. They have MAOI-like. That means they can act like one of the antidepressants. So they can increase your monoamine levels, MOIs, like monoamines, which are serotonin, dopamine, right? Norepinephrine, all these things, you should avoid anything that will increase that. Tramadol is a serotonin stimulant. It acts on serotonin receptors. You should not take it with linezolid. Pseudoephedrine will increase your pressure. And since linezolid is going to increase your monoamine, it's also going to do the same thing. Sumatriptan is a serotonin agonist. You should not take it with linezolid because it's going to increase your serotonin. Smoked ham, which has high level of what? Thiamine, you should not take it when you're on linezolid. Salami and pepperoni also has a bunch of thiamine product. Therefore, you should not take it. Therefore, all these answers are right. Once again, keyword is linezolid. You should avoid MOI-like food, which are thiamine, and you should not take anything that has serotonin in it. The next question is what is answering that question. And next care for a client prescribed what? Linezolid, and recently prescribed what? Tramadol. I told you about those combinations. They shouldn't happen. 4 hours later, the client is tachycardic and diaphoretic. Which additional finding should the nurse expect? Select or apply. Think about it. Linezolid is the serotonin agonist. Tramadol is a serotonin agonist. That means you have two serotonin chemicals in your system. You're going to increase your serotonin. 4 hours later, the patient has what? Tachycardia, diaphoretic. What do you think? Look at the answers. Which additional findings should the nurse expect? Aporeflexia, clunus, hypothermia, calm demeanor, constricted pupil, respiratory rate of 10, and muscle rigidity. Content. Tachycardia, diaphoretic, taking two serotonin agent. Stop the video. Something should ring in your ear and say, hey, this is what? Serotonin syndrome. The patient has serotonin syndrome. What should I expect in serotonin syndrome? I don't memorize this. This is the trick. This is the memory trick you should take with you. Serotonin syndrome. Don't memorize the symptoms. The buzzword is what? Everything is going to go up. The buzzword is everything goes up. Look at the answer choice. If you see things going up, you pick it. Hyporeflexia, I'm not going up. Clunus, I'm going up. Hypothermia, I'm not going up. Calm demeanor, I'm not going up. Constricted pupil, I'm not going up. Respiratory rate of 10, I'm not going up. Muscle rigidity, I'm going up. Therefore, there's only two answers there, 2 and 7. Somebody will say, well, respiratory rate is low, constricted pupil is associated with what? Tramadol. But that is not the scenario. It's taking linozolid plus tramadol. It's called serotonin syndrome. This is not opiate overdose. Two answers are there, clunus and respiratory and muscle rigidity. 2 and 7 are your right answer. What is the best next consideration? The client is prescribed ceftriaxone for what? Bacterial pneumonia. The client has a history of anaphylaxis to penicillin. Straightforward concept for you to grab. You take penicillin, you are allergic to penicillin, and I'm giving you ceftriaxone. The concept is there is a cross reactivity. Which answer choice do you think meets that criteria? Put down in the comment. Cross reactivity. Administer ceftriaxone as prescribed. Do you think is right? Administer a test dose and observe allergic reaction. That is a bad choice. Hold the medication and consult the healthcare provider before administering properly. That's the good one. Pre-treat with steroid to prevent allergic reaction. Don't do that. Which one is the right answer? Let the doctor know. Hold the medication. There's a cross reactivity over 50%. You should talk to the doctor. And this is teaching a client prescribe erythromycin, right? Erythromycin about possible side effect. Which statement by the client indicate understanding? I might experience hearing loss and ringing in the ear. I will avoid dairy products while taking the medication. I should expect increased urination. I can take this medication with antacid to reduce stomach. Stop the video, put down your answer, put in the comments. Let me know what you think. But this concept is something I'm giving it to you so that you can know when you see a question, be able to answer it. Erythromycin, when you see it, tell yourself what kind of drug it is. This is what? Macrolide. What are the things you need to know about macrolide? They cause QT prolongation, and the other thing is autotoxicity. Do you see autotoxicity there or QT prolongation? Number one, talking about your ear. I'm picking the answer. I have nothing to, I don't know anything about avoiding dairy products. I don't know about increasing urination. I don't care, antacid. But my concept, two things I'm taking with me today, every time I see a macrolide, QT prolongation, and autotoxicity. The pregnant client is prescribed what? Doxycycline for severe acne outbreak. What is the next best action? Which medication? This medication is safe during response. What is the next best response? This medication is safe during pregnancy. You should avoid this medication. Make sure to take this medication with milk. You can take this medication anytime, even before bedtime. Look at it. Bunch of answers. There's some that are contradicting each other. One said the medication is safe during pregnancy. Okay. The two said you should avoid this medication. Both cannot be right. Both cannot be right. Make sure to take this medication with milk. Well, one in saying that 1 and 3 saying the same thing. Then one says safe, one says I should take it with milk. You can take this medication anytime, even before bedtime. So 1 and 3 and 4, I say take it. And 2 said don't. That should be a red flag. Even if you don't know doxycycline causes something, test-taking strategy, critical thinking with these pharmacology questions is clinical. 3 answer choices say I should do something, and 1 say I shouldn't. The odd one may be the right answer. It's not safe. It's not safe. This tetracycline, you cannot take it with milk, no antacid. It can cause either teratogenic, they affect bone and teeth development. And therefore, you should avoid this medication. Number 2. The client receiving IV gentamicin develop tendinitis and what dizziness. What should the nurse prioritize? You get the antibiotic, you have side effect. Always be safe. That's all. Be safe. The answers are not esoteric. Be safe. Something, I got to do something. At least let the doctor know or stop the medication to figure out why the kid or the patient having dizziness and tendinitis. This is how you answer question. You don't make it difficult. Slow down the infusion. Something say I should slow it down. One say I should notify the, two say I notify the healthcare provider. Three said, well, give them antiemetics, right? Because they have nausea or something. That's why they have dizziness. Encourage the client to drink more fluid. Which one is safe? Tell me. Which one is safe? Put it down in the comment section. What do you think? Which one is safe? You slow down the infusion, it's still going. Notify the healthcare provider, most likely something bad is happening. And before you notify them, you most likely will stop the medication. I did not put there stop it because I want you to think. Notifying the healthcare provider, at least somebody else knows about it. If you slow down, that means the whole thing is ignored. So 2 is better than 1. 2 is your right answer. Which assessment the nurse should practice? The nurse is caring for a client with what? Ciprofloxacin, right? Ciprofloxacin and fluoroquinolone. They have specific side effects. What will you prioritize? Respiratory rate, Achilles tendon, tooth for what? Discoloration and low WBC. Well, if you're taking ciprofloxacin, I can check your WBC. It's going to be low. But is there a prioritization? No, I don't care about it. That means there's a content you need to know about ciprofloxacin. What do you think? Respiratory rate. Okay, I know a lot of people will pick it because it's talking about your airway. But the question has nothing to say. It doesn't say anything about respiratory, some patient in shortness of breath or anything like that. This is a concept level. You see that and they did not give you anything. That means they want you to pick something specific for that medication. If I want you to pick about respiratory rate, I will give you a scenario. When you see question that has nothing in it, yes, the name of the medication, what you prioritize, that means something specific about that medication. This fluoroquinolone causes tendon problem. You can have tendon rupture, they have tendinitis, therefore we should check what? Achilles tendon. Discoloration is not, mostly tetracyclines are the one that do that on your teeth. The client is taking trimethoprim, sulfametazole, develop a rash and fever. What is the priority next action? Request for antihistamine, notify the healthcare immediately, assess hydration status and increase fluid intake, monitor the liver function test. I have something about prioritization. I call it, you have to be sharp. What do you mean? You talk about breathing issue, electrolyte, shock, sepsis, airway, and pain. That means you have 1 second. There's things about a patient that is constant. Some that you have just 1 minute. If you don't do it 1 second, patient die. These suffer drug, they are dangerous. Photosensitivity and Stevie-Johnson syndrome. I see a rash and fever, that's sepsis. Be sharp. What do? Give the antihistamine to take care of fever and rash that you know is sepsis. Let them drink a lot of water. Of course, yes, sulfur drug causes kidney stone, but this is not kidney stone. Monitor liver function test, but this is not a liver problem. I'm going to have joined this with liver problem. You should notify the healthcare provider. This is Stevie-Johnson syndrome. Which client statement indicate the need for further teaching? And then teaches a client prescribe what? Metronidazole for bacterial vaginosis. You have infection, we give them metronidazole. What teaching provided? They never told us, but which one need further teaching? I will avoid alcohol during and for 24 hours after therapy. Okay, I can take this medication with food to reduce nausea. Okay, I will use mouthwash to prevent tooth discoloration. Okay, I should finish all the medication even if I feel better. Okay. If you're watching this video and you're here, thank you very much. And thank you for following Adapt and Click, and thank you for following the series. Put down in your comment, what do you think before you listen to me? Let me know what you say about or what you pick. The first thing that came to your mind after you read the answer choice. Let me know what you think. And this is a concept that you have to take with you. Metronidazole, look at number 1. 1 said avoid alcohol. That means alcohol is bad. You can't take alcohol with you. But they forget that 3 is also alcohol. Mouthwash has a bunch of alcohol in it. If you use a bunch of mouthwash and you go and do a breathalyzer, police will catch you. You're going to test positive. Your alcohol level will go high. Therefore, number 3 is the right answer. They forget. This is one of the teaching you provide to the patient that if you take metronidazole, there is some eating areas in our body, in our life, that contain alcohol, cologne, vinegar, whatever, and sanitizer. Stay away from it. So give them a list of things that alcohol is hidden so that they don't get sick. A client is receiving vancomycin via IV, develop flushing and itching on the face and the neck during infusion. What should the nurse do first? This is red man syndrome. What is the treatment? Red man syndrome. It's not allergic reaction. If I see allergic stuff there, I'm not picking it. Once I stop the infusion immediately, it's an allergic reaction? No, it's not allergic reaction. It's what? Infusion-induced flushing. So if you slow it down, it's usually help, right? Unless the patient is having wheezing, hypotension, you can stop it. Administer epinephrine. It's not an allergy. Continue infusion and monitor vitals. You have to do something. Therefore, slow down the infusion. Client on linezolid therapy report a headache and elevated blood pressure. We've seen linezolid, right? MOI-like symptoms that will cause hypertensive urgency. What is the next best action, right? MOI, right? You know that's why the blood pressure is high. Do you see anything that say anything about MOI? You see how I answer the question. I go for the content and I know what I'm looking for. When I'm looking at the answers, I'm looking for the content associated with what I'm looking for. Encourage increased fluid intake and rest. It doesn't say anything about MOI like. Inquire about last meal. Oh, did they eat any thiamine food? Administer acetaminophen for headache relief. Okay, I'm treating the problem, but I have to find out why they have hypertension. Continuing therapy as symptoms are mild. It's not mild. Therefore, find out if they eat any pepperoni or cheese or cheese or anything like that. Number 2 is your answer. And this is caring for a client receiving amoxicillin. They develop diarrhea, right? What would you do? What advice would you give the patient? This is common side effect. Drink a lot of water. Stop the medication immediately to avoid complication. Take over-the-counter medication such as antiviral diarrhea so that you don't have more diarrhea. Avoid eating fiber-rich food while on this medication. Well, think about it. You have diarrhea. You take antibiotic. What is the most common side effect of antibiotic? Diarrhea, because it changed the flora, the oral, the GI tract, the bacteria. Good bacteria get killed, and therefore you have diarrhea. So it's okay to tell the patient it's common side effect to drink a lot of water because of the diarrhea. But stopping the medication is wrong. Taking anti-diarrhea, that means you're taking Imodium for something that is expected finding. Avoiding fiber-rich will decrease your diarrhea. So it's good to bulky your stool. We're going to pick what? Number 1. From the sun. What should the nurse teach? You can't be outside without sunscreen. Always a bad thing. Wear a hat and long sleeve for outdoor. Probably is good. Sunlight will help the medication work better. No, they are photosensitive. Wear protective clothing only if you plan to be outside for 8 hours. No, every time you go outside, wear protective clothing and have a sunscreen. You know the answer. You pick it, and I know you got it. Number 2 is the right answer. Which assessment require immediate intervention? A nurse is administering what? Oxytocin to a laboring client. Which assessment require immediate intervention? I know this is prioritization question. Therefore, I'm looking for things that will change the situation of the patient, both the mother and the baby. That's what I'm care about. Contraction every 2 minutes. What do you think? Fetal heart rate of 90. Blood pressure of 120/78. Mild uterine what? Cramping. Stop the video. You can put down your answer, explain yourself, but learn from this. Stop it and then answer yourself, and then see how I'm going to approach it. I give you Pitocin. What does Pitocin does? It causes contraction of the uterus. In the process, what? Improve effacement and dilation, and then you have delivery. But what do you need to watch when I give you Pitocin? Tachysystole. The uterus can contract faster. In the process, it causes fetal bradycardia. What do you think? Do you see fetal bradycardia there? Contraction every 2 minutes is what we want you to do. Fetal heart rate 90 is bradycardia. Blood pressure is normal. Uterine cramping is expected. That's why I give you the Pitocin. I expect that. What is the right answer? Tachysystole leading to what? Fetal bradycardia. Number 2 is your right answer. So the key fact is when you're getting Pitocin, you need 5 contractions in 10 minutes. The duration of each contraction should be less than 90 seconds. And the interval after each contraction, at least 2 minutes. That's the keywords. That's the memory trick. Note that. Next time, they will ask you the same question. Which client is an appropriate candidate for endometriosis therapy? And then it's reviewed for clients in preterm labor who need what? Endometriosis. A client at 36 weeks with mild uterine contraction. A client at 32 weeks with a history of asthma. A client at 30 weeks with closed cervix and no fetal heart concerns. A client at 28 weeks with platelet count of 60. Preterm labor, that means you contraction, you have effacement, dilation before the end of 37 weeks. Which client is appropriate? Look, whoever does not meet the criteria of endometriosis is you eliminate it. So who is appropriate? Endometriosis is an NSAID. It's used, okay, for preterm labor, but there's specific conditions. You have to be, 32 and less weeks. Why? Because if you give it after 32 weeks, it causes premature of closure of what? Patent ductus arteriosus, or the right word, premature closure of the ductus arteriosus, leading to what? That problem. Therefore, number 1, 36 weeks is too late. Give it before 32 weeks or at 32 weeks. 32 weeks, fine, but you have asthma. Asthma patient, you should avoid NSAID. 30 weeks, good. Your cervix is closed, good. No fetal heart concern, good. A client 28 weeks, good, with platelet count of 60,000. That is going to cause bleeding with endometriosis. Therefore, the right answer is 3. 30 weeks and closed cervix and no fetal heart rate. So the buzzword is what? For preterm labor, when using endometriosis, what you're going to do before 32 weeks, and therefore watch forward PDA after 32 weeks. That's the buzzword. Which assessment finding require immediate intervention? And nurse is monitoring a client receiving IV Pitocin for labor induction. The same thing as number 1. I change it so that you use the content. These are the questions they will ask you. Uterine contraction every 2 minutes. Is it what we expect? And lasting 60 seconds. These are the numbers you have to know. I put it in the buzzwords. Fetal heart rate of 140 beats per minute with moderate variability. Clients report with a headache and a decreased urine output and a blood pressure of 118/72 and heart rate of 84. Step back, think about it. Why do I ask you this question twice? Change the answers. I want you to figure it out. Stop the video, 10 seconds, answer it, come back and listen to what I'm going to say. What is the requirement for contraction when you're on Pitocin? Yeah, contraction every 2 minutes is enough because you need 5 contractions in 10 minutes. Therefore, you need at least 2, no more than 2 minutes, right? So that's good. And it lasts in 60 seconds, less than 90 seconds. Fetal heart rate of 140, that's good. And you have what? Moderate variability, excellent reading. A client report headache and a decreased urine output. Think about it. A blood pressure of 118/72 and a heart rate of 84. I don't see anything wrong. Even if you don't know test taking strategy, critical thinking, you see, though, I've eliminated 1 and 2 because I use my content. And number 4, I already eliminated. Therefore, which one? I have to pick number 3. If you don't understand, this is the content, write it down. Pitocin is what? ADH. It acts like ADH, and therefore it leads to water retention. If I lead to water retention, I'm going to have decreased urine output, and my sodium will go down. I will have what? Hyponatremia due to dilution. This can cause headache and I have seizures. So therefore, remember, Pitocin has ADH-like symptoms. So what is the buzzword? Oxy make you overflow of water. Oxy, Pitocin make you have what? Overflow of water that can lead to fluid retention. Therefore, number 3 is the right answer. A critical thinking question on pharmacology, NCLEX practice question, learning pharmacology, OB, maternity, and delivery. A nurse is caring for a client who is 4 hours postpartum and saturating a perineal part every hour. I can tell you, every hour means bleeding. Rewrite the question and say, patient is post-op and is bleeding. Which provider prescription should the nurse anticipate? What do you think will help stop bleeding? That's all. Look at each medication and say, does this stop bleeding? Metaloganovin. It causes vasoconstriction. Therefore, what do you think? Metamethasone, right? Steroid does not cause help with breathing at all. I can tell you. The butylene is a beta agonist. It relaxes things. It makes the uterus relax. If you relax it, you're going to bleed more. Rogan is used for post-op hemorrhage in situation where there is isosensitization of the matter due to Rh negativity. Therefore, which one would you pick? Metaloganovin. Know it. Vasoconstriction causes bleeding. Certain situation, you should avoid it. And what is the mnemonic? That's it. A happy uterus contract. That's metogen, metaloganovin. Amabate is carboprost. Uterine tonic is what? Like oxytocin. And cytotec is misoprostol. All my happy uterus contract. They all causes contraction. So these are the medication you can use for what? Bleeding. Which action is most appropriate for the nurse? The nurse is caring for a laboring client at 8 centimeters dilated who requests pain relief. The healthcare provider prescribed IV nalbuphine. Which action is the most appropriate? Rewrite the question. Go for the bars rate. Make the question simple, your own way. What is that? A patient is at 8 centimeters dilated and requires pain medication. And this was prescribed what? Nalbuphine. Which one action should the nurse take? The most appropriate. Think about it. Administer the medication as prescribed. The nurse has to think about it. Hold the medication and notify the provider. Do you think she should do that? Prepare to administer naloxone to the newborn after delivery. Give the medication at peak of contraction. Stop the video. Let me give you content. But before that, 5 questions. I know you answer 4 out of 4 because you was adapting this and clap for yourself. Give the medication at the peak of contraction. It's true. But guess what? The patient is at 8 centimeters dilated, almost about to finish the active phase. That is not good. The principle and the concept of the nursing, OB, labor, and delivery on pharmacology is what? Maternal health is what? Never, never, never give any opiate when there's an active phase of labor. Therefore, even 2 is good. We should, even though 4 is good, we should not do that. You want to give naloxone after delivery, it's too late. Holding the medication and notify the healthcare provider. Best answer, hey, you want to do that? Because the patient in the active phase, administer medication is as prescribed. You are not basically using your whole knowledge to answer the question. As a nurse, you said no. 8 centimeters is too advanced. I cannot give any medication. Therefore, I will hold and call you and clarify what you want. Therefore, avoid narcotic in late stage of labor. Example, in active phase. Which statement indicate understanding? An institute, a client prescribe what? Oral contraception. How do you take it? I will stop taking the pill if I get cold. Yes, no. I will use a backup method if I miss 2 pills. Yes, no. This pill will protect me from STI. Yes, no. I can smoke as long as I am under 35. Yes, no. What do you think? Key concept, oral contraception. Mass illness does not prevent you from taking it. If you mix 2 pills, you should make sure you have a backup. The medication does not protect you from STI. And as long as you smoke, you are in trouble, even if you are less than 35. Bad problem. Therefore, the right answer is what? I will use a backup method if I miss 2 pills. Don't stop for minor illness, no ST protection, and no tobacco. Which statement by the client indicated a need for further teaching? Select or apply. And then she's educating a client with ectopic pregnancy related to what? Methotrexate. What do you think? Methotrexate is used as what? Therapeutic management of what? Non-painful ectopic pregnancy. But there is certain condition teaching you have to provide to the patient. It's immunomodulator. What do you think? I will stop taking my prenatal vitamins while on this medication. Yes, because you have to avoid folate for the methotrexate to work. Question say need further teaching. That one does not. I will avoid alcohol onto my follow-up. Methotrexate affects the liver. If you drink, you're affecting the liver. Good point. I can take ibuprofen for abdominal cramp. You cannot. So need further teaching because ibuprofen worsen the toxicity of methotrexate. I will continue having sex intercourse as long as I feel okay. No, abstinence key at this point. I will return for follow-up blood work to check my HCG level. Yes, until it's normal before you can do anything. I can go to the gym and do my usual weight training this week. Strenuous as exercise is not recommended when you get a methotrexate because it can lead to rupture of the uterine tube. So these are the things you have to know to master the content I've given you, and you know the answer, right? You know the answer. I will stop taking my prenatal vitamin, is good. I will avoid alcohol, is good. You cannot take ibuprofen, you cannot have sex, and you cannot go to the gym. Which client condition will cause the nurse to question the prescription? Something bad in the patient history. That does not need that. And it's for a postpartum client prescribe what? Methamphetamine. Key fact, vasoconstriction. Vasoconstriction is hypertension, what? Stroke, and MI. Do you see there? I see hypertension. Uterine atony is why we use methamphetamine. Vaginal bleeding is why we use methamphetamine. If you have been bleeding, history of anemia is unrelated. Number one, right answer. So it causes what? Vasoconstriction, you should avoid coronary disease, stroke, and hypertension. Key. What finding needs immediate intervention? That means something is not right. And as a client is receiving magnesium sulfate for what? Severe preeclampsia. We want to prevent seizures. But magnesium, when I give it to you, it suppresses your neurological system. So it drops things down. Your tender reflex is going to go down. Your respiratory rate is going to go down. Your urine output is going to go down, and you're going to have flushing. And most of the time, you don't see it that much. But which one should you worry about? Which one? Airway, right? Respiratory is the bad problem. Your reflex is fine, it's not going to kill you. Your urine output is you're making a progress, but your respiratory of 10 is not good. So that is the right answer. This also requires, don't be intimidated, don't worry, don't run away. How many questions have you answered so far? I know you get 9 out of 9, but this question is not straightforward. I'll show you the key fact. And let's prepare to give Rogan immunoglobulin. Which client is eligible? Who is eligible? The key concept is Rh negative mother giving birth to Rh positive, right? And then the mommy will be what? Activated if they give birth to that baby. So if you need Rogan, I'm going to give it to somebody who has Rh negative and Rh positive baby. And then when we do the test, we see that you're not being synthesized. So what is the problem? Indirect Holmes positivity means you've been exposed. If indirect Holmes is negative, that means you're not being exposed. So that's a good candidate. You don't give it to Rh positive mother and Rh negative baby. That's no problem. You don't give it to Rh negative mother to Rh negative baby because there's no sensitization of the mother. So the right answer is Rh negative mother give birth to Rh positive baby. And then you have indirect contest that is negative, not positive. That distinguished it from number 3. So that's the key. So what is the problem? Rh negative mother and Rh positive baby are the key for this question. And then teaches a client about clomiphene citrate. Do you know this? This is what we use to help with ovulation if you cannot have a baby. Which side effect is most common with the nurse should include? Think about it. I'm stimulating you so that you have more ovaries so that they can get fertilized. The problem, ovarian hyperstimulation leading to fluid shift change in the overall well-being of the individual. So this is very important when it comes to teaching about chromophene. So that's very important. What should the nurse do first? A nurse care for a client taking oral contraception, client report leg pain and swelling. That should tell you DVT. If he has DVT, what do you take? Hydration, pedal pauses, healthcare provider, warm compression. Trap answers, assess for pedal pause. This is a venous problem. There's no need for that. Apply cold compression. There's no any erythema anywhere that you worry about. You should let the doctor know about this patient. Therefore, DVT is a venous problem. What is the priority assessment? A client is prescribed misoprostol for labor induction. Labor induction. Which one is the priority? Well, it's a medication that induces labor, right? At the same time, what it does to the baby, tachysystole, because it's tachysystole, in the process, the baby heart rate is not happy. These are some of the things you have to pay attention to. Cervical dilation, we expect that. The client is going to be anxious, right? Amniotic fluid color is unrelated. But the key is to know what the medication is going to do, and you can find out. Therefore, Mispro is what? Uterine tachysystole, and you make the uterus contract faster. In a client taking terbutaline for preterm labor, which finding should the nurse report? Which one would you report? Is a beta agonist, right? No asthma problem, nothing like that. It's a beta agonist. It speeds things up. So if you have heart rate of 122, is okay. Jet drainers, blood glucose of 160, and fetal movement is present. What would you do? Which one would you report? Jet drainers is normal, as expected with terbutaline. Blood glucose of 160, do the same thing. Fetal movement is good. Heart rate of 122 is okay for terbutaline, but it's too high. It's expected, but it's too high. Once again, it's expected, it's too high. So that one, we need to intervene. Client condition require the nurse to question the prescription. I got a question. A nurse is preparing to administer coboprast to a postpartum client with heavy bleeding. Which condition should you make you question? Think about it. History of gestational diabetes, twin delivered vaginally, and then control asthma and pitocin during labor. The key is this medication is good, very good for postpartum heavy bleeding. But what is the problem? It can cause what? Problem in the asthma patient. It causes problem in the asthma patient. It causes problem in asthma patient. So therefore, if you have asthma, it's contraindicated, even though it's well controlled. 15th question. First question, a nurse is caring for a client with what? Anaphylaxis. Keyword, anaphylaxis. Focus on it. Anaphylaxis. Which medication should the nurse administer first? Think about it. Anaphylaxis and first. That means whichever medication you're going to pick should be used for anaphylaxis, but at the same time, it should be the first medication you give. Do you give diphenhydramine, epinephrine, albuterol, or prednisone? Think about it. If you have anaphylaxis, what is the underlying problem and which medication you pick? Stop the video, pick the answer. But what is the mnemonic I will give you to answer the question? This is it. Epi is for emergency. Therefore, the first medication you should pick and you should give to the patient is epinephrine, followed by what? Diphenhydramine, followed by what? Albuterol, followed by what? Prednisone. There's another question that we use this strategy, but this medication is used for allergies, anaphylaxis, and therefore epinephrine is the first answer. So take note of it. Next question. A nurse should anticipate giving which medication? The client in emergency department is experiencing acute asthma exacerbation. The buzzword in the question is acute asthma exacerbation. If I'm taking these exams, acute asthma exacerbation is what I'm going to focus on. Therefore, whatever medication they give me, I'm going to focus on what? Acute. That means asthma patient in exacerbation, acute state. In that state, I need to do what? Opening the airway. What medication I'm going to use? Something that acts fast. What do you think? Albuterol, Montelukast, Fluticasone, Ipatropine. Ipatropine orally, it takes some time to work. Albuterol nebulizer, going to the airway right away. Mantilucus is very good. Fluticasone is also good. They all will work. Mantilucas is a long acting. Albuterol short acting. Ipatropine is also short acting, but it takes a long time. Giving them orally is going to take a long time. What is the medication? I know you know it. This is the mnemonic that you can use to answer this question. ALERT is what? Albuterol for acute lung emergency rapid treatment. We have a rapid treatment issue. We're giving you albuterol. That's the next thing we're going to give this patient. That's the next thing. So albuterol is our right answer. What is the next question? Which medication should the nurse prioritize? That means you got to prioritize the medication. It should be the first one. All four of them are possible, but we need to prioritize one. That means if you have 1 second, which medication would you choose? The client is admitted with what? Acute myocardial infarction. There is a word there, acute. That's your buzzword. That means it happened right away. Therefore, patients having chest pain, don't get distracted. Go with the underlying problem. Do you give them morphine, nitroglycerin, aspirin, or furosemide? Think about it. It's an acute problem, sudden, right? Chest pain, right? Because they have ischemia. What is the underlying problem? Blood flow to the heart is being affected. That is what is causing the pain. What medication will you give? Morphine, nitroglycerin, aspirin, or furosemide? You know furosemide is going to kill this patient if you give it to them. It will make them hypotensive, worsen their heart and chest pain. So that is gone. Now you have 3 options, 1, 2, 3. Which one will you pick? Think about it. Attack the underlying problem. Always go to the pathophysiology. The pathophysiology is ischemia due to blood flow. I need to improve blood flow. Why are they having ischemia? It's because of a blockage. Either there's a clot in the vessel, right? Therefore, this is why antiplatelets are the best option. Aspirin first for arterial attack because there's a clot, there's a blockage in the artery. Morphine will decrease the anxiety, right? That's why we give it them. The less anxious they are, the more they become, the pain get better. Nitro will make the artery bigger, but to attack the blockage, aspirin is the best answer. So that's why we give them aspirin. 3 questions. What is your score? Put it down. Each question, stop it, answer it, listen to the way I'm going to approach it, and next time I approach every question like that. Next question. What is the primary priority assessment before starting? That means you got to do something, pay attention to something before you do something. About what? And then she's preparing to give what? IV dopamine. Patient has what? Hypotension. Therefore, I'm going to give the patient IV dopamine because they have hypotension. Why do I give them dopamine? To increase their blood pressure. But what is the side effect, right? Priority side effect of that medication is what you have to check before you give the medication. It's a safe medication administration. NCLEX practice question, pharmacology, test-taking strategy, critical thinking. I'm going to give you IV dopamine. I need to know what side effect would it have on you. Because of that, I got to check if you already have the side effect of that medication or what it's going to cause before I give it to you. What do you think? Heart rate or rhythm? Respiratory rate, temperature, or serum electrolyte? What do you think dopamine will do to you when I give it to you? It's going to increase your heart rate and it can cause arrhythmia. Therefore, what? I need to check it first before I give it to you. So dopamine, danger to the heart. So you need to check the heart rate and rhythm. Which solution should the nurse anticipate? A client in shock requires rapid fluid resuscitation. Which solution should the nurse anticipate? The key word is what? Shock. Shock means hypoperfusion. That means I need to improve your perfusion. I need to give you some fluid. What fluid will improve your intravascular system? If you need fluid and electrolyte, check the adapting class and make it easy as much as possible. Whatever stay in the intravascular system is what you give in the patient who is in shock. With fluid state intravascular system is the one that has the same concentration as plasma. It should be equal to plasma, which is what? 0.99% normal saline or 1% normal saline. 3% is too much. It's hypertonic solution. Dextrose 5% in water is what? Not good. It's going to leak out. And then 0.45% is less. Therefore, the right solution is what? Normal saline. What is the mnemonic for that? NS, nursing shock solution. NS is always nursing shock solution. Don't forget. So that's the right answer. Which assessment is the highest priority after administration? That means when I give it to you, I should watch for that. And then administer naloxone to a client with opiate overdose. What does opiate overdose do to you? Decrease your respiratory rate. Therefore, if I give you naloxone, what should I look for? These questions are not hard. I do not make it them hard. I just want you to use critical thinking. They are straightforward. If you overthink it, you get them wrong. So which assessment is the highest priority after administration of these medication? If it's going to decrease or if it's going to improve your heart rate, if it's going to improve your respiratory rate, then assessment is the highest priority after administration is what? Checking your respiratory rate. So number 2 is the right answer. And what is the mnemonic? Naloxone, no opiate, notice your breathing. And so we got to check your breathing. And that is the key aspect of it. And then should prepare for what? A client with ventricular tachycardia is unresponsive. I try to make the question very short, straightforward, to get you thinking. Ventricular tachycardia, what is wrong with the patient? Unresponsive. What does that mean? Change it into something manageable. The NCLEX practice question. This is not just questions and answers, but practice question to let you think critically. What is ventricular tachycardia that is unresponsive means? Critical thinking tell you that this is a pulseless VTAC. A pulseless VTAC need the heart to be pumping back. Medication is not effective. Using that strategy, any medication there should be wrong. IV amiodarone is gone. Adenosine is gone because this is for SVT. Ventricular tachycardia is pulseless, right? Ventricular tachycardia, which is what? VFib. Therefore, do you defibrillate them or cardiovert them? If you cardiovert, this patient is dead. He has pulseless VTAC. Therefore, you should defibrillate. And what is the mnemonic? Shockable VT, beat the ventricle, and the ventricle will wake up. Therefore, we should defibrillate this patient. Which lab value should be monitored closely? This one, straightforward. It's a bonus one. But you have to know because it's an emergency medication. Then let's give IV furosemide for pulmonary edema. Patient with pulmonary edema, in emergency, you give them IV furosemide. What should you look for? Furosemide lead to what? Loss of K. That's what you look for. Easy. Which IV medication is a priority? Which one is a priority? A client with what? Hypertensive crisis, right? Present with severe headache and blurred vision. That means they have urgency, right? They have problem associated with their hypertension. You need to bring the blood pressure as quickly as much as possible. Which medication can do that? Test taking strategy, content, NCLEX practice question, pharmacology, thinking critically is what? You have to give them a pharmacological medication that can drop blood pressure quickly. It should affect the vein and the artery. Which of these affect the vein and the artery? It has to be a good nitrate. Do you see a nitrate there? Labetalol cannot do that quickly. Metoprolol cannot do that. Adralazine cannot do that much. Best answer, nitroprusside. Therefore, and nitro, for now, you will drop it now. Right answer, nitroprusside. The 10th question. And NS is preparing to administer magnesium sulfate to a pre-eclamptic client. What is the primary assessment before giving? You know what magnesium does. If you need electrolyte questions, check adaptant class. But magnesium, it puts you down. Your muscle and your respiratory rate are priority. Your neurological status go down. Of course, bowel function may slow down. Urine output may slow down. Blood pressure may come down. But the priority is this. Magnesium, monitor the muscle and the lung. Do you see a lung there or a muscle there? I like respiratory rate more than the blood pressure. That's what you check. Reflexes and the respiratory rate, very important. Which medication should be prepared after epinephrine? We've done 10 questions. How many did you answer? Put down in the comment. Explain to me which drug that disturb you, which emergency situation you want to know more about. And let me know, and I'll make a video about it. But what do you think? Which medication should be prepared after epinephrine, after you've given patient epinephrine? I talk about this in the second question, or the first question. The client developed what? Acute anaphylaxis after IV contrast. That means allergic induced shock, right? And you've given them epinephrine because you think an allergy related. What is the next one? There's a mnemonic for that. If you can remember them, after epi, when patient has anaphylaxis, there's something that follows. Is it diphenhydramine? Is it prednisone? Is it albuterol? Or is it furosemide? Furosemide is wrong. But you left the 1, 2, 3. Which one do you think? Test taking strategy, once again, is airway problem. Open the airway. And if it's allergy, treat the allergy first. If I give you epi, you take care of the allergy. Which of these medication would still treat the allergy? The mnemonic is epi first, and then the DAP. DAP means what? Diphenhydramine, albuterol, before the steroid. Don't forget this rhythm. Don't forget this order. Every time they give you a question on anaphylaxis, I want you to remember that you give them epi, then what? Diphenhydramine, which take care of the allergy. Then you open the airway, which is albuterol. Then you give them the steroid to help with the systemic inflammation. This you got to know. Which prescription should the nurse anticipate? What do you think? A client with severe hypoglycemia is unresponsive. Every word in the question I've said, I just give you the buzzword. I don't want to give you too many words. The buzzwords are what? Hypoglycemic and what? Unresponsive. There's 2 ways you can have hypoglycemia. Either you're responsive and you can talk to me, or you are unresponsive and you cannot talk to me. So the memory trick is what? You're responsive or unresponsive. If you are unresponsive, I cannot use your mouth because you're not talking to me. If you are responsive, then you can use your mouth. Therefore, if the patient is unresponsive, don't give them anything through the mouth. Therefore, I'm looking at the answer choice. If I see oral medication, wrong. 4 is wrong. 3 is wrong. Insulin is going to drop the sugar more. Therefore, IM. So either you give them IM something or IV something. And I don't see IV, I see IM. IM glucagon, which is going to increase your glucose. And this is the mnemonic. Give glucose muscle a shot. Glucagon will give glucose muscle a shot. And so that's the key. Which finding should the nurse prioritize? Which one? And nurse is caring for a client receiving IV lidocaine for ventricular dysrhythmia. We use it all the time. You also have to be aware they can change the question. Patient is getting local anesthesia. All of a sudden, they're getting sick. They will develop what? One of the key features of lidocaine toxicity is neurological problem. That is the key. Dizziness, hypotension, tonic-clonic contraction, and mild nausea. If you have to pick one, which one will you prioritize? I hide the answer choice and I use different word. If I put the word you should expect, you pick it. But I know you know the answer because you watch adaptants. I know you know the answer because you watch adaptant class. What do you think? This is the mnemonic. Look for central nervous system danger. It's lidocaine. Do you see central nervous system dangers over there? Tonic-clonic contraction is equivalent to what? Seizure. That's your right answer. Two more. A client with status epilepticus require what? Rapid anticonvulsant therapy. Which IV medication is prioritized? Simple. Rewrite it on your own. Straightforward. Patients having seizures. You need medication to slow them down. Which one is an anticonvulsant therapy? Which one can drop your seizure down? Which one will slow you down and prevent from you having seizure? The key word is what? Status epilepticus. The anticonvulsant is a trap. Don't give them phenotime. Don't give them valproic acid. Don't give levetiracetam. Don't give them levetiracetam. Don't give them any anticonvulsant because they are long acting. It takes a long time to work. We want a rapid. We want a rapid medication. So lorazepam is your first answer choice. And what is the mnemonic? Life-saving seizure stop. Lorazepam, life-saving seizure stop. And the last one. Which medication should the nurse anticipate administering immediately? The client in the ICU developed what? Torsades de Pontes after receiving IV or dansetron for what? Nausea. You know what the torsade is? It's a meandering, polymorphic ventricular tachycardia. How do you treat it? What causes torsade? Is what? Prolonged QT and what? Low magnesium. Which medication do you give? If you give them amiodarone causes prolonged QT. That's bad. You make it torsade worse. Lidocaine will cause more arrhythmia. Adenosine is used for SVT. I see magnesium. I know my mnemonic. Magnesium would twist the rhythm back to normal. And that is the torsade. It's a twisting, meandering rhythm. And magnesium would twist you back to normal. 15 questions. Which assessment finding require immediate action before giving the next dose? That means the nurse already giving this dose before, and she's trying to figure out if she needs to give it again. The client is admitted with what? Severe post-operative pain. The nurse administers morphine IV as prescribed. Which assessment finding require immediate action before giving the next dose? Is it respiratory of 10, pain 8 out of 10, blood pressure 130/80, heart rate of 88? What do you think? The best answer and strategy is morphine. What is the side effect? When I give you a medication, I need to worry about the side effect. The side effect of morphine is respiratory depression. Therefore, if I give it to you, I should check your respiratory rate. Respiratory of 10, pain of 8 out of 10, blood pressure 130/80, heart rate of 88. The most important is the respiratory rate. So I got to check it again. Respiratory rate of 10 is too low, and that's the right answer. And what is the key to answer this question? This is the concept. Every question, I'll give you a concept. And what is that? Respiratory depression is a life-threatening adverse effect of opiate. And therefore, the nurse should check that before she gives the medication to the patient. That's what she needs to do. Next question. Which intervention should the nurse prioritize? That means which medication the nurse should pay attention to. A nurse is caring for a client who reports dizziness and nausea 7 hours after oral intake of what? Aspirin. What would you do? Prepare for endotracheal intubation, prepare for gastric lavage, administer sodium bicarbonate, and administer acetylcysteine. This question requires critical thinking, test-taking strategy, analyzing the question. Which intervention should the nurse prioritize? That means if you have one choice or 1 second, what would you do? You got to be sharp. What is be sharp? Breathing, electrolyte, shock, sepsis, airway. We have the patient having issues with what? Dizziness and nausea. After we give the patient aspirin or the patient took aspirin, that means that's the side effect of the medication. When you take an aspirin, you should not have dizziness or nausea. It's an unexpected finding. Therefore, patient is having side effect. And when it happens, 7 hours. This is the key. When it comes to aspirin overdose or aspirin side effect, you deal with what? Time. If you give this medication to the patient, what would you do? Intubate them, gastric lavage, sodium bicarbonate, acetylcysteine, that's taking strategy. Number 4, acetylcysteine is for acetaminophen. Therefore, it's gone. Aspirin is not acetaminophen. Now you're left with 3 choices. What do you think? Unless the patient have respiratory distress, you don't need to intubate the patient. 1 is gone. 2 and 3, you left below. Now, what do you want to do? Test taking strategy. Every time they give you a question about somebody having overdose, and they give you an option of lavage and antidote, think about it. If you taking an aspirin, 1 to 2 hours is still in your stomach. Therefore, the best way to remove the aspirin from your body when it's within 1 to 2 hours is lavage. After 1 to 2 hours, you already absorb it. So the best thing is to give them antidote to bind to the medication or help with excretion. Sodium bicarbonate help with the excretion of aspirin. And so that's the right answer. And that is the content you should master. Time is important with the aspirin overdose. After 1 to 2 hours, give antidote, no lavage. And therefore, 3 is the right answer. And next is reviewing the medication history of a client prescribed what? Ibuprofen for arthritis pain. Which condition requires caution with NSAID therapy? Patient has what? Arthritis, right? And we're giving them ibuprofen. What condition should you worry about when you give them NSAID? NSAID affects things. It has multiple side effects, so many side effects, and one of the major side effects is shown above. It can cause hypertension. It can cause ulcer problem. It is used to treat osteoarthritis. You can sometimes use with migraine. But between 1 and 2, the best answer is what? Peptic ulcer disease, worse than hypertension. Therefore, in this choice, I will take peptic ulcer over hypertension, even though hypertension may be another side effect. The effect is indirect because it causes what? Water retention, and that can worsen your hypertension. But peptic ulcer is a major side effect of aspirin and NSAID therapy. Therefore, NSAID increases the risk of GI bleeding, and you should be careful about it. Which lab should the nurse monitor immediately? The client take acetaminophen, 500 milligrams every 6 hours for 10 days. For chronic pain, the client reports nausea, abdominal discomfort, tell you that something is not right. I take acetaminophen, 500 every 6 hours for 10 good days. There's a lot of medication. That means taking the medication, what, 4 times a day, right? 4 times a day for 10 days. And now I have abdominal pain and nausea. Something is not wrong, right? Which of the following should the nurse monitor immediately? Acetaminophen, the key concept is what? It affects the liver. It's liver toxicity. And therefore, how do I assess the liver? It's by checking lab work that is consistent with the liver. Creatinine is consistent with your kidney problem. The VVC indicates infection. AST, ALT indicate liver dysfunction. Platelet indirectly may be related to liver because of the spleen. But in this question, direct effect is what? Acetaminophen. Platelet is usually will be affected by aspirin. We're talking about acetaminophen. Test taking strategy. 4 questions. How many did you get so far? This is the way it's going to go. I want you to put down your answer in the comment and let me know how you're doing. But these questions, I'm trying to use strategy, critical thinking to lead you to the right answer. NCLEX, know you know acetaminophen, but they will ask you questions where you got to apply. And this is one of them. Which statement by the client indicate understanding of what? Safe use of what? I don't know. The client is prescribed what? Hydrocodone acetaminophen. It means opiate relative, right? Hydrocodone is opiate. He has acetaminophen, maybe Percocet. It does not matter. I see hydrocodone. I know some medication that contain opiate. For back pain, which statement by the client indicate understanding of safe use. That means you're taking opiate. What is the best safe use of opiate? I can drive immediately after taking this medication. It's very sedative. I will avoid alcohol while taking this medication. It's a good idea because both of them are downers. I will take extra dose if the pain worsens. You should not. You should follow the schedule provided. I don't need to monitor bowel movement. You should, because it causes what? Constipation. Therefore, what is the right answer? You can drive immediately after taking medication? No. I will avoid alcohol while taking this medication because alcohol increases the risk of sedation and hepatotoxicity of that medication. Number 2 is the right answer. Which sign requires priority intervention? The client is prescribing naproxen. It's an NSAID, 500 milligram PO daily for rheumatoid arthritis. Test taking strategy, go for the buzzword. What is the buzzword? Naproxen. How many do you taking? 500 milligram daily. What is the question asking you? Which sign require priority intervention? That means what? You have 1 second. Before you answer it, ask yourself, what is naproxen? It's an NSAID. What is the major side effect? Because it's bleeding, because it's fluid retention, hypertension, because it's a bunch of stuff. But look at the answer choice and prioritize one of them. Mild headache, dry mouth, slight ankle swelling, and dark tarry stool. We already addressed this question, and this is the same strategy I'm asking you and content. Headache probably related to fluid retention, but it's a mild headache. Don't get surprised. Stick with what I've given you. Mild headache means mild. It's not hard. It's not bad. Dry mouth, good luck with that. Slight ankle swelling is fluid retention. Black tarry stool means you bleeding, indicative of GI bleed and a serious and NSAID adverse effect. And therefore, that's the right answer. Which is the next best response? A client is prescribed allopurinol for chronic gout. The client asks why daily intake is necessary. Step back. Ask yourself, what is the question asking? It's asking about allopurinol. What is the question? The question said for chronic gout. Patient wanting to know whether I have to take it daily. You have to bring your contents about what? Allopurinol. It's not used for acute situation. Number 1, it's used for what? Chronic situation. Based on that, you should look at it and each answer choice, if one said chronic, you pick it. If one said acute, you let go. Number 1, it prevents future uric acid buildup. It sounds like chronic. It treats the acute gout attack immediately. It sounds like acute. It works best when pain is present. It sounds like acute. It should be taken only when swelling occurs. It sounds like acute. You see what I did? It sounds like acute for 3 answers, and it sounds like chronic for 1 answer. Which one would you choose? It's a chronic condition. Therefore, we take it for chronic as a what? Prophylaxis, not for acute attack. Number 1 is the right answer. Which medication does the nurse anticipate administering? That means which medication the nurse will give. What is the situation? A post-op client receiving morphine shows shallow breathing and unresponsiveness. I give you morphine, which is a downer. All of a sudden, you're breathing shallow and unresponsive. What would I give you? An antidote, right? You pass the stage of me doing anything. Naloxone, acetaminophen, ibuprofen, sumatriptan. Sumatriptan is for migraine. Ibuprofen, we already know, is an NSAID. It's not an antidote. Acetaminophen is not an antidote. Naloxone is the right answer. Naloxone reverses opioid-induced respiratory depression. That is the content that you got to take. That's the concept. Which statement indicates correct understanding? Selected apply. The client is prescribed prednisone for an acute asthma attack. Which of these indicate correct understanding? I should not stop this medication abruptly. Should they do that? I should take this medication with food. Should they do that? I should monitor for increased blood glucose. Is that true? It is safe to take live vaccine while on this medication. Do you think it's safe to take live vaccine while in this medication? I may experience mood changes while taking this drug. Stop the medication. Stop the video. Put down your answer in your comment. Answer it yourself, and then wait and see how I approach it. If I'm taking this test, this is the way I approach it. What is the content? Prednisone. For what? Acute asthma. I don't care about asthma. The question says medication, which is prednisone. Restatement indicate correct understanding. Okay, if I take steroid, I should not stop this medication abruptly. You should not stop it because you got to taper it. I should take this medication with food because it causes ulcer. I should monitor for increased blood glucose because it causes hyperglycemia. It is safe to take the live vaccine while taking medication. It makes you immunocompromised. Therefore, you should not take live vaccine. I may experience mood changes while taking medication. It causes psychotic overtone. How do you answer this question? This is your mnemonic. Abrupt cessation, live vaccine, and monitoring for hyperglycemia are important consideration for what? Steroid. But this is what I want you to remember. Sugar M. Sugar M. That is the key to remember the mnemonic. Well, S is what? Sugar will go up. The U will do what? Use what? Food to decrease ulcer. The G is what? Gradual taper, right? The A is what? Avoid vaccine. R is what? Review their mood. And M is monitor for infection. So sugar M is what you need to know about steroid. And so these are the answers. 4 answers are right. Number 4 is wrong. You should avoid live vaccine. What is the first action? First action means you do something to prevent patient from getting complication. I did a video on first and best. It's on adult and class. You should look at it. First and best. In this question, first means I need to prevent complication. It may be emergency, so I need to act right away. A post-surgical client uses a PCA pump for pain. The next note, sedation score for 4 out of 4. That means bad. It's completely gone. And saturation is 88. The first action is to fix the complication. And the best action is to overall, this patient needs oxygen. So overall is basically dealing with the problem. But the first action is to what? Stop the PCA. Stop the poison that is causing this sedation. You should not administer another opiate. Encourage breathing, maybe probably the best action, or give them oxygen. But to stop the medication is the first thing to prevent the offending agent from getting to the patient. This is the right answer, and this is the way to approach first and last patients or best patients. This is the best approach for first and the best questions. So severe sedation and hypoxia indicate opioid overdose in this patient. So stop the poison. A client is prescribed sumatriptan for acute migraine. The client has a history of hypertension, bad problem. Which teaching point is essential? The key is sumatriptan causes vasoconstriction. Therefore, if you have coronary disease, hypertension, stroke, you should avoid it. Therefore, what teaching should you provide? Take this daily to prevent migraine. One thing you need to know about sumatriptan, you don't take it daily because of vasoconstriction. You take it a few hours or after the onset of the problem, that decreases the duration of it, right? Report chest pain is good because you may have ischemia. This is safe with any heart condition. It's not safe. You can take multiple doses in an hour. You should not. So the right answer is 2. So triptan can cause vasoconstriction and can cause cardiac event. Which statements show risks for overdose? A client with multiple over-the-counter cold medication contain acetaminophen. There's a bunch of cold medication that contain acetaminophen. If you take them multiple times, you get overdose. I take 500 milligrams every 6 hours. I read labels for acetaminophen context. I combine multiple cold medicine daily. I avoid alcohol while taking the medication. You can see the best one and the wrong one, and the one that indicates overdose is combining a bunch of them. The dosage add up, and you may have complication. So avoid combination of this medication. Which lab work in should the nurse monitor about what? Patient taking ibuprofen 3 months. bunch of stuff. Does it affect your kidney, your liver, your CVC, your blood glucose, or electrocardiogram? Yes, it does. It affects your kidney. That's number one. It affects your liver. That's number two. Because it's bleeding. That's number three. These are long-term use of that medication, and you should be careful. It does not affect your glucose or electrocardiogram. A client or more often report constipation. What is the best nursing intervention? That means the overall treatment of constipation. Don't give them laxative, but the overall treatment of constipation is what? Increase dietary fiber and fluid, administer another opiate that's going to worsen it. Bed rest is going to be a problem. All other pain medications, not an option. Give them fiber and fluid. A client reports pain of 9 out of 10 after IV morphine. What is the next best action? Document pain and continue monitoring. Assess vital signs. Tell the client to endure the pain. Switch to NSAID without assessment. What do you think? These answer choices are made it so it's easy for you to understand them, that I want to show you that if you have pain and I give you the medication, no matter how high is your pain, 10 out of 10, I still need to make sure whatever I give you works. Therefore, assess for vitals. You need to reassess. The client start celecoxib for chronic pain, which symptoms require immediate reporting. These Celebrex, very, very notorious. It causes cardiac problem. So every time you see it, always pick a cardiac question. Slight knee stiffness is because of the what? Chronic pain related to that. Slight ankle swelling because it's NSAID, it may retain water. Occasional headache because it's retaining water. But shortness of breath is a cardiac issue related to fluid overloaded or ischemia. And therefore, that's the right answer. 16 questions.
The first question, as you can see, is just testing your knowledge about what medication you need to hold and you need to give to the patient when they're going for dialysis. This is what nursing school NCLEX will ask you on pharmacology. Which medication should the nurse hold until after dialysis? Select or apply. A nurse is preparing morning medication for a client on hemodialysis, right? The client is undergoing hemodialysis. Which medication should you hold until after dialysis? There's a concept regarding these medications. The first thing you should know, any medication that can be cleared by the kidney during dialysis, you got to get rid of it. Anything that is going to cause hypotension, you should avoid it. Otherwise, you can give them most medications. As you can see, antihypertensive, phospholipid, erythropoietin injection, insulin, and carbamazepine. What do you think? Stop the video, put down your answer, and think about it. I give you the facts already. Phospholipid is going to decrease what? Phosphorus in the blood. So that's good to give it to the patient when they're going for dialysis. It helps with dialysis. Erythropoietin is going to increase red cells. It's not going to be affected by dialysis. Insulin, you don't want the patient to be hyperglycemic, therefore you can give it to them. And carbamazepine, you don't want them to have seizures, so they can have it. Antihypertensive, you should avoid it because it causes what? Hypertension. So key fact, anything that is going to cause hypertension, diuretics, water-soluble vitamins like vitamin B, C, and folic acid, you should avoid it. Antibiotic can also be cleared during dialysis, so they should avoid it. Any other medication, you can give it, but you got to check with the provider. But these are little ones that the NCLEX will ask you. Don't forget about antihypertensive, diuretic, and water-soluble medication. But most medications, especially renal failure medications, can be given. Phospholipid, erythropoietin, insulin, and if they have seizures, you can still give them their carbamazepine. You don't want them to have seizures, otherwise they get into trouble. That's the key. So antihypertensive is the only answers. It's a select or apply. You just pick those that you're confident. Next question, which findings should the nurse prioritize? That means there's one medication you should pay attention to prioritize. A nurse is caring for a client, prescribe what? Betanocol. Key fact, you have to understand what or know what is betanocol. If you know it, then what do you think? Bladder scan show 500 ml urine in the bladder. Client report difficulty initiating urination, blood pressure of what? 100/60 and hypersalivation. This question, I want you to put your answer there and let me know what you think, but it requires critical thinking. At the same time, common sense and know the medication. It's a renal medication you're supposed to know, mostly for the bladder, botanical. What do you think? The key fact is this is a cholinergic. We give it to people who have urinary retention. So cholinergic will cause the bladder to contract. Therefore, number one is a trap, right? Bladder scan shows 500 ml. That is the reason why we prescribe bethanochol. Client report difficulty initiating urination. 1 and 2 are saying the same thing. That is the reason why we give them bethanochol. Blood pressure of 100/60, bethanochol, which is a cholinergic, will decrease your blood pressure, but this is normal. Hypersalivation is a side effect of a cholinergic effect. You have drooling associated with salivation, and that can affect your airway. So that's the key. Number 4 is your right answer. So bethanochol stimulates parasympathetic nervous system, and all the signs and symptoms about cholinergic side effect is what you pay attention to. 1 and 2 is the reason why we prescribe the medication. Key fact. Next question. Which client statement indicate a need for further teaching? That means they're saying something wrong. That's the buzzword, something wrong. So you have to know the concept and figure out if they're saying something wrong. A client with what? Acute urinary tract infection is a UTI. Is prescribed what? Phenoxyparadine. That's the medication. Phenoxyparadine. Therefore, these medication, phenoxyparadine, is the key aspect. If you know everything about it, then you can answer the question. The patient saying what? This medication maintain my urine a reddish orange color. I will take this antibiotic for 7 days. I can stop taking the medication. Once my burning goes away, I should report my yellowing of skin or eyes to my provider. I give you 10 seconds. Put down your answer and let me think. Think about it. The medication is for phenoxyparadine. What do you think? Why do we prescribe it to patients who have UTI? This is a common medication. They like asking regarding renal pharmacology. It's good to know. What do you think? I know you put down your answer already. But the first thing you should know is this is not an antibiotic. Okay, this is not antibiotic. It's used for what? Analgesic, to help with the pain, the burning, sometimes the spasm, but mostly burning and the urgency and the frequency. So this is what the medication is used for. It's not an antibiotic. It will turn your urine reddish orange. That is normal. I will take this medication for 7 days. Antibiotic is wrong. It's not antibiotic. You can stop it if the burning goes away because it's a pain medication. If you don't need it, you don't need to take it out. And if your urine is changing color or your skin, this is liver toxicity, can have hepatotoxicity. Therefore, you have to do something about it. But the key aspect is not antibiotic. Always look for it. It's not antibiotic. It's what? Analgesic. Therefore, number 2 is your right answer. Which findings should the nurse prioritize reporting to the provider? That means something you see that you got to talk to the provider. Prioritization. Nurse is reviewing medication for a client with chronic recurrent UTI who is prescribed long-term nitrofurantoin therapy. Forget about it. It's a long question. Rewrite it. Patient is on nitrofurantoin therapy. Which one should I prioritize? I rewrote the question. Now I have control over the question. I need to prioritize a patient taking nitrofurantoin. Which one do you think? Your urine turning yellow? A patient has headache, persistent cough, and nausea after taking the medication. Stop the video, 10 seconds, put down your answer choice, and let me know what you think. This medication you need to know is very important. Its side effect is very important because we use it for UTI, but it can cause major problem. What do you think? The right answer is not number 1. Turning your urine yellow is expected finding, right? Headache is one of the expected finding. They take some Tylenol to help with that. Persistent cough is a problem. Nausea is not the problem. But the major problem is persistent cough because it causes pulmonary fibrosis and interstitial lung disease. Therefore, that is your key. Anybody on what? Nitrofurantoin, look for cough, look for shortness of breath, look for dyspnea because those are bad side effects associated with the medication and we need to stop it. So number 3 is your right answer. Which instruction should the nurse include in the client teaching? That means you got to teach them. A nurse is caring for a client with what? Recurrent UTI is prescribed what? Sinosacin. Do you know this medication? You know it. This is an old medication, but sometimes they can use this medication in the test. Sinosacin, I can tell you, is a fluoroquinolone. Therefore, I've given you a clue. It's a quinol, fluoroquinolone. It's the same thing as what? Ciprofloxacin. They are in the same group. If you know ciprofloxacin, then you can answer this question. Take this medication with milk to reduce stomach upset. Avoid prolonged sun exposure while taking this medication. Limit fluid intake to prevent renal irritation. Stop the medication if you experience mild nausea. The question says the nurse should include in the teaching. Therefore, what teaching do you provide? Forget about the name of the medication. Sinosacin does not matter anymore. I told you what it is. It means it's a fluoroquinolone. What teaching do you provide for a patient taking fluoroquinolone? Milk should be avoided. They should not take it with milk or dairy products. So number 1 is gone. Right? You can't stop taking the medication if you have mild nausea. It's an expected finding. Right? You should avoid sun exposure because it makes you photosensitive. Therefore, you have rash on your skin. You should not limit your fluid because what? When you limit fluid, you can clear the urine. This is why you have UTI. Drink a lot of water and wash everything out. So the concept is sinosacin is a quinolone. Fluoroquinolone is an antibiotic for UTI. It causes photosensitivity. You should avoid milk, dairy product, antacid, and drink a lot of water to flush it out. Which intervention should the nurse prioritize? Prioritization 101. A nurse is caring for a client prescribed what? Propanthyline bromide. Propanthyline bromide for peptic ulcer disease who has a history of urinary tract infection. Which of these should you prioritize? Once again, circle the medication, propanthyline bromide, and I need to prioritize for patient prescribed for what? Peptic ulcer disease or as urinary retention. Schedule the medication 30 minutes before meal and at bedtime. Instruct the client to increase fiber and fluid intake. Monitor for decreased gastric pain. Question the prescription. What do you think? 10 minutes. This is critical thinking. This pharmacology, renal pharmacology, questions and answers with the rationale, aspect rationale to let you think. When you see these questions again, you will never forget it. I yield fact for you. Think critically. The medication is what? Propanthyline. You need to pay attention to. Giving to the patient for peptic ulcer, patient has urinary retention. The key is what? You need to prioritize. If you have ulcer, hey, yeah, you take the medication 30 minutes before meal at bedtime, okay? Instruct the client to increase fiber. Why do I do that? It has nothing to do with peptic ulcer disease. This should tell you something. Monitor for decreased gastric pain. Well, you're taking medication to help with peptic ulcer, your pain will go down. Therefore, you can see 1 in 3 is gone. Now you're left with what? 2 and 4. Instruct the client to what? Increase fiber, prevent complication associated with the medication, and 4 say question the medication. That means there's something in the question that the patient should avoid. Critical thinking, you're analyzing each question and make sure they don't contradict each other and they're giving you a clue. 4 and 2 are giving you a clue. 1 is said, take care of it, treat the complication, and 4 said, don't give it to the patient at all. Key fact, that medication, propanthyline, is what? Anticholinergic, which causes urinary retention and therefore it causes all side effects. The reason why you have to increase your fiber and fluid intake is because what? It's an anticholinergic. It causes constipation. So we don't want you to have constipation. Patients already have urinary retention. If you give them anticholinergic, they're going to go into bad urinary retention. Next, you question that order. Which finding required the highest priority intervention by the nurse? A client with what? Recurrent pyelonephritis is prescribed ciprofloxacin. It means you have recurrent bad UTI involving the kidney, not the bladder, the kidney itself, and have been prescribed ciprofloxacin, that is fluoroquinolone. You have to know the key fact about fluoroquinolone. This is the same thing at the previous question. What do you think? You should prioritize. Client report nausea when you take the medication. You report Achilles tendon pain when walking. Report dizziness after standing up quickly. Report metallic taste in the mouth. You got to be sharp. Think critically. Which of these problems I've listed is most important associated with fluoroquinolone? What do you think? Put down your answer. Stop the video. Let me think. We are doing a test. You are part of it. I want to know. We've answered 7 questions. How many do you guys so far? 5 out of 5, 6 out of 6, 7 out of 7. This is the 7th question. Put down your answer. Let's think. Number 1, fluoroquinolone. Key fact you have to know about them. Avoid what? Dairy product. Avoid what? Milk. There is a black box warning about tendon rupture, right? It also causes photosensitivity. You got it. That's the concept. Every time you see a fluoroquinolone, that's what you're going to use to answer the question. Therefore, what is the key? Tendon rupture is the most important. Achilles tendon, I should worry about it. If you take the medication, you have nausea, it's fine. Dizziness, orthostatic, just get up slowly. Metallic taste is an expected finding. Therefore, this is what you need to pay attention to. A nurse is providing discharge teaching to a client, prescribe what? Prescribe trimethoprim sulfametazole for UTI. Which client statement indicate a need for further teaching? You've seen this medication before on pharmacology regarding antibiotic. Same thing, same strategy. It doesn't change. It has the same name. Therefore, it's a sulfur drug. We use it for what? UTI. What do you think? Drink a lot of water, 8 glasses of water a day. Let the doctor know when you see rash. I will limit my time in the sun and use sunscreen. Take the medication with what? Orange juice every morning. Think about it. When you answer questions, don't rush. Read the question again. Patient taking some sulfur drugs, some sulfonamide for what? UTI. Which client statement need further teaching? Well, drinking a lot of water is good when you have UTI. Letting the doctor know that you have a rash is also very important. Do you put sunscreen on yourself or do you take the medication with the orange juice? Test taking strategy. Sulfur drug, I know about them. You should know the side effect. Patient is taking this medication. You need further teaching. Look at the answers. 2 and 3 are saying the same thing. I wear sunscreen and I say rash. Something should tell you that there's some photosensitivity associated with this medication. Therefore, 2 and 3 are okay. But one said drink water, another one said drink orange juice. Which one do you think is? One said, I would drink a lot of water. The other one said orange juice. You can't drink water and then drink orange juice at the same time. Something is wrong. The key is you should not drink orange juice because orange juice will make the sulfur drug crystallize and it form more kidney stone. Therefore, 4 is the right answer. The key fact is sulfonamide, you should drink it with a full glass of water. Take it with a full glass of water, not orange juice, because then it will crystallize and it cause problem. A nurse is reviewing home medications for a client with end-stage renal disease. Which over-the-counter drug require immediate teaching? Look, kidney disease, there's one medication you should avoid. This is a bonus question, and you should see that NSAID, a bad problem, does not require you to be taking this while you have end-stage disease. You should avoid it. You should avoid it. You should avoid it. This is a bonus one. The client with chronic kidney disease is prescribed calcium carbonate. What is the expected therapeutic effect? Prevent cardiac arrhythmia, improve your urine output, reduces potassium level, and bind dietary phosphorus. When it comes to kidney problem, any problem they have, we try to counteract it. First, they have high potassium, so we give you things to lower your potassium. Their phosphorus is high, we give you things to lower it. The calcium is low, we give you things to offset it. The reason why we give you calcium carbonate is what? Do we giving it to you to decrease your cardiac arrhythmia or improving your urine output or reducing your potassium or binding your dietary phosphorus? Don't pick potassium. When I give you calcium carbonate because your potassium is high, it's to protect your heart, not to decrease your potassium. It does not decrease your potassium. When in chronic kidney disease, your calcium is what? Low, and your phosphorus is high. So what we do, we give you more calcium to counteract the effect of phosphorus. So it's a binder. We're not preventing cardiac arrhythmia. It does not affect your urine output. It's exchanged with phosphorus. So the right answer is that it's a calcium, it's a phosphorus binder, and get rid of your phosphorus. That's the key. And it's reinforcing this dietary teaching for a client taking phosphorus binders. Which meal choice indicate correct understanding? Phosphorus binders is going to bind things in your GI tract to prevent you from absorbing what? Phosphorus. Therefore, which diet meal choice do you think you should be taking? Well, if I'm giving you phosphorus binders, you should not be taking too much food that has high phosphorus. That's the key. Which one you know? Cheeseburger with mixtures, fried fish with coleslaw, baked chicken with rice and green beans, pizza with extra cheese. These are hard questions, but think about it. If you don't know, the concept is this. This is the concept. I need you to memorize this and know them. Fresh fruits, vegetables, chicken, lean meat, egg white, and rice and pasta are the key things that when you're talking about kidney disease patient, this is what you give them because you don't want them to have high phosphorus. So the right answer is number 3. All other choices are wrong. But the best way to answer these kind of phosphorus high-level medications or diet is to know these are put on the screen. Fresh fruits, vegetable, chicken, turkey, lean beef, egg white, not the yolk, rice and pasta. And you can educate the patient. So any other option they give you, don't pick it. Know this one and say, this is what I will give you to a patient with kidney disease. Any others, I just avoid it. 11 questions. What is your score? Put down in the comment and tell me you're ready. Type, I'm ready. Type, I'm ready. I've got 11 out of 11. That's the key. 4 more. And next is reviewing intake orders for a client with end-stage disease. Which medication should the next question? Patient has end-stage disease. What should you avoid? Morphine, acetaminophen, and gentamicin, erythropoietin. What do you think? Put down your answer choice. Comment and explain to me why you pick whichever. Patient with kidney disease should get pain medication. Nothing wrong with it. Acetaminophen affects your liver, not your kidney. Gentamicin is nephrotoxic. And any patient with end-stage disease, we give them erythropoietin to improve their red cells. Therefore, 3 is the right one. A client with chronic kidney disease is prescribed Savilama. Which teaching is correct? Take this medication on empty stomach. Take this medication with meal. This medication increases calcium absorption. This medication replaces potassium. This is the same thing that we saw, but I changed the name of the medication just to trap you. Savilama is what? A phosphorus binder. If I give you a phosphorus binder, what would you do? Think about it. Take this medication on empty stomach. The phosphorus binder, if you eat food, is supposed to absorb phosphorus from your diet. So you should take it with food. Take this medication with meal. Makes sense, right? This medication increases calcium absorption. It does not increase calcium absorption. It binds to phosphorus, and it may indirectly increase calcium, but not absorption. This medication replaces potassium. It does not. Therefore, the right answer is a phosphorus binder. You should take it with food, and that's what you teach the patient. And next is caring for a client receiving erythropoietin, a good medication to know because it's very testable. The broad effect is used in kidney disease, which finding required the nurse to withhold erythropoietin or epoetin alpha and notify the provider. There's a concept you have to know about this medication. A hematocrit of 32%, hemoglobin of 11, headache, and blood pressure of 140/70. These medications are used to increase your blood cells. The major side effect is hypertension. If your blood pressure increase, you get headache. So the major side effect is headache. Hematocrit is not that high. If it's like over 40, yeah, we don't even let you get there. But after 35, we stop it. Hemoglobin, if you're greater than 11, we stop it. This blood pressure is not bad. Therefore, headache is the major side effect. So erythropoietin early toxic sign is headache. Then you have hypertension. So that's when you hold the medication if your hemoglobin greater than 11. Last question. Client with hyperkalemia is prescribed sodium polystyrene sulfonate, KSLate. Which intervention should the nurse include, select, or apply? You have to know this medication. They're not going to give you KSLate. They will give you sodium polystyrene sulfonate. What do you think? It's also what? Used to decrease potassium. But there's a way it does that. It's given orally, and you have to have diarrhea. But the diarrhea, we got to titrate it and see how much. If you cannot have bowel movement, you cannot take it. Because it's a what? It's a sodium polystyrene sulfonate. You see the sodium there is going to exchange with potassium. So I decrease your potassium and I increase your phosphorus. Therefore, what are you going to do? We need to monitor your what? Bowel movement. We need to check your potassium. We need to check your sodium. Antacid is going to affect it. Access for constipation and diarrhea, because if you have constipation, you can have necrosis. Therefore, what are the right answer? Monitor for bowel movement, monitor for hypokalemia. You should check the individual sodium level, and then you should assess for constipation and diarrhea. If they have a constipation, that means you should stop the medication. These are the concepts you have to know
to test your knowledge on anticoagulants. These are what the NCLEX will trap you, and they are teaching risk reduction question, which client statement indicate need for further teaching. They're saying something bad, and then scare for several clients on what? Anticoagulant. All of them are anticoagulant. If you're on warfarin, I will need weekly blood draw. Is it a good thing to say? Enoxaparin, I will need weekly blood draw. Is that right? Rivaroxaban, I will increase vitamin K diet. Is that okay? I will use electrical shaver instead of razor blade. Dabigatran. Warfarin, I will limit intake of vitamin K rich diet. These are our statements from clients. Stop the video. Let me know what you think. But I'm going to give you the buzzwords and the key things the NCLEX will ask you. Warfarin, of course, I need to check your INR, right? Therefore, I need you to have your blood draw at least once a week. That is fine. Enoxaparin is an heparin. Heparin does not need blood draw unless it's IV form. Enoxaparin is a sub-Q form of heparin. You don't need blood draw. Rivaroxaban has nothing to do with vitamin K. It's not coumadin. What is direct heparin inhibitor? Therefore, what is it going to do? You don't need any lab draw. Dabigatran is the same thing. I will use electrical shaver instead of razor blade. It's a good thing because you're going to bleed. I will limit intake of vitamin K rich diet because I'm on warfarin. That's a misconception. You should not increase it. You should not decrease it. Consistent amount. Therefore, what is the key? If you're on warfarin, diet is consistent and you need lab draw. Other anticoagulant, you don't need any diet changes and no lab draw. Therefore, number 3, need intervention, further teaching. You should not change your diet. And number 2, enoxaparin does not need blood draw. And then warfarin, don't change anything, consistent amount. This question is big, it's high yield, and please love it. It's a good teaching. Please know it. What is the next priority action? That means what you do first. What do you do first? There's 2 questions with this particular question, same stem. I'm trying to teach you something. Priority, what do you do first? Client is on what? Heparin has developed platelet of what? 40,000. What does that mean? If you're on heparin and your platelet drop, we call it heparin-induced thrombocytopenia. What would you do if that happened? Do you continue heparin at lower dose? Do you stop the infusion? Do you check their GCS or increase fluid? Concept, test-taking strategy. The thing said priority. Priority means you have 1 second. What will you do? First thing you do. If I'm giving you a poison and it's making you sick, I should stop the poison. Continue at the lower dose, you still getting the poison. Assessing the GCS, you're expecting some bleeding in the head. That's why you're assessing that. Increasing your IV fluid, you're still giving the poison. What you need to do, stop the poison. Stop the poison. The patient has developed heparin-induced thrombocytopenia. You need to stop it. Now let's look at the wrong answers. Continue heparin at lower dose, you're giving them heparin. You need to stop heparin completely. If you're looking for GCS, what do you think? You expect them to be bleeding. But heparin-induced thrombocytopenia, the major complication is not bleeding, it's thrombosis, stroke, and pulmonary embolism or DVT. Therefore, you're thinking otherwise. Of course, they may bleed, but number one is thrombosis. IV fluid is not happy. Stop the poison. What is the next best action? Same patient, same situation, but change the word best action. This is what the NCLEX will do to you. Same questions, and you see different, they change one word. You say, what did happen? I made a mistake. No, they testing something. The first one I said priority, which is the first. Now I said best. Best means what? You deal with the first thing, and now the best is the overall management of the patient. It's not the first, it's not the priority one, it's the best. Therefore, if you take in heparin and you develop low platelet, you have thrombocytopenia. What do you think the doctor is going to do? Continue heparin at lower dose, recheck your platelet, assess for your GCS, or give them dabigatran. Think about it. If you know this, put that in the answer choice. But this is a concept you have to know. When you develop heparin-induced thrombocytopenia, we stop all heparin and we give you other anticoagulants. That is the most important thing. That is the best action. The first action is to stop it, and the best action give you other form of anticoagulant. And that other form is dabigatran. Assessing for the GCS, like I said, you're looking for bleeding instead of thrombosis. Checking for platelet is not going to help you. And continuing heparin at lower dose, patient has heparin-induced thrombocytopenia. Stop it. If I said the first, you stop the medication. If I said the best, you treat them and give them dabigatran. So watch for that question. The clients. 6 clients in emergency department present with left facial droop, slurred speech, and normal CT. Think about it. Connect the buzzwords. Connect the buzzwords. And let me know what you think. Left facial droop, slurred speech, and normal CT. What do you think? This is stroke. And what am I going to give you? Artiplex. If you're taking the NCLEX and they give you a case study on a stroke, you're going to get Artiplex. If you see a standalone question and you see a stroke, they're going to give you Artiplex. So know this question. I intentionally give it to you. This can be a full lecture. You'll see it on YouTube. That what are the contraindications for Artiplex in the patient with a stroke? Anybody who had surgery 4 weeks ago? Anybody who had brain surgery 6 months ago? Anybody with atrial venous malformation? Anybody with this blood pressure? Anybody with stroke 2 months ago? Anybody with recent surgery? The key is to know this. Take your pen and a paper. I want you to write this down. And don't forget, contraindication for Artiplex. If you have surgery 4 weeks ago, it's enough. All you need is 2 weeks. Abdominal surgery. If you have brain surgery, you need at least 3 months. If you have atrial venous malformation, that's bad. That is going to cause bleeding. You should have uncontrolled hypertension. If it is, you're not going to get it. This blood pressure is good. If you had stroke, it should be more than 3 months. This patient had stroke 2 months ago. We have a problem. If I say recent surgery means just now. It does not matter what time. Recent remain recent. Recent surgery is bad. Therefore, recent surgery, stroke within 3 months, uncontrolled hypertension, atrial venous malformation, brain surgery within 3 months, abdominal surgery within 2 weeks. These are the things you have to know, and they're going to show up on the NCLEX. Which of the following drugs should the nurse suspect may be prescribed as antiplatelet therapy? Select reply, and nurse attend a staff education on antiplatelet medication. You have to know them. You have to recognize them. You have to be able to see, said, oh, these are antiplatelet. What do you think? Which of these is antiplatelet? I know you know aspirin. Maybe you know about clopidogrel, but do you know about tachygrelor or pentoxifylline or dipyridamole or prasugrel? What do you think? Are these anticoagulant? Are these antiplatelet? Are these thrombolytic? I give it to you. All are antiplatelets. How do you recognize them? This is your mnemonic. The mnemonic to remember them is this. This you shouldn't forget. A cool, tiny platelet drop pieces. Therefore, each letter represents the medication. A for aspirin, C for clopidogrel, T for tachygrelor as you go down, P for pentoxifylline as you go down. Remember them, a cool, tiny platelet drop into pieces by these medication. That's the acronym to remember all the antiplatelet. And the big one is aspirin, clopidogrel, and tachygrelor, and then pentoxifylline. Don't forget about them. Know them. Which medication should the nurse expect to administer? A client receiving heparin infusion start hematuria, side effect of heparin. You bleeding because you get a heparin. You have overdose heparin. When you bleed from heparin, means you have overdose. What is the antidote for heparin? Protamine sulfate, vitamin K, warfarin. You see, atropine is off. Now you're left with warfarin, vitamin K, and protamine sulfate. Vitamin K and warfarin are friends. Therefore, A is your right answer. You see, that's the easy way to learn these things. Protamine sulfate is the antidote for heparin, and vitamin K deal with warfarin. Therefore, what do you think? H2P and VNK, those are the acronym to remember. HMP, heparin and protamine sulfate are friends, and vitamin K and warfarin are friends. Number 7, a client taking warfarin asks about dietary restriction. Which food should the nurse teach the client to ensure consistency? The key word is warfarin, and the key word is consistency. What is warfarin going to do? Bind to vitamin K dependent factors. Which of these contain high level of vitamin K dependent factors? Not orange, not potatoes, no chicken. It's usually what? Spinach. Therefore, which one we should ensure to have consistent amount? That's number 2. That's all you need to know, because it contains a bunch of what? Vitamin K dependent factors. So number 2 is your right answer. A nurse is monitoring a client on warfarin. Which laboratory results indicate the medication is therapeutic? When you're warfarin, I need your INR to be what? 2 to 3. Which of these is 2 to 3? Number 3 is your right answer. These are straightforward questions, but easy to mix. So I just want to make sure you know them, and then we talk about them. And then prepare to administer enoxaparin, Lovenox. What is the correct site? It's given as sub-Q. What would it be? Sub-Q. Deltoid is not a sub-Q. Pistalis lateralis is not a sub-Q. Glute muscle is not a sub-Q. Test taking strategy. Number 3 is your right answer. And hence has provided teaching to a client, prescribe clopidogrel. We saw it. It's an antiplatelet. Which client statement indicate a need for further teaching? It's a bleeding medication. Therefore, if they say something they don't understand, well, that's what you pay attention to. I will call with dark stool. I will avoid green leafy vegetables. I will take acetaminophen for knee pain. I will use soft Bristol toothbrush. Causes bleeding. Using soft using soft Bristol toothbrush is good. I will use acetaminophen for knee pain. I don't want to bleed. I will avoid green leafy vegetables. It's a bad idea. There's no need to change anything when you're clopidogrel. I will call with dark stool. You blink, you bleeding. Therefore, patient does not understand number two because they think they can change their diet. In clopidogrel, it's an antiplatelet. Therefore, no diet modification. And this is caring for a client with anemia, prescribe ferrous sulfate, iron. Know this because it's common. A lot of people are on it. And NCLEX will ask you, these are little questions you don't want to miss. What do you think? Which teaching is most important? Take it with milk, expect dark stool, stop it if you're constipated, and avoid vitamin C. All are trap answers. Trappy answers. Number one, you should avoid it taking it with milk. It affects absorption. Number four, vitamin C rather help with absorption. So you should rather take it with vitamin C and avoid milk. Stool, dark stool is expected finding. That's what iron does. I'll give you the mnemonic. It's going to cause constipation. Therefore, which is the most important? Expect dark stool. But what is the key word? Dark stool are expected. Milk reduces absorption and vitamin K enhances absorption. But what is the mnemonic I want you to take with you? Iron, I'm rusty. Stool is going to be rusty black. That's the buzzword. And next knows the treatment is effective when, which is finding it okay. And next administer vitamin B12 injection to a client with pernicious anemia. That means they have what? Pernicious anemia due to vitamin B12 deficiency. That's a megaloblastic anemia. If patient is anemic, what do you think they're going to do? The question is asking you effective. That means there's improvement in the anemia. Reduce fatigue, increase appetite, absence of bruising, and increase urinary output. What do you think? Fatigue is consistent with anemia. This question is not testing anything, just to tell you they will give you questions like that. That is straightforward. Pernicious anemia, you have fatigue, you get tired, you have shortness of breath. Effective teaching, I'm going to do better. Reduce fatigue. 13, which prescription should the nurse anticipate from the provider? What do you think you should expect? An nurse care for a client with what? Moderate claudication. 13 questions. How many have you answered so far? I know you get 13 out of 13. Put down your score down. I want to check your score. I will watch this video multiple times and see how many people put their score there. Don't be shy. Put it down and let me know how many you check it. But these are hematology questions. You have to be able to identify them. And do not make the question too hard and make it concept-based. That when you know the concept, the answer choice is right there. Claudication. What medication will you give? Remember that in claudication, we want to improve blood flow, right? I see warfarin, I see pentoxaphylline, enoxaparin, and dabigatran. There's a test-taking strategy here. Do you see it? Put down your answer choice. Let me know. If you're taking this test, I want you to use this test-taking strategy. There's 3 anticoagulants there, and there's 1 antiplatelet. Something should tell you that all the 3 anticoagulants are wrong. Warfarin, enoxaparin, dabigatran are wrong. The right answer is pentoxaphylline. Why? It's an antiplatelet and increase red blood cell flexibility and decrease blood viscosity, and they allow blood flow. So patient with claudication, expect them to have pentoxaphylline. Know this medication. It's a good test-taking strategy and a drug that to be aware of. A client prescribed with folic acid. You have to know, given to pregnancy, it's a folate. What is the purpose of it? To prevent your blood pressure, to help your baby spinal cord develop properly, to prevent gestational diabetes and reduce morning sickness, of course. Neurotube defect. Which one is neurotube defect? Do you see any neurotube defect there? Spinal cord development properly. That's the key. And the last question. And nurse is preparing to administer IV iron dextrose. Remember, iron, we have oral form and IV. If we have to give you 2 IV, you got to be careful. It's very dangerous. It's very dangerous. It's very dangerous. I'm giving you a clue. What is the priority next action? Don't flush IV with heparin. Administer a small test dose, mix it with the vitamin C, and give IV in the deltoid. You use the vitamin C with the oral form, but not IV form, right? This is an IV. It cannot be IM injected in the deltoid. You're left with 1 and 2. If you don't need to flush heparin, right, give them small dose because it can cause anaphylaxis. So the right answer is iron dextrose can cause anaphylaxis. Therefore, small dose until you know the patient is doing well. 15 questions. It's just to get you set up. It's a pharmacology, but at the same time, you have to know from fundamentals of chemotherapy drug. And Nancy is teaching a new graduate about chemotherapy safety precautions, which statements are correct. Select or apply. The buzzword is chemotherapy safety precaution. And we want to select or apply. Pick those that you are 100% confident, but read the answer choice and see if it makes sense, right? It's a chemotherapy drug. Most of them are vesicant. Most of them are poison. And therefore, based on that knowledge, what do you think? Wear PPE when preparing chemotherapy drug. Dispose of chemotherapy waste in a puncture-proof label container. There's a reason why those words are there. Wash hands before and after handling chemotherapy agents. Wear gloves when giving vesicant chemotherapy drugs. Use a dedicated biohazard container for chemotherapy contaminated linen or body fluid. These are our buzzwords. Disposal of chemotherapy drugs and tubing in the regular trash. You see, I use the word regular trash. The key word is what? Of course, you touching a poison, a chemical, where your PPE, right? Disposal of your chemotherapy waste in a puncture-proof label container. That's the right thing you're supposed to do. Wash hands before and after handling chemotherapy agent. That's right. Wear gloves when giving vesicant chemotherapy drug. That's right. Use a dedicated what? Biohazard container for chemotherapy contaminated linen or body fluid. That's good. Disposal of chemotherapy drugs and tubing in the regular trash. That's not good. Therefore, how do you remember these medications and what fundamentals of pharmacology regarding chemotherapy agent? What do you need to know? The mnemonics is what? Chemo. And I will show you. The first one that we talk about is what? Wearing your PPE. That's good. Then you dispose them in a puncture-proof label container. Then you wash your hands before and after handling chemotherapy agent. Of course, you got to use a dedicated biohazard container for chemotherapy contaminated linen and body fluid. And then you got to wear gloves. You should not dispose chemotherapy drug and tubing in a regular trash. So what does that mean? Chemo. Chemo means this. This is the mnemonic fundamentals of chemotherapy pharmacology drugs. And this is what you're supposed to know when they ask you questions on fundamentals. C is what? Contain waste properly. That means biohazard containers, not regular trash. You don't put them in regular trash. You got to wash your hands before and after, right? The E, wear your equipment. Those are your PPE. Protect your face, high shield, splashes, any area there's going to be splashes, you got to protect yourself. And M, make sure you mark or label waste as what? Chemical hazard. And use what? Punctured proof container. Very, very important. And the O, I did not put it as one of the answers, but only trained staff should be able to prepare and administer chemotherapy. Never forget these chemo mnemonics. This is going to help you with fundamentals regarding chemotherapy agents. Number 2, a client receiving chemotherapy developed tumor lysis syndrome. Which lab results is a priority? This, you got to bring your content.
What is tumor lysis? This is the tumor cells. Inside the cell, we have a bunch of potassium, right? That's the first scheme. And then we have a nucleic acid over there, like that. This is the problem. And therefore, outside the cell, we have a bunch of calcium, right? When you expose the cell to chemotherapy, everything will burst. And you have a bunch of phosphorus inside. When the tumor bursts, potassium level increases. You go outside into the blood. What happens? Your nucleic acid goes up. Your phosphorus goes up. And you go and chew all your calcium, and your calcium goes down. So these are some of the most common lab work you see. High potassium, high nucleic acid, which turn into uric acid, high phosphorus, and low calcium. This is classic, classic tumor lysis syndrome. Some people will call it KUPC, right? KUPC. So potassium, uric acid, phosphorus, all of them goes up, right? And then your calcium go down. What is going to happen? In this lab work, they say, which lab is a priority? Well, potassium is not supposed to go down, it's supposed to go up. So this is wrong. Don't pick it because you see hypokalemia is bad. It does not meet the definition of tumor lysis syndrome. Hyperuricemia, I expect that. Hypocalcemia, I expect that. Normally, your sodium remain normal. But the question says priority. You have uric acid and hypocalcemia. Which one is dangerous? Uric acid will affect your kidney, but which one is going to kill you? Seizures and cardiac arrhythmia is very important regarding calcium. Therefore, I'm picking number 3. This is some of the test taking strategy you should be familiar with. Low calcium can cause tetany and seizures. It can lead to laryngeal spasm, airway obstruction. Therefore, that's our priority. 3 is our right answer. These are little things you have to pay attention to. Which nursing assessment is a priority? The same thing. A nurse is receiving doxorubicin. For all these questions, I'm not going to give you anything that you don't need. Just 1, 2 things you have to know about this medication. And then when you see it, that's what they're going to ask you. If they don't ask you, email at that NCLEX. Doxorubicin. What is the number 1 thing you have to know? If you watch this video and you don't remember anything about this is cardiotoxic. Because it's cardiotoxic, what do you think? Is it going to affect your heart rate? Do you check for lung sounds? Do you check for cardiac ejection fraction or blood glucose? Don't pick number 2 because it's a lung problem. Not everything is airway. It does not answer the question. If the answer choice does not answer the question, even though it look bad, don't pick it. Don't pick lung sound. Because the effect is a cardiotoxic, you have to know that your heart is going to be toxic. If your heart is toxic, it's not going to speed up. It's going to slow down. Therefore, cardiac ejection fraction is the best answer. So monitor ejection fraction before therapy. This is very important. The client receiving cyclophosphamide complain of hematuria. What should the nurse anticipate? These medication, there's one thing, if you don't know about it, is that symptoms the patient is complaining about. Blood in the urine. What should the nurse do? Hold the nurse dose, encourage fluid, give them furosemide, and teach low protein diet. One of the complications associated with cyclophosphamide is hemorrhagic cystitis. There's going to be blood in your bladder. What do you need to do? Wash it out. How do you wash it out? Not to give them laces. If you give them furosemide, they need fluid for the furosemide to work. If you don't have fluid in your system, furosemide is not going to work. Holding the next dose, you have not done anything. Patient have symptoms. At this point, you know the problem. Encourage fluid intake. That's the best way. So hemorrhagic cystitis, what you need to do, hydrate and notify the provider. So cyclo, see blood, hydrate yourself. That's the mnemonic. What is the priority next action? For a client with neutropenia from chemotherapy, neutropenia means your WBC is low. It's a sign of infection. Therefore, based on that buzzword, I need to prevent infection. Applying warm compression to IV site does not answer the question regarding neutropenia. Encouraging visitors is a bad idea because they will make the patient sick. We don't prevent them, but we want them to wear PPE when they come in to see the patient. Iron does not answer the question. Therefore, what is left? Number 4, place the client in a private room. I use some of these answer choice to tell you when the answer is obvious, don't pick something else that is distractive. Neutropenia is infection. Pick an answer choice that is infection. That's all. A nurse is caring for a client receiving what? Methotrexate. This medication, you have to know it because it's very common. Used as chemotherapy agent, it can also be used in rheumatology. Which adverse effects should the nurse anticipate? Methotrexate is a cancer drug. Therefore, you know that cancer drug, if you don't pick anything at all, something related to immunosuppression. I don't see immunosuppression, but all I see is what? Alopecia, peripheral neuropathy, hyperglycemia, and weight gain. There's no chemotherapy agent that make you gain weight. Only chemotherapy agent that make your glucose go up is steroid. Therefore, that one is out. We use steroid for other agents like lymphoma. Now you're left with 1 and 2. Peripheral neuropathy is specific for one chemotherapy agent, and we're going to see it. Alopecia is one thing you have to know about methotrexate because of the immunosuppression. And therefore, things you need to know, hair loss, MAF, SAW, right? And bone marrow suppression. There's additional one you have to know when you see it. Your liver function can get affected. It's also teratogenic, right? And therefore, pay attention with these side effects regarding methotrexate. It affects your liver, it's teratogenic, and bone marrow suppression, in addition to what? Hair loss and SAW MAF. Therefore, the right answer is alopecia. And this is caring for a client experiencing methotrexate toxicity. Question 7. What have you done so far? You've been watching this series. I know you got this pharmacology down. I hope you get 6 out of 6. Answer the question, just type, I'm ready. I'm ready to conquer NCLEX. Number 7. A nurse is caring for a client experiencing methotrexate toxicity. Which drug is given to prevent methotrexate toxicity should the nurse expect? This is a content level question. You know methotrexate side effect. There is a way we can prevent the side effect of methotrexate. There is a medication we give with methotrexate to decrease its activity. Do you think it's allopurinol? Do you think it's ondansetron? Do you think it's vigrastim? Do you think it's leucovoриum? Allopurinol is used for gout, right? You can also use it for tumor lysis syndrome. Ondansetron is used for what? There's a question you will see: nausea induced by chemotherapy. Vigrastim is used for what? Increase your WBC. We'll see a question like that. Leucovoриum is the drug that you can give together with methotrexate to decrease methotrexate toxicity. Don't forget leucovoриum. Therefore, leucovoриum rescue normal cells from methotrexate toxicity. That's the key answer. So leucovoриum is a lifesaver for methotrexate, and that is the mnemonic you should be aware of. The client receiving chemotherapy drug for breast cancer complain of what? Nausea, which drug is commonly given with chemotherapy to prevent nausea and vomiting. I already given you the answer. ondansetron, metoclopramide, lorazepam, diphenhydramine. Diphenhydramine is Benadryl. It's used for, and is an antihistamine, right? Allergy medication. Lorazepam is used for what? Anxiety. Metoclopramide and ondansetron are good for what? Nausea. But the one that is best for chemo-induced nausea and vomiting is what? Ondansetron, because of the serotonin antagonist effect of it. So that's the medication. And then it teaches a client taking what? Tamoxifen for breast cancer. Which statement indicate understanding. Tamoxifen is the drug used for breast cancer. Which one indicate correct understanding? I will stop taking it if I feel hot flashes. I will report calf pain or swelling immediately. I can take a pregnancy test later if I miss a dose. I can double my dose if I forget one. Test taking strategy content. You know breast cancer has estrogen and progesterone receptors. Therefore, if I'm giving you medication to treat breast cancer, that means it's going to block estrogen and progesterone receptors. In the process, a major complication associated with these medications is what? Clot. Therefore, clots are bad. You can get DVT, you can get PE, you can get stroke. Hot flashes is a common side effect of those medications because they block estrogen, right? They are teratogenic, so you can't talk about being pregnant. We don't want you to get pregnant. So 3 is a trap. I don't want you to get pregnant, so use something to prevent you from getting pregnant. Checking for pregnancy tests, no, we don't want you to do that. We don't want you to get pregnant anyway. You should not double the dose. So tamoxifen increases the risk of DVT and PE, and the key fact is this. If you want to remember, side effect of tamoxifen, the T, we call it TAMOS. T is thromboembolism. A, you should avoid it in pregnancy. M, you're going to have menopause-like symptoms. That's the hot flashes. You're going to have vision changes. And S, you should do extra monitoring so that you don't get pregnant. Now, a client is receiving chemotherapy, prescribed what? Filgrastim. Why? What is the purpose? I know you get this, 10 out of 10. Put down your answer. Let me know and tell me that you get this answer choice. What do you think? What is filgrastim used for? To increase your red blood cell, to increase your WBC, to increase your platelets, or to reduce alopecia? Number one, you know that is wrong because ipotine is responsible for increasing your RBC. The WBC is usually stimulated by filgrastim. Platelets, wrong. And we'll see an answer choice later on, a question related to that, why platelet is wrong. The medication, I will give it to you, is opraverkin. Opraverkin is the one that increases your platelet. Number 4 is wrong. Therefore, right answer is number 2. The client receiving cisplatin should have which lab monitored closely. Cisplatin is nephrotoxic. If it's nephrotoxic, what drug or lab work do you look for? Creatinine and BUN. Like I said, straightforward to the point. The client receiving allopurinol. Allopurinol during chemotherapy should be taught to do what? Allopurinol, think about it, we use it in gout, right? To prevent uric acid formation. Therefore, we want to prevent uric acid breakdown. In chemotherapy, when we give it to you, we have increase in what? Uric acid. The reason why we want you to take allopurinol is to prevent what? What do you think? At the same time, what kind of teaching would I provide you? Allopurinol is going to protect your kidney. If I'm going to protect your kidney, what would I do? Test taking strategy. Look at number 1. He said, avoid water intake. Number 2, he said, take with plenty of fluid. I'm not even looking at 3 and 4 anymore. I see 2 answers that are opposite each other. One of them is the right answer. Therefore, allopurinol prevents uric acid kidney damage from tumor lysis. what would you do? Increase your fluid intake. A nurse is caring for a client receiving chemotherapy drug via IV, which client teaching is best to prevent extravasation. Most chemotherapy agents are vesicant. They can cause necrosis of the skin. What is the best way to prevent extravasation? Do you check it more frequent? Do you apply ice if it become red or swollen? Or remove what? Or rub the IV site if it turn, if it or rub the IV site if it burn during chemotherapy, or remove the IV if you hurt a little bit. Think about it. Do you want to remove IV if you hurt a little bit? And do you want to teach the patient to do that? Which client teaching is best to prevent? You tell the patient, hey, put it up if you start hurting a little bit, or you tell the patient to rub it, or patient to apply ice, or check the IV site frequently during chemotherapy. Frequent checking is the best answer, so that before they start hurting, it's too late. So I want to check, make sure no changes before I can do that. So frequent monitoring is your best boy. What is the next best action? The best, okay, is the number one. A client receiving Vicrastin report what? Numbness and tingling in their fingers. Do you decrease the medication dose? Do you let the doctor know? Do you give the analgesic or apply warm compression? I've given you the side effect of what? Vincristine. That is the peripheral neuropathy medication that we saw. Vincristine is used for what? It's a chemotherapy agent, and the major side effect is numbness and tingliness. Question 14. If you see that, what would you do in that situation? Do you decrease the infusion rate? Let the doctor know, provide analgesic, or warm compression? What do you think? Of course, we're going to decrease the dose. That is the ultimate thing that is going to happen. But not right now. You are not the responsible. It's dose dependent. The presence of peripheral neuropathy is dose dependent. We got to decrease the dose. But that is not your job. I will talk to the doctor, and then he will decide what he want to do. Notify the provider. And the last one, a client receiving Vincristine report what? Epistaxis, right? Lab value shows 80,000 of platelet. Which prescription should the net anticipate? Ipotine, Filgrastim, Opravenkin, adalimumab, dipyridamole. Think about it. You should recognize all those medications. Platelet is low, having nosebleed. You know ipotine is used for red cell, it's gone. Filgrastim is used for what? WBC is gone. Opravenkin will increase your platelet, good. Adalimumab is immunosuppression. It does not affect your platelet. And the last one, dipyridamole, is what? Antiplatelet. It's going to worsen your platelet. Therefore, we only have one answer choice. 15 question. A client is prescribed what? Prednisone for what? Autoimmune disorder. Which statement indicate correct understanding? I should stop taking the drug if I feel better. I need to take this with food or milk. I can receive live vaccine while taking prednisone. I should expect my potassium level to go up. Stop the video. Put down your answer. I know you know it. Let me know what you think. First question, what do you think? The keyword, go for the buzzword. The buzzword is what? Patient is on prednisone. It's an autoimmune disease medication. I've given you a clue. It's immunosuppressant. And immunosuppressant, what do you think the patient is saying the right thing? I've underlined 3 keywords. This is NCLEX practice question, test taking strategy. 3 words alone I'm dealing with. I'm dealing with what? Prednisone and autoimmune. And correct understanding. Therefore, I have to look at the answer choice and say, are they saying something right? Stopping the medication when I feel better. I take it with food or some milk. I have to take live vaccine. It's going to what? Increase my potassium. Test taking strategy. Steroid or autoimmune diseases medication should never be stopped abruptly. Number 1 is wrong.
Take it with food or milk. I don't know, but I will leave it and see if there's any other choice that may be worse than what I'm hearing. Autoimmune medication, you should avoid live vaccine. That one is gone. You know, steroid is going to what? Increase your sodium. Steroid increases your sodium. That is why your blood pressure is high. Therefore, anything that increases your sodium automatically is going to decrease your potassium. There's a pharmacological thinking associated with it related to pharmacokinetics. I'm not going to go into details. The idea is any medication that increases your sodium, that's the buzzword, is going to decrease your potassium. Therefore, I know this is wrong. It's related to angiotensin system, but don't worry about it. Therefore, test-taking strategy, I know number 2 has to be right, but I have no clue whether I need to take it with food or milk. There's a reason why. Steroid will cause what? Ulceration. Therefore, you need to protect your GI tract. That's the reason why. And this is the way I'm going to break down each answer choice, and I'm going to give you keywords that you have to be able to remember them. So steroid should always be taken with food or milk to protect the GI tract. It causes hypokalemia, hyperglycemia, infection risks, and you should not take any live vaccine. That's number 1. Second question, which finding is most concerning? Prioritization. That means all the 4 are bad, but there's one that is going to kill the patient. That's all. That's what I'm dealing with. Therefore, I'm going to underline my buzzword, and I said, I'm worried about most. I know they are all concerning. All these are concerning, but which one is number 1? What is the problem? A transplant patient, immunocompromised. That's why they are immunological medication. And it's what? Cyclosporine. I've given you the clue, even if you don't know what cyclosporine is. I've told you that it's a transplant patient. It has to be immune medication. If this were isolated, it's not a video about immune drugs, immune pharmacology, something should ring in your ear and say, cyclosporine paired with transplant means it's an immune suppressive medication. Therefore, I'm worried about something that is going to kill the patient. I see gingival hyperplasia. I don't know. I see hirsutism. I have no clue. I see temperature 101.5. I say, oh, that's not good. I see tremor. Fine. But which one is the bad one? Every time you see a transplant patient, immune medication somebody is taking, and you hear about fever, you know something is not going right. Sepsis is the biggest thing we worry about this medication. They're going to have other signs and symptoms associated with the medication. Gingival hyperplasia is common with what? Cyclosporine. What is your treatment? Know this. You should be able to make videos about gingival hyperplasia in my questions and answers. And I talk about gingival hyperplasia. If you don't know the content, all they need to do is good hygiene, see a dentist, and then some antibiotic. It's not going to cure them. The hirsutism is related to the medication. Tremor, well, if I'm tremor, I'm not saying they're having seizures. Don't let that trap you. If I want you to worry about seizure, I will put it there. Infection is always a bad thing regarding immunosuppression. And never forget about it. Infection is the most dangerous complication about immunosuppressant like cyclosporine. Therefore, that's what I'm picking. Number 3. So what is the mnemonic? To be able to recognize cyclosporine, I want you to take your pen and paper. If you don't know this medication, use this. Any question they're going to ask you will be related to this mnemonic. It calls cyclosporine. C, be caution about infection. Y, Yankee jumps, which is what? Gingival hyperplasia. And then it can affect your creatinine, right? It can also affect your liver, that is the L. And O, other hair growth, that is what? Hirsutism. You see cyclo associated with cyclosporine, and that is the buzzword, that is the mnemonic. Write it down. If you're in nursing school preparing for your NCLEX, or you're already ready to take the NCLEX, this is the keyword. Every time you see cyclosporine, the key information is related to the cyclo. Number 3, and as she's teaching a client on long-term steroid, I'm trying to take you up and down, things we've talked about, but then I expand it. Now select and apply long-term corticosteroid therapy. I've already given you the content. You should be able to answer this question. This is the same thing we saw in question one. Which should be included in the teaching? The nurse is teaching the patient about corticosteroid. Which one should be included in the teaching? Monitor the what? Blood glucose, avoid crowds and sick people, stop the medication immediately if Cushing symptoms occur, take medication in the morning, expect delay in wound healing, report the black tarry stool. I've told you, you know the answer. I know you got it. Question one, answer this question completely. What do you think? Stop the video, put down your answer. But the key is select or apply in long-term corticosteroid. Select or apply. You don't need to pick all the 6 answers. Pick those that you are 100% confident. If you want to guess, be my guest. But I don't want you to guess because you don't know 100%. You're not going to lose the point if you get only 3. Therefore, if there's 3 answer choice there and you pick 3, you're good. I said, take steroid with milk or fluid because it affects your GI tract. Therefore, if I see a report black tarry stool, hey, you bleeding from ulceration. It's immunosuppressant. Immunosuppressant will affect wound healing. You take the medication in the morning. Even if you don't know, I'm going to leave it there for you. I'll come back. Stop the medication immediately. The word immediately changes everything. There is no immunosuppression. You should stop taking right away. If you develop Cushing symptoms, you should not stop it right away. Slowly, it has to be tapered, right? Avoid what? Crowds and sick people is good because you don't want to get infected. Monitor blood glucose level. It causes hyperglycemia. Why do you have to take it in the morning? Your body, when we wake up in the morning, our steroid goes up like that. Then it stays the same in the evening, then it comes down. So at night, our steroid is low. In the morning, it's high. Therefore, if you're taking steroid, you should mimic your body steroid production. You make more steroid in the morning. So you should take it in the morning so that your adrenal gland knows that you have steroid in place. So that's why this is the right answer. So what is the key concept I want you to know for each question? Corticosteroid suppresses your immune system, infection, raises glucose, hyperglycemia, it causes ulcer. You're going to have black tarry stool. You should take it with milk or fluid, and you should be tapered slowly. These are concepts you should know. Therefore, glucose monitoring, avoidance in contact, taking the medication in the morning, expecting delay in the wound healing, and report black tarry stool. These are concepts I want you to put it down in your note. So this is question 4. Which teaching should the nurse include? For a client taking cyclosporine, this is a selector that apply. We already talked about it, but I want to expand and give you more information. We already know the mnemonic associated with this medication. Monitor blood pressure. Should you do that? Report signs of infection. Avoid grapefruit juice. Monitor kidney and liver labs. And look, discontinuous if gum bleed. Take with St. John's wort. I've given you the mnemonic associated with the cyclosporine. And we talk about what? Cyclo. With the C, talking about caution about infection. I see infection there. I'm taking it. Why is the yonky gum? I'm seeing gum bleed, but it said discontinuous. You should not. It's expected finding. I see C is what? It's going to affect your creatinine, kidney function. You see, checking your lab for your kidney. And I see L is also your liver lab. I'm going to take care of it. And the O is citizen. But I had extra information for you to think critically. This is NCLEX practice question test taking strategy, giving you critical thinking information. Look at it. Monitor your blood pressure. If your kidney is in trouble, then we should monitor your blood pressure. Say grapefruit juice, it affects the liver in terms of metabolism of the medication. Therefore, it increases cyclosporine. St. John's wort also affect metabolism of the medication. It make it less effective. Therefore, these are little things additional. I've given you all the content regarding cyclosporine. And therefore, what do I say? Grapefruit juice increases drug level. Nephro and hepatic toxicity must be monitored associated with this medication. Therefore, what do you think? Blood pressure monitoring should be ensured. We should report infection. Therefore, grapefruit juice, monitor kidney and liver labs, and take it with St. John's wort. You should not take it with St. John's wort. Therefore, the right answer is what? Monitor the blood pressure, report signs of infection, avoid grapefruit juice, and monitor lab. You should not discontinue it. You should not take it with St. John's wort. These are concepts I want you to be aware of, and that's what shows up in the NCLEX. A client taking tacrolimus, developed lab work, WBC 2000. What is priority? I don't know what this medication is, tacrolimus. You don't have to worry about it. But for this video, I want you to know it's immunosuppressant. If it's immunosuppressant, it's making your white WBC 2000. That is too low. That is neutropenic. It's so low, your risk of infection is so increased. What do you want to do? Hold your drug and notify the provider. Encourage fluid intake, give it with food, continuous as prescribed. This patient is sick with very neutropenic situation. You should let the doctor know. So the WBC less than 4,000, severe infection, drug should be held. Why did I give you this simple question? Because that's what the NCLEX will ask you. They may not check the question the same way. They may imply that tacrolimus, you should worry about infection, which was the first thing I said when we start the video. This is another way telling you infection is bad. So number one is your right answer. This medication is to re-emphasize cyclosporine, tacrolimus, nephrotoxic, the immunosuppression, it causes infection. The client is prescribed what? Filgrastim after what? Chemotherapy. What is therapeutic effect? These are medications, like I told you, immune medication. They are straightforward if you know how to approach them, if you recognize them. Filgrastim, whenever you hear it, think about something related to your immune system. Think about something related to your immune system, but specifically your WBC. It increases the WBC. We increase your WBC when your WBC is low. And what medication we give it to you? Filgrastim. Therefore, this medication is what is responsible for. The easy way to remember this is this mnemonic. Okay, Philly is what? Neutrophils. The Philly is neutrophils. Filgrastim is going to increase your neutrophil. That's the mnemonic. And as is preparing to give infliximab, it's also an immunosuppressant. What are you going to do first? There is specific information about this medication. You don't have to memorize it. I want you to know it every time you see infliximab or adalimumab, these mAbs. Before we give it to you, there's one thing we do, not your glucose, not your CBC, not your potassium. What do we check? It's going to activate TB. It's going to activate hepatitis B status. And therefore, what are we going to check? We got to place this and make sure you don't have previous hepatitis B. Or if you have TB, what does that mean? If you've been exposed with the PPD, if you have PPD positivity and you're taking this medication, you're going to get full-blown what? Tuberculosis. NF blockers, which are infliximab and adalimumab, will reactivate latent TB or hepatitis B infection. Therefore, we screen them to prevent you from getting active full-blown B infection or tuberculosis. Therefore, B is the right answer. This is question here. What is your score so far? I know you're doing good. I know you get 7 out of 7, but this medication, I want you to know it from top to the bottom. From the top to the bottom. A nurse care for a female client with psoriasis prescribed what? Methotrexate for the first time. Which of the following teachings should the nurse include in discharge? This medication, you have to know it. The key word in the question is what? Even if you don't know anything about it. I told you the patient is on what? Patient has what? Psoriasis. Prescribe methotrexate. This should tell you this is immunosuppression. And therefore, what teaching should you include? Teaching about immunosuppression. This said use two forms of contraception to avoid pregnancy. Report mouth sore and bleeding gum. Your liver is going to get injured, and so we should get your liver enzyme. You should take some folic acid with it. You should get what? Nasal flu vaccine. You should stop the medication of nausea, and you should see ophthalmologist. Something should be ringing in your ear. Immunosuppression. What do you think? Put down your answer in the question and let me know. But I know you got it. I know you get this. Let's break this question down. Look at each answer choice. Select that apply. Don't pick everything. You watch, adapt, and place. You know how to approach this question. Stop drug if nausea develop, and immunosuppression should not be stopped. Therefore, this you know is wrong. It's an immunosuppression. Why would you get nasal flu? Nasal flu vaccine is what? Live vaccine. This is gone, right? Take folic acid supplement. What do you think? These will counteract the side effect of what? Methotrexate. It affects your liver, and therefore we should monitor your liver enzyme. Immunosuppression is going to give you a bleeding gum and a mouth sore, gingival hyperplasia in addition to immunosuppression. Let me know about it. It's a teratogenic. Therefore, I don't want you to get pregnant. That's why you have two forms of contraception, a barrier method and an oral medication. And number 7 is the trap. They're going to trap you with what? Hydroxychloroquine. You don't need to see ophthalmology because it does not affect your eye. It's hydroxychloroquine that affects your eye. So what is the concept? It's teratogenic. Watch about getting pregnant. Hepatotoxic. Check your lab work. Bone marrow suppression. You're going to have mouth sore and bleeding gum. Folate is going to help reduce these side effects. Therefore, pregnancy, right? We're going to check your enzymes. We're going to report sore. Take folic acid to avoid the side effect. But you should never, take nasal flu vaccine. You should not stop it if you're having nausea and you don't need to see ophthalmologist. Which of the following should the nurse include? Another select apply. A nurse is providing teaching to a parent of a child prescribe what? Epinephrine auto-injector. This should tell you epinephrine auto-injector has to be given IM. It's an IM medication. Do you inject in the mid-outer thigh? Can you inject it through your clothes? Should you massage the site after injection? Should you call 911 after injection? Should you store it in the refrigerator? Should you use it for mild allergic rhinitis? Break the question down. A bunch of information. Teaching is number 1. Prescribe what? Epinephrine. Something should be ringing in your ear that epinephrine is always used for what? Emergency. Therefore, why would you pick number 6? Tell me why you want to pick number 6. It's a mild allergic rhinitis. It's a trap. Epi is emergency. This is not emergency. How can you store this in a refrigerator? Think about it. Test-taking strategy. If you're working with it, most of the time, emergency medication is with you. The kid has it. You're working with it. In terms of emergency, mommy take it out of the bag and then inject it. Or if the child is old enough, can inject them themselves. You cannot store this in a refrigerator. You can't carry a refrigerator with you. Some of these answer choices, you should be able to think about it. An epi, which is an emergency medication, is an auto-injector. Basically, the patient is going to carry it. How can they refrigerate something like that? Negative. Why do you have to call 911? It's emergency. Do you want to massage a site for after IM injection? These are fundamentals you bring into this question. Oncology medication, the immunological medication. Therefore, I'm not doing that. It's an emergency. The needle can go through your cloth. It's acceptable. And you inject it in the outer aspect of the thigh because that's where you absorb it faster. But it's an IM medication. These concepts I want you to know. Usually for anaphylaxis, never refrigerated. It's stored at room temperature. That's the key. Therefore, you can inject it through your clothes. You can call 911. You can inject it in the outer thigh. Never massage the site after injection. You should never store it in the refrigerator. You store it in a room temperature, and you don't use it for mild allergic rhinitis. And it's for a client with what psoriasis, prescribe what hydroxychloroquine for the first time. This is what I was talking about. This is the content. They will confuse you with what methotrexate. And what did I say they're going to confuse you about? Is right there. Which statement indicate correct understanding? I should have regular eye exams. This drug work immediately. It increases my risk of TB. I can stop if I feel better. Immunosuppression, the theme we've been talking about so far, immunosuppression, infection, and don't stop it. Therefore, number 4 is wrong. It does not increase TB. The one that we talk about is adalimumab and infliximab. Those are the two, the MABs. This is not the MAB. Immunosuppression does not work right away. It takes some time. Therefore, hydroxychloroquine, never forget, you need to see ophthalmology because it can cause retinal problem. Therefore, number 1 is the right answer. Number 11, 5 more. I know you're going to get these 5 right. Let me know, what is your score? Type it. Tell me I'm ready. Neurological medication with this video. A client on what? Adalimumab report fever, chills, cough. What should the next do? What has been the theme so far? I'm telling you, immunological medication, there is certain questions you should expect. Immunological medication, document and recheck 1 hour. Tell the client this is expected, hold the dose and notify the provider, administer another dose. We've been talking about infection and don't stop the medication. It takes time to work. Therefore, what do you want to do? Let me know. Immunosuppressant, infection risks is life-threatening. I should let the doctor know before the patient dies. And nurse is caring for a client on what? Azothioprine, another immunosuppression medication, which lab value require priority monitoring in this client. You have to pay attention to that. This is very, very important. It requires a lot of thinking, but it's straightforward. You got it. If you've never seen it before, azothioprine. It's an immunosuppressant. It causes bone marrow suppression. It's going to decrease your WBC, it's going to decrease your platelet, it's going to decrease your white count. But the most important, as I've been talking about all along with immunosuppression, is what? WBC. It's more important than any of them. WBC is the most important, so watch for it. A client with chronic kidney disease is prescribed Ipotine. Ipotine is one of those medications you have to know in chemotherapy and immune system medication. We give it to patients to do what? Increase their WBC, increase their hemoglobin, increase their platelet, or their potassium. Who do we give it to? The question says, which lab value indicate Ipotine is effective? We saw a question about what we use for when we need to increase your WBC, which is what? The filgrastim. The platelet is called opraverkin. You know, we don't use this medication to increase the potassium. Therefore, it has to be hemoglobin. Ipotine increases your hemoglobin. Therefore, it stimulates RBC production. And that is the right answer. The client with what? Autoimmune disease is receiving immunoglobulin. Immunoglobulin are very powerful immune medication, right? They are infusions we give it to patients for specific reason. If you have severe infection, you have antibodies floating, we can use this immunoglobulin to help with that. But the major side effect is no mild fever and chills. It's no headache during infusion. It's no fatigue the next day. It's allergic reaction. Immune medications, especially medication for antibodies, they are immunoglobulins. The major side effect is what? Allergic reaction. Therefore, chest tightness and wheezing are number 1. And the last question. This is just to tie everything up. This is just to make everything perfect. And this is scheduled for MMR vaccine. Which condition require postponing? This is just everything together. You know that immune medication patients who's taking that medication, they have to be careful. They are immunocompromised. They should avoid live vaccine. What is the problem? MMRI is a live vaccine. Therefore, which condition will make you pause and stop the medication? Is it cold? Is it fever 99.2? Or they be on steroid for a long time? Or they have hepatitis media? What do you think? What do you think? IV hepatitis media, it's just basically you have a ear infection. You still can get your vaccination. You get cold symptoms, you can still get it. Your temperature 99.2, you can still get it. But if you're immunocompromised because you're on long-term prednisone, you should not get it. Live vaccine is bad. 15 questions. NCLEX practice question. Test taking strategy with rationale. This question, all these questions, I want you to stop the video. We're going to talk about concepts. It's a concept on every question. Stop the video, answer it on your own, and then listen to the way I'm going to approach it and write down the concept so that you can use it for every question. First question, a 5-month-old is prescribed ibuprofen for fever. Which instruction is most important for the parent? Give every 4 hours around the clock. Call the provider to confirm the prescription. Administer on an empty stomach. Alternate with what? Aspirin for better fever control. What do you think? Stop it. Put it in the comment. Let me know your answer. For the first question, I trust you're going to answer this question based on concept. And what is the concept is what? How do you answer question? Ibuprofen. That is the key. And 5 months old, connect the dot. Why did I give you 5 months old and ibuprofen? There's a concept associated with it. How do you answer it? Anybody less than 6 months should not get ibuprofen. That's all. Therefore, the most important information the nurse should provide to the parent is give every 4 hours around the clock. I don't think so. The kid is 5 months. Call the provider to confirm the prescription. That is a better choice. Administer on an empty stomach. Ibuprofen should be taken with the fluid. Alternate with aspirin for better fever control. You know aspirin is not good for kids. The best medication is acetaminophen. The concept here, ibuprofen should never be given to a kid less than 6 months. And like I said, all the questions are going to be like this, where I give you the concept. And so that when you see a question, you can apply it without memorizing the question. Ibuprofen should never be given to infant under 6 months. This is a key because their kidney is not developed. First choice, number 2. Which teaching is correct? This you have to know. This, please know it because it's very, very important. Cystic fibrosis patient. Nurse care for a child with what? Cystic fibrosis prescribed pancreatic enzyme. What is the concept? Cystic fibrosis patient, they need pancreatic enzymes because the pancreas does not work. It cannot secrete due to being blocked by the mucoid secretion in the duct. Selected apply. Don't pick everything. Pick those that you're 100% confident using the concept. Therefore, what is number 1 going to say? I'm going to show you what you should pay attention to. Each question, try to analyze it. What is your answer? Put down in the comments. I would like to know. Stop the video and answer it. Let the child chew the enzyme with meals and snack. Give on an empty stomach before meal. Give only if the child ate fatty food. Sprinkle it on applesauce for the child to swallow. Mix it with hot liquid for absorption. Sprinkle it on milk or hot milk for child to swallow. What do you think? I know you get it, but you have to use the concept. It's a selected apply. All the answers sound the same, but there's a way you can answer it. The key, once again, the key, this medication comes as a capsule. Therefore, you should not chew it. You should not crush it. You should swallow it. At the same time, if you want to open it, you can open it and sprinkle it on food, but the food has to be acid. And then you got to swallow it right away with the food. And the answer choice provided, let the child chew, is wrong. You can't chew it. Empty stomach is not good because you need the food to eat with it. Give only if the child eat fatty food. Is not right. Sprinkle it in applesauce. Applesauce is an acid, and then swallow it. This much is better. Mix it with hot water. No, you can't do that. You will destroy it. Sprinkle it on milk. Milk is a base, and this is also hot. You can't put it together. So acid food can be sprinkled on it, and then you take it right away. So there's only one answer choice here. If you pick more, you get 0. But the key is to use the concept to look at it. This is the hard question. As we go through the case, there's going to be harder and harder and harder. Some will be a little bit easy, but that is the purpose of the test. So stick around so that you can see those variations of those questions. Number 3, an excuse for a child prescribed amoxicillin, which instruction should be given to the parent. Stop the medication once the fever subsides. Discard the liquid suspension after 14 days. Give with fruit juice to improve absorption. Double the next dose if one is mixed. That is the concept. Like I said, each question, this is NCLEX Pharmacology using pediatric pharmacology review, NCLEX practice questions and answers. What is the problem? Why do I give you amoxicillin? And I say you're giving it to a child. It's an antibiotic. It should be taken what? Based on the prescription. So you should not stop it when the fever subsides. I know you never selected that answer choice. There's a temptation. You're going to put fruit juice. Fruit juice rather make it worse. It tastes really bad with fruit juice. You should know this. Don't give it to them. You should never double the dose if one is mixed. Continue with the prescription given. The key is this. After 14 days, the suspension doesn't work anymore. There's a risk that the parents will continue to give it to them. But at 14 days, the medication doesn't work. The suspension needs to be discarded. Therefore, the right answer is number 2. But that is the concept. Amoxicillin suspension should be discarded after 14 days. And therefore, you should never use it after that time. And that's the right answer. And this is the way you approach the question. Every question, like I say, is a concept. This one is a little bit busy. It's usually those calculations, but don't worry. There's a lot of ways there. It's just straightforward. Adapt NCLEX got you. Take your pen and paper and see the way I can approach it. Those calculations. If you need more, I have a bunch of those calculations on Adapt NCLEX. Which action should the nurse take? So what would you do? A nurse prepared to administer acetaminophen to a child. They give you the weight, 20 kilos for fever. The provider prescribed 250 ml every 8 hours. They give you the safe dose, 10 to 15 milligrams per kilo per dose. That is the safe dose. What does the safe dose mean? How do you answer this kind of question? Underlining. The safe dose means if you have to give the kid, this is the maximum and the minimum you can give it. This is the minimum and this is the maximum, every dose. Therefore, to approach this question, to know, prescribe 250 milligrams every 6 hours, you have to know if the 250 is within this safe range. How do you do that? This means what? 10 to 15 milligrams per kilo per dose. That means every kilogram of the kid, you can give them 10 to 15 milligrams of the acetaminophen. Therefore, if I weigh 20, then you should multiply the 10 by 20, which is what? 200. And the 15 by 20, which is what? 300. Therefore, the safe dose, as you can see, is 200 to 300 milligrams every 6 hours, whatever time was the frequency. Prescribed medication was 250. This is within the safe dose. Therefore, the nurse should not hold the medication. The nurse should not reduce it to the lowest dose. The nurse should not increase it to the highest dose. The nurse should give as prescribed. Calculation of safe dose. If you need more, check the Adapt NCLEX. But this is the way we can calculate safe dose prescription. What is your answer? 4 questions. I know you get 4 out of 4. If you don't remember the safe dose, those are the key. This question tests your knowledge, test-taking strategy, and critical thinking. A nurse is administering a medication that is metabolized primarily by the liver. That is the reason why I said by the liver. How do you answer questions? Go for the buzzword. What is the buzzword? By the liver. That means that medication will be metabolized by the liver. In which client should the nurse monitor most closely for adverse reaction? That means you have a bunch of kids and the medication they're going to take is related to the liver. If your liver is not good, you can't use it. Who will you monitor closely? It's straightforward, but requires some critical thinking. Is it 3 months old, 5 months old, 7 months old, 15 months old? Stop the video. I want to know your answer. I know you got it because you watch Adapting Class. Put down your answer in the comment section. I would like to know your answer. But this is the key. The liver is immature in kids, less than 6 months. After 6 months, it starts to pick up with maturity. Therefore, who we need to monitor closely? It has to be somebody who is 3 months old. 5 months is also bad, but prioritization, 3 months is the best answer choice we have. And is administered phenytoin to a child with seizures, which finding require priority intervention. Gingival hyperplasia, double vision, skin rash, mild drowsiness. What do you think? I want you to stop the video and let me know. Adapting Class want you know what you pick for this answer, because this is always a good medication to know for adult and pediatric. We're focusing on pediatric pharmacology, NCLEX practice questions, NCLEX questions and answers using this key concept. Phenytoin is an anti-seizure medication. We give it to kids and adults. Both of them can have seizures. There is certain side effects you're supposed to know. It's a sulfur drug. That's number 1. 2, it has a common side effect. Number 2, and that is what? Gingival hyperplasia, double vision, mild drowsiness. You can get rash. There's 2 types of rash, photosensitivity and Stevens-Johnson syndrome. Which one will you prioritize? You don't know what the rash is. What? I never tell you they went out to the sun and get a rash. That is photosensitivity. Therefore, the right answer is number 3. It may be Stevens-Johnson syndrome. That is sepsis. We got to intervene. First thing. How do you treat gingival hyperplasia? Oral care and antibiotics. It's not a priority. A nurse is preparing to administer medication to a newborn. Which intervention is most important to minimize the risk of drug toxicity? This is the same question we saw. This is the same question we saw 2 questions before. Number 5, newborn. I'm going to give you medication. Which one I should prioritize to minimize toxicity? That means I'm giving a medication to a newborn. What should I do to prevent the newborn from getting sick from it? Shorten the interval between the medication dose, monitor the newborn urine output and kidney function, double check the dose with another nurse before giving, give the medication by the safest route. What do you think? This is critical thinking. I give you the answer already previously. A newborn, what is the key aspect when it comes to safe medication administration? This is the safe medication administration question. What do you think? A newborn, do you shorten? That means you give them more medication in a very short time? Or you monitor their urine output in their kidney? Do you verify the medication with the nurse before you give it? Or you give it through the fastest so they can get to their system quickly? The concept that we talk about, like I said, I gave you the concept in the previous question. That newborn, their kidney and their liver is not matured. Therefore, if it's not matured, before you give them a medication, you got to make sure the kidney is functioning and the liver is also functioning by checking those enzymes. Secondly, if you give them the medication in the shortest time, they can clear it out of the system. The liver and the kidney is responsible for getting drugs out of your system. If they are not matured, you're going to become toxic regarding the medication. Shortening the interval is a bad idea. Checking with another nurse, I know some people will pick it. It's not the wrong answer. But in this prioritization question, I said the most important. This is why prioritization can be difficult, but you got to use strategy and say, think about it. Do I check with the nurse? That means you're okay with their kidney function and liver function not being good. That means you shouldn't pick it. checking with the nurse is a normal practice. But monitoring their urine output and kidney function before you give them the medication is the most important. Safest route, defeat the purpose that they cannot clear it. You want to give it to them so that they can get it slowly. What do you think is the right answer? I know you got it. Number 2 is the right answer. And nurse is perfect. A nurse is reinforcing teaching to parent of a child prescribed metafenidate for ADHD. Which instruction is the most important? If you're taking the NCLEX today or in a nursing school, I want you to know this medication for ADHD, metafenidate. It's a high-yield key medication that showed up, keep on showing up, whether you like it or not, because the kids, a lot of kids are on this medication. You have to know how to teach the parent. What is metafenidate? Which instruction is most important? Give at bedtime for best effect. Expect sedation as a common effect. Limit fluid while on the drug. Monitor weight and appetite regularly. This is a medication that is very high yield. What do you think? Metafenidate is a stimulant. That's the key word and the buzzword and the concept. A stimulant should never be given at bedtime. You're not going to sleep. A stimulant cannot sedate you. You will need some fluid. Therefore, by elimination, weight and appetite, a stimulant always suppresses your appetite. Since it suppresses your appetite, you're not going to eat. And therefore, that is the key. Growth retardation is the key regarding metafenidate. So we need to know so that we can monitor that. That's the best thing the nurse can teach. A 5-year-old with asthma is prescribed Abodro inhaler. Which side effects should the nurse teach the parent to expect? Bradycardia, hyperkalemia, tremor, hypoglycemia. This is a trap question. There are bad problem answers there. You see bad answers over there. There is likelihood that you get trapped by one of them. Go for the buzzword. The buzzword in the question is what? Abodro. Abodro is what? Beta agonist. What does beta agonist do? It speed things up. So things goes up, except your potassium. Therefore, if things are going to go up, it's a beta agonist. It's like I've given you epinephrine. You're not going to be bradycardia. It's going to cause hypokalemia. It will lead to tremor, and you make your sugar goes up. You see how I approach it. This is test-taking strategy pharmacology using concept regarding Abodro, which is a respiratory drug. And based on that, you can see that the answer choice look like tremor, but the other ones are all traps. Therefore, don't pick it. Number 10, a child with sickle cell is prescribed morphine. Which nursing action is most important? Monitor respiratory status, encourage fluids, monitor urine output, assess for constipation. What do you think? Based on what I've given you, which of this is very, very important? Which of this you should monitor? Which of this you think is very important? Morphine, what does morphine do? It decreases your respiratory drive, and therefore it's a downer. If it is a downer, then what are you going to do? A downer, you need to monitor the kid's respiratory status. Encourage fluid intake is okay because you prevent constipation. Monitor urine output, yes, because you lower your urine output. It causes urinary retention. So you're going to assess constipation. But the most important thing you should do is checking for your respiratory status. And this is the way you can know the thing, but sometimes you got to apply it. Number 11, a toddler ingests iron supplement accidentally. Which intervention should the nurse anticipate? What do you think? Number 11. We are 5 questions away. 10 questions pass. What was your answer? I would like to know. Let me know your score. Put your score down. Toddler ingests iron supplement accidentally. Which intervention should the nurse anticipate? Every time you're looking for questions regarding pediatric accidental injection, always go for the buzzword. Iron, accidentally, intervention. What would you do? Don't pick lavage. Never pick lavage. Never pick lavage. It's outdated. It causes more aspiration and the kid's in trouble. If there's activated charcoal there, you got to make sure it's within 1 hour. Therefore, based on that, 1 is gone. 3, 4, and 2, 3, and 4. What do you think? Administer what? The furosemide, which is an antidote. IV calcium gluconate, which is also an antidote. Hemodialysis, which is also treatment for something. Hemodialysis take a long time. There's taking strategy. Don't pick number 4. There's no need you should. It's a what? Anticipate. The nurse should do it right now. Accidental injection, we got to do something right now. You're left with 2 and 3. Calcium gluconate is not used for iron. Therefore, number 2 is your right answer. This is the key. All the questions that you see, I'm using the same strategy. This is the question. I want you to write it down. It's a test-taking strategy. Everybody knows this about the digoxin, but there's the way they can frame the question, you can get it wrong. This is test-taking strategy. Write this down. And next, administer the digoxin to a 3-year-old. The medication is already given. Which finding require immediate intervention? That means something is killing the patient. We got to stop now. Vomiting, bradycardia, fatigue, anorexia. If you watch some of my video, I've told you the digoxin, the number 1 toxicity sign is a sign. Number 1 sign you should be looking for when the patient is digoxin is GI symptoms. But after that, when the toxicity already occurred, then you look at other conditions. The bad one is your heart. That is the way to approach it. At the same time, I have vomiting and anorexia. That tells you there's 2 GI problems. It should never be your answer choice. 1 and 4 should never be your answer choice because they are the same GI symptoms. Now you're left with brady and fatigue. I will choose bradycardia. And this is the way I explain it. Bradycardia, it means the medication has already finished you already. Now, that is the red flag. If you don't do anything, you're going to die. The yellow sign means, which is GI. When you see it, you should not wait until you get to red. And how do you know? They are asking you about getting to red. Immediate intervention. If I see bradycardia, the kid is dead. Therefore, I pick that one. This is a follow-up. And look at the way the question is framed. A nurse is caring for a 3-year-old child receiving digoxin for heart failure. The same thing. Which finding should the nurse recognize as a sign of toxicity? The sign of toxicity, they're looking for early sign. That means this is a sign of toxicity. When you have bradycardia, it's not a sign of toxicity anymore. The medication has damaged you. But when I see GI symptoms, I know this is the beginning. Your body is telling you yellow flag is flagging, is flagging. Same thing. I see bradycardia and heart block is the same thing. I'm not going to pick the 2. Fatigue, therefore vomiting. And you see the way I approach them, they are the same question, but the answers are different. GI symptoms are first signs of toxicity. Therefore, the sign of toxicity in this situation, I'm going for the GI symptoms. 2 more. And then it's prepared to give an IM medication to a 2-month-old. Know this, know this, know this, because they ask all the time. They will give you a diagram and you have to point it. Or they will ask you, what is the name of the location? IM medication on the kid less than 6 months. There's a specific location, which I know you know, which I know you know. If you need, I have a lot of paid videos that you can watch it on my website, on my channel. Which side is appropriate? Deltoid, they don't have a lot of shoulder. Ventral gluteal, their gluteus is not that big. The thigh is the safest. There's less nerve, there's less vessel. Therefore, I'm going to vastus lateralis, less than 12 months. This is it at the lateral portion of the thigh. This is adducting class. 1 more question. Number 15, last question. English practice question, focusing on pediatric pharmacology, using expert answers and explanation. Child is prescribed with aspirin for Kawasaki disease. Yes, we give you aspirin for Kawasaki disease because we want to prevent cardiac issue. Therefore, what complication should the nurse be concerned about? Aspirin, does it cause bleeding, cause constipation, drowsiness, allergic rash, or Ray's syndrome? What do you think? Put down your answer in the comment and let me know your score, 15 out of 15. But you know, aspirin is antiplatelet. There's going to be some bleeding. There's no constipation associated with it. There's no drowsiness associated with it. There's no allergic reaction you should be concerned about. Ray's syndrome is very important. Kawasaki is a UR symptoms. You should never give them aspirin. But why do we give them aspirin then? You don't want the kid to have cardiac aneurysm or die from MI. Ray's syndrome, the parent can watch them. Therefore, those are the things that they should be concerned about. 15th question, NCLEX practice question based on pediatric pharmacology.